issues around who was getting tested and who had access to testing. So it's not that we aren't giving you data that we already have, it's that we're looking really hard to get that data ourselves. We have a lot of incomplete reporting, and it's been a challenge. So we need to go back now and do some medical record reviews so that we can actually get more accurate information. In terms of the mortality data, it was also pretty incomplete around race and ethnicity. So we're trying to pull all of the death records so that we can actually see if we can get better information off of the death records. But, you know, my promise to you is as soon as we have that information and we analyze it, it'll be available for everyone. You know, we care just as much as everyone about making sure that we address head-on any issues around disproportionality. And we are worried, based on data that's been shown disproportionality in other places. We're also very much aware that African Americans in particular, Native Hawaiians, Native Alaskans, Native Americans in LA County have a disproportionate burden of illness going into a pandemic. They are much more likely to have higher rates of almost every illness that we collect information on. And as I've noted before, having serious underlying health conditions makes you at much higher risk for serious illness and even death from COVID-19. So we want to do everything we can to both understand the data, make sure that our communities have access to all the information that we have about any inequities, and then that we work together to try to minimize inequitable distributions of any disease and certainly of deaths. Take the next question.
Yes, our next question will come from the line of David Rosenfeld with LA Daily News.
Hi, how are you? Thank you. I was wondering real quickly, you know, the numbers over the last few days, the number of new cases has come down slightly. I wonder if that should be any indication that the curve is flattening, or if there's anything else that you can offer that would explain that. Perhaps are there less tests happening over the weekend?
Yes, exactly. So you hit it. Yes, there are less tests happening over the weekend. So we'll look to tomorrow and Wednesday's numbers, and that will be a much better indication. We actually had very high numbers on Saturday, so I don't see that our numbers are necessarily dropping already. I would anticipate, as I noted earlier, that we're going to see a lot more cases this week and next. But thanks for the hopeful note there. But it is really an issue around lab testing. We'll take our next question, which is our last question.
Okay, our last question will come from the line of Dave Lopez with Channel 9 News. Please go ahead.
Yes, good afternoon. My question was asked previously about the number of the drop, doctor, but back to the modeling that you said you were working on. Is there any indication, and again, I know we're looking into the crystal ball, and I feel like a parrot asking it over and over again, but does your model show you when this real heavy apex will hit in the LA area?
So Dr. Galley has been working with a team from DHS, a team from DPH, and some folks at UCLA on some modeling strategies that we can use to predict what might happen in the future here in LA County. And I believe I'm going to just ask her to speak about sort of when we're going to be able to release that information so that you'll all have access to that modeling data as well.
Hi, so we're working on this model that's been mentioned, and we hope to have data that's able to be released by the end of this week. I think it's important to keep in context what the model can and can't do. So what the model will never be able to do is exactly predict a peak. It will paint through a range of potential scenarios, a band in which we might anticipate that there would be a peak, but then that model is continually updated with the data from the previous day on testing, hospitalization rates, so that we can determine which point on the curve in which of those scenarios we are closest to. And then the actions that people take on a given day obviously have an impact on what that model shows in the weeks to come. So if people get tired of social distancing or physical distancing, or they see the bed numbers that are still really open and available and they think, oh, this isn't concerning, or they see potentially case numbers come down, as was just mentioned, even if there's various reasons for that, and they think, I don't need to stay home, that will have an impact on the model results that we'll see 2 weeks from now and push us up on a curve, again, that has a slope up to increasing impact on bed demand, ICU rates, and ventilator rates. It's also important to keep in mind that really the goal of those physical distancing measures and the goal of all of the public health efforts in general is to not just lower the peak, but also spread out the peak. So in a classic epidemiologic model like this, you'll have a very sharp spike where you have the peak, all of the bed demand is in a very narrow range. One day you're very full, the next day it starts to go down. The goal of the efforts that have been put into place by public health entities are really focused at lowering that overall curve and critically spreading out the curve so that you don't have a single point in time peak, but what you have is bed demand spread out over weeks that would remain kind of broad and flat for a period of time and then proceed to decline. This concludes our press conference. Thank you, everybody.
Ladies and gentlemen, that does conclude your conference for today. Thank you for your participation and for using AT&T conferencing service. You may now disconnect.
And we continue to bring you the very latest here on News Now and coronavirusnow.com live look at the White House. We are just moments away now from President Trump and the rest of the coronavirus White House task force to do their daily briefing in the briefing room. That'll be happening in just 10 minutes. We know these things go a little bit late, and sometimes they don't start right on time, so we'll have it always in double box for you so you don't miss anything right here on News Now, everybody. Let's continue to keep you in California.
Away from congregate sites entirely and moving towards hotel rooms. So to this end, we are now shifting gears at Moscone West, and rather than that being a shelter to achieve the reduced population in our homeless shelter system, that will instead serve as a shelter environment for individuals who have either tested negative for COVID-19 or who are considered post-COVID or have cleared the 14 days and are no longer COVID positive. This will be staffed by the appropriate medical and social work staff. The population will be reduced from a total of 394 down to 200. The shelter will be partitioned off into 4 areas of 50 patients each, and each individual will have their own partition, creating that necessary physical distance as well as a wall or partition to create additional privacy. This will help us really provide a relief valve on the back end of our system, allowing individuals who were quarantined in hotel rooms to exit out after having been, again, tested and tested negative, to allow for those rooms then to be activated for additional people who need to be quarantined. It will also help our hospital system for homeless individuals who may be in that system for a non-COVID related illness. Those individuals also will have been cleared by the hospital and could choose to go to that shelter as well. We still have the imperative, however, of reducing the populations in our existing shelter system. The plan moving forward now is to achieve this reduction through placement into hotel rooms exclusively. We will continue to focus on the population in our shelters, individuals age 60 and above, as well as individuals who have underlying health conditions that make them more vulnerable to COVID. The current estimate of the number of rooms in order to achieve that reduction in shelter census is 500, which brings me to the data on the hotel rooms that we have brought forth up to the present. We currently have 945 rooms in 8 hotels across the city to be able to receive individuals who either need to be quarantined or isolated, or individuals who are going to be moved from the shelter system in order to reduce the population, or moved from the street. The individuals who are moving from the street, again, per the CDC guidelines, per the FEMA reimbursement guidelines, would be individuals who are over age 60 or individuals who have underlying health conditions that make them vulnerable or more vulnerable to the COVID-19 virus. We continue to move individuals as we speak. So far, we have moved or admitted over 150 individuals into these rooms, with another 40 vulnerable adults being moved from the shelter system today. We will continue to do two things. One is continue to move individuals from the shelter system and then the street into these rooms, but we also continue to work with hotel owners and negotiate further contracts to bring additional rooms online. Again, when we started this 4 weeks ago, based on the best guidance from the CDC and from our partners at the State Department of Health, as well as the Department of Public Health here in San Francisco, our target was 3,500 hotel rooms and 2,500 shelter beds. Based on the best information, evidence, and data we have now, we're looking at more like 4,500 hotel rooms, and the shelters that we had planned to activate to create thinning are now no longer going to be used for that purpose. Moving forward, we are working with our public health partners to identify potentially smaller congregate sites to serve as medically based shelters, and this would be for individuals who are vulnerable or older and need extra support that cannot be provided within the confines of a hotel room. The lead on our movement out of the shelter system into hotels, as well as the identification of vulnerable individuals on the street and moving into hotels, is led by the Department of Homelessness and Supportive Housing. The director of that department, Abigail Stewart-Kahn, is here to talk about how we're going to achieve that reduction in our shelters and on the streets, as well as to talk to you about our system response to the COVID positive identification at Division Circle Navigation Center, as well as at our MSC South homeless shelter. So Abigail Stewart-Kahn.
Thank you, Director.
Just whenever you want. You could, may know in fact, be like, sure, just respond. Or you can go, usually the White House gets usually about what Amazon, the public Amazon. If you want to swallow center for a second, you can be ready to bunch of stuff, and somebody else will swallow out, and they'll take questions, nice animation.
Great. How are you?
Brent, when does it get fluid? Huh? When does it get fluid?
At any point that you want to look at one of the other drivers and say, hey.
Oh, okay. So there's not like a set time or anything?
No.
Thank you.
Sure. And if you get stuck and like don't and want to move but can't find the stop, just go back
right there.
Welcome everyone to this special KTVU Digital Town Hall on coronavirus. I'm Greg Lee, joined by mayors from 3 major Bay Area cities, San Francisco, Oakland, and San Jose, here to talk about each of their cities' response to the pandemic. I want to thank you all for being here. I know you've all had very busy schedules. I want to take you back to March 16th. 6 Bay Area counties announced shelter-in-place orders. All of your cities were part of that. At the time, considered some of the strictest in the nation, but many have since followed suit. Mayor Liccardo, Santa Clara County has the highest number of cases, unfortunately, the highest number of deaths right now. But it was also Dr. Sarah Cody, your county health officer, who was really on the forefront of this. Can you talk about the early discussions to take immediate action?
Well, we had been having conversations, certainly with the county, about a whole host of measures, including shutting down a lot of public events. And as you know, this is really a county decision, but I've been very forthright about the need to act quickly and to ensure that we're not making mistakes, erring toward being too late. We know that these are very severe restrictions that are being imposed, but they do no good if they're imposed 2 or 3 weeks down the road. So moving in really at the speed of this virus is so critically important.
Mayor Breed, what does it mean to know in hindsight that the Bay Area was really one of the leaders in this?
Well, it means that we're saving lives. And I think ultimately that was our goal. It was, of course, a hard decision to make and a hard decision to explain to people why we were putting them in a situation where we were asking them to stay at home, especially people who they are hairdressers or barbershops, nails, and others who this is how they make a living. And it was definitely a very hard decision to make, but it was necessary. We had to do what was in the best interest of public health. And that has been the guiding principle for me as a mayor here in San Francisco, because as hard as these decisions are, we are fortunate in that we have incredible public health experts who provide us with guidance on what is going to happen and what is the best way to address it to really save lives. And I think we've taken the steps to implement the right approach, and people for the most part are complying. It's been very challenging, but we're going to get through this. And it's hard right now. It's going to get even worse, as we have heard, in terms of people who are going to be diagnosed and who are going to sadly pass away as a result of this. And what we are trying to ensure is that we reduce that number as much as possible. And this is why these steps, these very difficult steps that we're taking, are necessary.
Mayor Schaaf, we're just starting to see some very early evidence that these orders are effective mitigation, and the orders have just been extended with new guidance for some of these face coverings and masks. How hopeful are you that we will see positive results because of this?
You know, I'm very hopeful, and I know that we all watch the numbers every day. And, you know, for example, the graph that the governor's office released recently really illustrated just how powerful this shelter in place has been. When you look at the rate of infection that would have happened without a shelter in place, it is staggering. And so as we see the numbers kind of steady, we obviously are seeing increases. We know that we are not at the peak yet, but we do have very clear evidence that suggests that what we have done has saved lives, has bought time for our health system to get ready for the surge, and also has bought time for the continuation of research, for improving the testing capacity, which has been a huge frustration for all of us, and also to start developing the ability to determine whether people are developing the antibodies, the herd immunity, as they say. So all of this time that we're buying is going to make so much of a difference. And I, for one, and I know that in our nightly calls, the big 13 mayors had calls literally every single night during the initial weeks of this crisis. And we were concerned that the counties weren't being aggressive enough. And so while that shelter in place was the first, and it felt like it came very quickly, I think we all welcomed it. We would much rather be criticized for being too aggressive to save lives than for not having done everything we could to reduce suffering.
Mayor Arreguin, thanks for meeting us in this call. All of us kind of continue to adapt to this situation, and we're still kind of seeing people defying that order. We heard Mayor Breed talk about that a little bit. What is the message to your community as we step up these orders and enforcement in some cases?
I think the message to our communities, please shelter at home. You're doing this not only to protect your family, but also protect your community. And in the city of Berkeley, we've had a great success in our residents complying with the shelter-in-place order. It's obviously creating difficulty for people. Clearly, the impact on our businesses has been significant. And I know many of us have launched relief funds, which are providing financial assistance to small businesses and nonprofits to keep them in business and to ensure that they can get through this crisis. But really the most important thing you can do to help stop the spread of this virus is to stay at home. And while it may be an inconvenience, it is essential. And we are having an effect in helping flatten the curve in California because we're not only out there first in issuing these shelter-in-place orders. Many other states have followed California and the Bay Area's lead, but it is having an impact in reducing the spread.
As you all know, this has certainly been a local, state, and national effort. Mayor Liccardo, you and I have talked a lot about the need for more testing, and there's a huge backlog in our state. Mayor Schaaf spoke about that a little bit. But how do we go about making a dent in that, and what needs to happen to ensure that not only are those tests happening, but they're getting processed?
Well, I think we really need to see the federal government step up in a big way and commandeer a process to ensure that we can scale testing at a national level so that we have the millions of tests that we're going to need to be able to do the identification, the contact tracing, the isolation, the quarantining that communities throughout the world have been able to successfully implement to contain the spread, whether it's Taiwan or Singapore or other places. We know what works. And the alternative is that we keep our economy shut down. And we know that's impoverishing millions of our residents. So we critically have to ramp up. And I know private sector is really ready and willing to step up. We need national leadership, and that requires the federal level the ability to use the law that's available, that's been made available since the Korean War, to commandeer private sector resources, to put those resources against this problem.
Mayor Schaaf, nurses and doctors and first responders are working around the clock. We're hearing some cases about nurses creating protective equipment out of trash bags. Are you getting the help to get these first responders what they need to continue to battle this virus?
You know, I want to echo what Mayor Liccardo said, which is the federal government has not done what it could do to actually consolidate the purchase of protective equipment. We all now have a new vocabulary word, PPE, which is the masks, the gowns, the face shields that our caretakers need to stay safe themselves. And if we aren't taking care of our caretakers, we are all in trouble. We know that there is a limited number of people that are trained to handle this health crisis. If they are sick and removed from the workforce, that will have a cascading effect, and we've got to be aware of that. I can say that in Oakland, not only have we, and I know all the cities have scrambled, engaging in our own direct purchasing of protective equipment for our first responders. Remember, it's our workers that answer those 911 calls, that go out to the medical calls. And that has been crazy. It could have been avoided if the federal government had done what it should have done. They still haven't enacted the powers that they have. And so here we are competing against one another for PPE. Now, I will say in Oakland, I'm very proud that we've had the private sector step up to fund and stand up the first kind of city-run testing site. We began by providing testing for our first responders. We've expanded that to first responders in our neighboring cities, including Berkeley. You're welcome, Jesse. And now, starting next week, we will be extending that to other critical service providers, anyone in healthcare, even grocery store workers, any organization that is providing a critical, essential service and caretaking. We are now going to extend our testing sites to those employees. But it is ridiculous that a local government has had to do this by relying on the charity of great partners like we have in our city. Brown and Tolan Physicians led this effort with tremendous support from Blue Shield of California. But it did not have to be this way. It should never be this way again.
Mayor Breed, I want to move to the issue of protecting the homeless community. The city reported its first case of COVID-19 at a navigation center yesterday. You also opened up the Moscone Center for some of that homeless community to prevent the spread. How important is it to protect the most vulnerable? And how plausible is it to put many of these homeless people into hotel rooms in the city?
I think that it's definitely important to protect the most vulnerable, and that's exactly what we're doing. You know, it is a process, and I think that people have to also understand that, for example, Moscone West, where we're going to have basically almost 400 beds open, we were delayed by an additional day because of our inability to completely staff the shelter beds that we have available. This is not just something that we can do. We have to protect the people who are actually working with the population as well, and we have to make sure that we have the capacity. We are expanding our capacity like never before, in addition to getting access to these hotel rooms. Because, for example, when we take patients out of the hospital beds, which is our priority, those who are COVID-19 positive, and move them into a hotel room, we have to have support there 24/7. We have to make sure they're fed. We have to make sure they never leave those rooms. There's a whole system that has to be implemented that has never been implemented before when managing access to hotel rooms, and our focus has been the most vulnerable population. So for example, we are providing the folks who are at San Francisco General who don't need a bed, who need to be quarantined. We have already moved many of those patients out of the hospital into those hotel rooms, and it's been well over 100 people. We also are focused on the vulnerable population in our shelters, because we have to make sure that we have social distancing in our shelters, and there's not sufficient room for the current population that's in that particular setting. And so we have to move people out of our shelter systems into places where they can be separated appropriately. That's been our priority. We also are focused on the unhoused population, people who are over the age of 60 and people who have underlying conditions. So we are targeting those specific populations, as well as healthcare workers who don't want to go home to their families because they are the ones on the front lines working with these folks. And we have to make sure that when we're dealing with this, it's easy for someone to say, we got 30,000 hotel rooms in San Francisco, we should, give everybody a room. Well, you know what? It's not that simple. It requires a lot of money. It requires a lot of capacity. And the other thing is, when you think about it, everyone's afraid of, being infected themselves. And when we are managing these shelters now, we have to maintain social distancing. So we have to re-educate the people who are working with the populations and the folks that we are bringing in to work in our shelters and to work in these hotel rooms to manage the situation. We have to make sure that the kinds of systems that protect them are put into place when they are facing the public. So it's more complicated, I think, than what people are trying to suggest that we do, and it is very costly. Our first priority is to protect public health. And so we are using our resources and we are prioritizing our hotel rooms and the decisions that we make to do exactly that. It's complicated. I know people want us to move faster, but unfortunately, we are moving as quickly as we can. And the priority is, of course, saving lives during this pandemic.
And Greg, I think Mayor Breed's doing a great job under very difficult circumstances, as we're seeing in many places throughout the Bay Area. But as many of the large city mayors have been talking about and doing, we're seeing opportunity in this crisis. And by that, I mean, under emergency orders, you can move a lot faster. And I think this is a great opportunity for us to expand our capacity for emergency housing, for example, by buying those motels that we're moving folks into at a time when the motel owners may be quite interested in selling, or actually building prefab, tilt-up kinds of housing that we can get in place quickly to get people housed. We're going to need to expand that capacity because all of our cities are going to be facing the challenge months from now of literally pushing people back out in the street when we need to go use a convention center again. Yeah. And so I think, as all the large city mayors are talking about, we want to see federal partnership and state partnership that will enable us not simply to manage the moment, but actually expand capacity for us to address the crisis of homelessness that will continue beyond this.
Mayor Arreguin, Governor Gavin Newsom just a short time ago talked about something called Project Roomkey, in which kind of San Francisco, I guess, would be the model, and that we would see more of these hotel rooms opened up to the homeless community. Any idea what that might look like in your city?
Well, we've been speaking to all hotel and motel owners in the city of Berkeley, and the County of Alameda actually initiated an RFP last week to ascertain, whether hotel owners would be interested in leasing rooms or entire hotels to cities in Alameda County and to the county of Alameda. And we've gotten some interest, and we are actually going to be working in partnership with the state to potentially lease a hotel in the city of Berkeley to provide isolation for homeless individuals who are experiencing symptoms of COVID-19. But I want to just touch upon something that Mayor Liccardo had said. Because of the emergency, because of the orders that have been issued not on the local level, but the statewide level, which allow us to move much more rapidly to respond to this crisis, it is giving us much more flexibility and resources to be able to expand our shelter capacity and our housing for the most vulnerable in our community. And I hope that after this crisis that we can sustain those resources, because we may likely see more people become homeless because of the economic crisis that is created as a result of this pandemic. So we are working very actively to identify hotels, not just in the city of Berkeley, but also in Alameda County to direct people who are symptomatic.
Well, and to that point, when the governor, actually the first 2 hotels that the state leased were in Oakland. And one of them, and we were sending, lists of addresses up to Sacramento. One is one that we had also been in conversation with about buying, because we, again, want to prioritize the leasing of hotels that are willing to engage in a lease to own, because we do not want to be kicking people out onto the streets when this is all finished. And so that very first hotel in Oakland that is being used for isolation for COVID suspected unsheltered residents is one that we had already been working on purchasing. And so it is likely to now be a permanent asset to deal with homelessness on a long-term basis.
Mayor Breed, that's kind of a good segue for us into talking about the rent moratoriums that all of your cities and counties have enacted, because you don't want to add to the homeless population when this is all said and done. How important is that, and how do you ensure there are not mass evictions when we come to the other side of this?
Well, I think that's why when we did a rent moratorium in the beginning, and with the opportunity to provide people with 6 months after this is over to pay back their rent. But we also know that there may be a need for us to shift our existing resources in some of our affordable housing money to help deal with back rent or other issues. And so this is why I launched this economic recovery task force, which I announced it yesterday with the goal of making plans for the future. What is going to happen after this is over? People are still going to be suffering financially. And so, yes, what do we need to do now? And we are trying to do it now to support our small businesses, to provide people with money and food and make sure that they don't get evicted. But what happens after this is over and there's a real strong need? And so I think that it's going to require some changes in our priorities. We in San Francisco anticipate anywhere between a $1.1 and $1.7 billion budget deficit. And that's going to require a lot of cuts, a lot of changes, a lot of reprioritization. And so I think part of what we're hoping to do and what we wish we had strong federal leadership, which makes the difference. We're fortunate to have Governor Gavin Newsom here in California working hand in hand with all of us to try and deliver. And so I think it's going to continue to be a state and federal relationship that's going to help get us through this. But we are going to develop a plan here in San Francisco to address recovery for those who are having challenges with their small businesses, for people who may have personal challenges. It is going to be rough, and we are not going to be able to deal with it on our own. We know the economy is going to be screwed for some time, both here locally as well as throughout the entire U.S. And so it's going to take a lot of work.
Mayor Schaaf, you also announced the launching of a program for grants and loans for small businesses. Can you touch on that and how you hope that maybe mitigates some of this pain that is going to be felt economically?
Sure. And, again, I think it's important that people are clear. It's really an eviction moratorium that many of us have enacted, we legally cannot excuse people from their obligation to owe rent. So I think it's important people recognize the limitations on government. What we can do, though, is try and start raising philanthropic dollars to help people make those rent obligations, as well as delay, put off, not allow penalties and fees, things like that, to help all of us kind of spread the pain out a little bit during this crisis. We did launch our Small Business Emergency Fund, again, as part of our philanthropic efforts. In fact, today I just learned that we're raising the total amount of grants through that to $500,000. We've already had 395 applications. 80% have been from owners who are people of color, and a tremendous percentage were actually some of our lowest income residents who also are business owners. These emergency grants were very much targeted for low income business owners. And we were pleasantly surprised at how many people that are at 30% of the area median income. These are extremely low income individuals who also own businesses, housekeepers, hairstylists, people who own a business but are struggling themselves to make ends meet. And so we're excited that these initial grants are going to some of our most deserving, not just businesses, but also residents.
Mayor Liccardo, Silicon Valley Strong is kind of also in that same vein. Can you talk about those efforts as well as how San Jose might recover on the back end of this when it comes to the economy?
I've been really heartened by the response we've seen to Silicon Valley Strong. We've had more than $17 million in commitments already, primarily to help low-income families that are now without a paycheck. They were already struggling, but of course, now the struggle is just more intense. The bad news is we've had more than 7,000 families fill out applications for those dollars, and we know we are simply not going to be able to fundraise to meet the need because the need is so much greater. We also had a small fund as well for small businesses, and we're providing small $10,000 grants to businesses as well. And we're just going to keep hustling, and we'll have a telethon, in fact, in just a few hours as well to try to raise more dollars. But the reality is that as a community, we need to recognize the really common responsibility that we have. You know, when we became the first city in the country to announce an eviction moratorium, we had a lot of landlords who said, of course we're going to do that. We're not going to kick people out. Some complained, but I think even those landlords are now recognizing, even if you evicted somebody, there's nobody behind them to pay rent. So let's all accept the fact that evicting people isn't going to actually solve any problems. Let's recognize together that we're responsible for one another. And if anything that we learn through this very difficult time is just how connected we are to one another. Even though physically separated, this pandemic shows how dependent we are on one another and that we need to help each other.
Mayor Argo, can you talk about efforts in your community economically, especially for those small businesses that continue to struggle during this?
Absolutely. Well, I want to acknowledge Mayor Liccardo's leadership, being one of the first cities to adopt a moratorium on evictions during this pandemic. And his leadership has really inspired not only our respective cities to adopt legislation, but definitely put pressure on our governor to adopt a declaration, which he had issued last week. And so really it's going to take all of our collective efforts to get through this crisis and get through it as a region. And our region has provided great leadership. You know, we were one of the first regions to issue a shelter-in-place order, and as a result, many states have followed our leadership as well. But in Berkeley, we launched a relief fund, which the city provided $3 million to initially capitalize the fund, and we're working hard to raise contributions from large businesses and residents. We've had thousands of donations from people throughout the city of Berkeley, some as little as $5, some as much as $50,000. And we're deeply appreciative of the fact that our community is really stepping up and working to try to support our small businesses and our arts organizations and residential tenants that are facing eviction during this very difficult time. And I'm really just inspired by how our communities have really stepped forward and have really provided great leadership and have really come together. And this has been a very challenging time. And while we have to be physically distant, it has also been a great unifying moment for many of our communities. So we encourage anyone who wants to donate to please go to berkeleyrelieffund.org. And we are continuing to try to provide as much assistance as possible, knowing that those SBA loans are going to take time to arrive in people's mailboxes.
Greg, I just wanted to add, you know, we have a lot of great resources here in San Francisco as well. We launched a fund, a $10 million fund to provide no interest loans and grants to our small businesses. We had launched that yesterday. And so if anyone needs any information, whether you're a small business, an individual, you're looking for help or you're looking for resources, go to oewd.org. We've been doing a lot of great work here in San Francisco, and I'm so grateful that we have, as some of the other mayors pointed out, we have private sector partners, people who are very generous in contributing and helping to support the need to try and get money into the hands of people who may not have access to unemployment insurance, who may not have access to any other resources. We want to say that it's important that we provide those resources, and we want people to do everything they can to support and uplift one another. And I also want to say, I mean, for example, we have a fund for artists in particular. It's a $2.5 million fund specifically for artists. And a friend of mine told me about a gentleman who she was talking to who said, oh, I'm going to apply for the fund. And she said, well, wait a minute. Are you going to be evicted? Don't you have a situation where, I won't expose the person's situation, but aren't you in a situation where you don't need anything, basically? You have a husband who takes care of you. You aren't going to be evicted. You have food on the table. This money is you're not in any need of this money. And he said, you know what? You're right. I don't need this, because the fact is that money's not going to help every artist in San Francisco. And what we want people to do is to realize that and to just be respectful of that. If you don't need it, then don't go after it, because there are so many people out there who really need this money. And we want to make sure that we reach those who need it the most.
And to that point, I mean, we're encouraging people, if you can pay your rent, pay your rent. There's just a cascading effect of everything that's going on right now. And we recognize that the income disparities, the racial disparities, all of those things get worse in moments of crisis.
Yeah.
And so we really do have to stay mindful. And those of us who can help have got to help as much as possible.
You've all given some really remarkable examples of the community coming together. And I want to give us a chance, as we've talked all through some of these major issues that your cities are dealing with, to kind of end on a positive note. And I think throughout all this, and we've certainly been reporting some of it, we've really seen some remarkable humanity from our communities. And I would love for each of you to maybe share an anecdote, if you can, about the good that is happening in your communities. And Mayor Arguin, we'll start with you, if you can, just to give some of your communities some hope as we deal with a very difficult time.
I'm inspired by how our community's really pulled together and has really been looking out for everyone, including the neediest people in our community. And just some examples, not only people that have given to our relief fund, but people that are sewing masks to provide them to first responders, given that we need to now wear facial coverings. Businesses that have completely changed their operation, manufacturing businesses, to focus now on developing personal protective equipment. Distillers that are developing hand sanitizer to increase access to hand sanitizer for our first responders and our staff. I mean, we have had to adapt, and we've had to change the way that we do things. But despite that, we are seeing businesses and residents really think about the needs of not just themselves, but of their community. And I really think, despite the challenges, that we will be stronger and we'll be more resilient, and this region will be more resilient after we get through this crisis.
Mayor Liccardo.
I think we're seeing what makes Bay Area so incredibly unique as a community is people are just rising to this moment. I remember getting a call late one night from Kara Shirdhar, who's the head of Bloom Energy, who said, you know what, we don't do ventilators. We actually make energy cells, but I've got a lot of folks on the line who are quite interested in figuring out how we can help renovate all these broken and old ventilators, because we think there are thousands of them in hospitals throughout the country. And the governor asked us to see if we could help. And we just need to find somebody who can help us test them and certify and make sure they're safe. And so I connected them to Bonnie Maldonado, who's a doctor over at Stanford, and she got her pulmonary unit involved. Everybody just jumped in. Within 48 hours, literally within 48 hours, he had an assembly line rolling of workers who weren't just doing it because they were told. These were folks who were working overtime and volunteering their hours just to try to get ventilators in place to be able to address the critical need at hospitals throughout the state. And so it was so heartening for me to be able to go to the factory, be able to meet, obviously at a safe distance, many of those who are working long hours, and the governor was there as well, just to celebrate this moment where so many people from different walks of life came together and said, this is a critical moment, let's rise to it.
Mayor Breed?
I got a note taped to my, next to my mailbox. It was from a neighbor who said she was our block captain. And if I needed anything, whether it's groceries, anything from the pharmacy, or just someone to talk to, with her email, her cell phone number, to reach out for anything. And I got a little choked up because I thought, wow, how amazing are the people of San Francisco. I've heard so many stories. A friend of mine whose mom lives in the inner Sunset, basically someone called her and said, because she's a senior, said, I know, you know, that you're part of the vulnerable population. You can't leave. I'm here for you. We can drop off groceries, whatever you need. I mean, I'm hearing stories where people were just, of course, going outside their apartments at a safe distance and clapping at 7 o'clock for healthcare workers. It just really is bringing out the best in people. And I really appreciate that because in times like this, it's necessary. And it's necessary for us to put positive energy in the air, for us to, you know, realize how blessed and fortunate we are, and that this is temporary and we will get through it. But it's going to require a lot of course, patience, a lot of understanding, a need to just really focus on the very best of who we are as people, and how when we come together at a safe distance, there's nothing that we can't accomplish. So I am really hopeful about the future, and this is going to continue to be a difficult time, but we should be so proud that here in the Bay Area, because of our quick action, there are countless lives that have been saved. And we're going to look back at this time in history and be really proud of the actions that we took. And so I'm grateful to be here, grateful to be working with some incredible mayors throughout the Bay Area. And we will get through this, and we will come out of this stronger and better than ever.
Mayor Schaaf, I'll let you close us out.
Oh, thank you. Those are a lot of hard acts to follow, but I have so much deep gratitude for the resilience and grace that our entire community is showing up with in this moment. Some specific stories: Oakland Spirits Company stopped distilling vodka to start making hand sanitizer. Family laundromats in the Fruitvale district. They were too concerned both about their workers and the public that was coming. And, you know, laundromats are considered an essential service, right? Hygiene is very important in this moment. But they decided to just switch their entire operation to actually doing families' laundry for them, wash and fold. And then they are not charging senior citizens anything for that service. We see grocery stores delivering for free to seniors in their neighborhoods. And then I just want to end by really giving a huge shout out to public servants, our workers, and it's not just the firefighters and the police officers that have been responding to your calls every day, knowing that they are putting themselves in tremendous jeopardy with this disease out there. But just the moments of creativity. My head of Parks and Recreation designed an entire child care protocol for our first responders who might need childcare because schools are shut down right now. The head of my animal shelter came up with an entire protocol to take care of pets of our homeless citizens that may need to be moved into isolation trailers or isolation hotel rooms and not be able to take their beloved pets with them. These are the kinds of creative ideas, and I just see my city workers working around the clock all weekend to try and help our community get through this crisis in as good and together and healthy a way possible. So to all the public servants out there, to all the government workers, we see you. We are so grateful for your continued commitment. And again, just let us as a community continue to exhibit our best values as we move through this crisis.
Thank you. Mayors, I wanted to thank all of you for the work you're doing for our communities and to thank you for taking the time to meet with us. I think it's important for our viewers to hear directly from you. We appreciate your efforts and we hope that you continue to stay safe and stay healthy and lead our communities.
Thanks, Greg. Stay healthy.
Welcome everyone to this special KTVU digital town hall on coronavirus. I'm Greg Lee, joined by mayors from 3 major
And thank you guys for being here with us on News Now. As you can see, we are still awaiting President Donald Trump and his coronavirus task force team. They did push that back to 5:30 Eastern time, which was about 5 minutes ago. So we are still sitting here waiting. And as soon as we do see the president and his team step out, of course, we're going to be bringing that to you in full here in that full screen. But until then, since we do have some time to wait, it looks like, why don't we go to a special that got sent to us from one of our sister stations down in Texas, the Dallas-Fort Worth Fox 4 channel. They did a little This Week in Sports that they sent to us over the weekend. So I'm going to play it for you again while we're waiting for President Donald Trump. As soon as him and his team step out, of course, we'll be taking that in full for you right here on News Now.
The COVID-19 pandemic is affecting different people in different ways. They include some sports figures you might know. Some are struggling with the changes in their lives, and many others are just finding ways to help other people. More tonight from the Fox 4 Free-for-All team.
All right, we continue our work from home here tonight. Mike Ducey with Sam Gannon, Jeff Kolb with us, the entire Free-for-All Fox 4 Sports team here. You guys doing okay?
Doing all right. I don't know what day of the week it is, but you know.
Yeah, right.
Hanging in there. I was growing quite the beard, but I've shaved, so it's over now.
Boy, Jeff overdressed for the home studio.
Very dapper, yes.
Today,
no,
yeah.
I'm not trying to show you up.
No, some sense of, I never worry about that. Some sense of normalcy anyway. We're going to talk a little bit about the effect of this shutdown on basketball teams in our area, the Mavs and the Wings. And let me start with Dwight Powell. I talked to him the other day, and Powell, well, you may have seen this recently on social media.
Out came a whistle. Yeah! Willie stopped and looked around to see who it was. It's me, Peter shouted, and stood up, and Willie raced straight to him. Yeah, I know.
Gabe, our buddy with the Mavs, one of the best MFFLs we have. All of us have a little relationship with him. We see him at games all the time. And when I heard he was doing his homeschooling reading time, kind of around the time when I was, obviously at home, his dad asked if I could do it. I said, of course, which was awesome. It was fun. And hopefully we get to it again soon again. But and then today I got a chance to talk with some kids at the hospital and check in on them and see how they're doing in this kind of strange time. And it was great. They lifted my spirits. Hopefully I lifted theirs a little bit as well.
Powell, along with Luca and Mark Cuban, donated $500,000 to first responders in the COVID-19 battle. Of course, Cuban has been an impressive leader in this fight, not just in Texas, but nationally. And Powell has been impressed.
Extremely proud. I think that's one of the greatest parts about being a Maverick is the way that we've been taught from day one and shown through example of how to act in this community. And we have a lot of great fans that look up to us, and we're members of this community. So it's always been important for all of us to find ways to give back and find ways to be leaders. And Mark has done an amazing job for his entire time winning the map and doing that. And I think that's passed down through the leadership team. I know Coach Carlisle does an amazing job of reiterating that message to us and setting an example. And then Dirk did a phenomenal job as a player. So my tenure here already, I've been able to pick up a lot on what it means and how to execute being a leader in the community. And it's no surprise to me that Mark stepped up in this situation, and he's tirelessly trying to find ways to help and unique and find the niches that need the most attention. And yeah, it's no surprise at all, and I'm truly proud. And
all right, as you can see, the team's starting to step out here, so we are taking this in full for you as we get another coronavirus task force briefing right here for you on News Now.
Thank you very much. Thank you very much. This week, America continues our aggressive effort to defeat the virus. As we enter a crucial and difficult phase of the battle, we continue to send our prayers to the people of New York and New Jersey and to our whole country. But right now, New York and New Jersey are very hot zones, and we're with them, we're with everybody. Your struggle is our struggle, and we will beat this virus. We will beat it together. I also want to send best wishes to a very good friend of mine and a friend to our nation, Prime Minister Boris Johnson. We're very saddened to hear that he was taken into intensive care this afternoon, a little while ago. And Americans are all praying for his recovery. He's been a really good friend. He's been really something very special, strong, resolute, doesn't quit, doesn't give up. We have made tremendous progress on therapeutics. I had a fantastic call today, which I'll be talking about a little bit later. And I've asked two of the leading companies, these are brilliant companies, Ebola, AIDS, others, they've come with the solutions and just have done incredible jobs. And I've asked them to contact London immediately. They have offices in London, the major companies, but more than major, more than size, they're genius. And I had a talk with 4 of them today, and they speak a language that most people don't even understand. But I understand something, that they've really advanced therapeutics and therapeutically, and they have arrived in London already. Their London office has whatever they need, and we'll see if we can be of help. We've contacted all of Boris's doctors, and we'll see what is going to take place, but they are ready to go. But when you get brought into intensive care, that gets very, very serious with this particular disease. So the two companies are there, and with what they are talking about, and it's rather complex and has had really incredible results. We're working with the FDA and everybody else, but we are working with London with respect to Boris Johnson. Across the country, we're attacking the enemy on all fronts, including medical, scientific, social, logistical, and economic. We're pressing into action the full power of American government and American enterprise, and our military has been incredible. We've just sent 3,000 public health personnel. They're now deployed in the New York area, and they'll be over at the Javits Center over at the Great Ship. And as you probably have heard, and I was informed that Governor Cuomo has already told you and announced, he called me up a little while ago and he asked whether or not it would be possible to use the ship with respect to fighting the virus. And we hadn't had that in mind at all, but we're going to let him do it, and we're also going to let New Jersey, Governor Murphy, we spoke with him a little while ago, and New Jersey is going to use it also because New Jersey is a hot spot. So Governor Murphy and Governor Cuomo are going to be using the ship, New York, New Jersey, and it's a big ship. And it's now COVID. It's set for COVID, and we are going to, hopefully, that will be very helpful to both states. The Javits Center, which is 2,900 beds, just built by our military, also is going to be manned now by the military, and they should be in place tomorrow. And they'll start sending quite a few people over to the Javits Center. It's convenient. It's right in the middle of everything. So that'll be something great, and we appreciated Governor Cuomo's really nice statements, and likewise Governor Murphy. We have worked very well with both of them, and with, frankly, all of the governors. Vice President Pence had a call this morning with them that lasted for close to 2 hours, and I understand there wasn't a negative person on the call. 50 governors, or just about 50 governors. I think they were all on, from what I understood, and they were very positive about everything their federal government has been doing for them, and you'll hear what that is, and it's rather amazing, actually. Nationwide, the Army Corps of Engineers is building 22 field hospitals. These are big hospitals, and alternate care sites in 18 states. So you have a combination of 22 field hospitals. In addition to that, we're building alternate care sites, which is a little bit of a smaller version of the hospital. And we have a lot of them, and they're going up in 18 different states. In total, we have deployed 8,450 hospital beds from federal stockpiles. And, you know, if you think this is done over a period of weeks, it's incredible, actually. More than 8,000 ventilators have been sent from the national stockpile to our cities and states, backed by the Defense Production Act, which we've used very strongly, very powerfully. So powerfully that we don't have to use it too much, frankly, and it's nice when you don't have to. We're getting more than we ever bargained for. American industry is stepping up. Manufacturers are really going to town, and we have thousands of ventilators being built as we speak, and we have hundreds that are being sent to different locations, and we're ready to roll with almost 10,000 that we have in the federal stockpile. When I say ready to roll, too, I mean exactly what that states. We are, wherever that monster goes, we're able to move with it. Great flexibility. We have tremendous flexibility, and we have people waiting, and they're ready, willing, and able, but waiting to bring them wherever it may be, if they need it. If they're needed. It's possible that they won't be needed, that we're fully stocked, because numbers are coming in where, because of what the American people are doing, we're having fewer hospital visits. I think that could be the case in New York. It could be the case in a few other states. and fewer beds, fewer hospital visits mean fewer ventilators. So we'll see whether or not our original projections were right. But anyway, I had a very good talk with both governors, and I think they're very happy, extremely happy about what we're doing for them, and especially going all COVID. So that'll take place almost immediately. FEMA and HHS have directly distributed 11.7 million N95 respirators. Think of that. Get the number. 11.7 million N95 respirators, 11.7 million, 26.5 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22.6 million gloves. 22.6 million gloves. We have also arranged for vast quantities of additional materials to be allocated through donations and existing supply chains. We've also given tremendous medical material and supplies throughout the 50 states and territories. And through Project Airbridge, we have succeeded in bringing plane loads of vital supplies into the United States from overseas. We had an additional 3. These are massive planes, by the way. The big planes are very big, very powerful, and they're loaded to the gills with supplies. And rather than bringing them into our stockpile, as we've discussed, we bring them to all the different locations where they're needed, so we can save a big step and a timely step. Because of my actions under the DPA, I can also announce today that we have reached an agreement, very amicable agreement, with 3M for the delivery of an additional 55.5 million high-quality face masks each month, so that we're going to be getting, over the next couple of months, 166.5 million masks for our frontline healthcare workers. So the 3M saga ends very happily. We're very proud to be dealing now with 3M and its CEO, Mike Roman. I just spoke with him, and I thanked him for getting it done. And Mike was very happy to get it done. Great company. So we're getting 166.5 million masks, and mostly that's going to be for our frontline healthcare workers. Okay? That's 3M. Thank you, 3M. I also want to thank Apple, one of the many great American companies that's really leapt into action. Today, Apple announced that it is now producing plastic face shields for healthcare workers at the rate of 1 million per week. 1 million, and these are the shields that you see on television quite a bit, and they're at the highest level of quality and safety. We're grateful as well to Salesforce, which has donated 48 million pieces of personal protective equipment, including masks, gowns, suits, and face shields. So thank you very much to Salesforce. I urge all of our nation's governors to ensure that the massive deliveries that we've made to your states over the past few weeks are distributed as quickly as possible. So again, we're working very well with the governors. Now, they may see you and say, oh, we're not happy, but they're very happy on the phone. And Mike Pence is a straight shooter, and he had a great phone conversation to them with all of the governors, teleconference. And they're very happy, every one of them. Were there any negatives?
No, sir.
See? I told you. Mike is the greatest. Mike, and you have done a great job, Mike, and I appreciate it. The whole country appreciates it.
Thank you, Mr. President.
Anthony appreciates it, right? Don't you see? Everybody appreciates Mike, special man. So a lot of the things that we've done, again, are going directly to the states. The states seem to be very happy. If they're not, they can call me directly. They can call Mike directly, and we'll make them happy. But tremendous progress has been made in a very short period. And I think very importantly, the progress has been made before the surge comes, because the next week and a half is going to be a big surge, the professionals tell us. And I think we're in good shape for it, Anthony. So it's good timing, really good timing. We can have this stuff there. It's already there for the most part, but we're bringing a lot of different resources to the various locations, especially where the surge is looking like it's going to take place. Resources from the national stockpile need to reach our warriors, and they are warriors. I tell it all the time. I saw it again this morning. He's young, in many cases older, but they're walking into the hospital and they're putting on, I mean, as their doors open, they're going into this place, and, you know, it's not exactly too safe. And they're going in there and they're putting the outfits on and they're putting their masks on and it's incredible. It's like no different than you watch the war movies or you watch the old clips of war running up hills. To me, it's the same thing. Men and women, young and old, but a lot of young people just going in there. They're not thinking about, oh, gee, this is dangerous. They're not saying, oh, I don't want to go in. They're warriors. They're running through those doors. It's the most incredible thing. It's an incredible, beautiful thing. Resources from the national stockpile need to reach these warriors in the hospitals immediately, and we're making sure they do. And again, the states have that responsibility, but we're working with the states, and we're getting the states a lot of things that they can distribute, or when they tell us, we bring it directly to the hospital from the federal stockpile or from the planes that land, without even going to the stockpile. If any state's having difficulty distributing supplies, we urge you to use the National Guard to assist in the delivery. And I have to say, you have done a fantastic job. Deborah, you know that you've done great. Tony, you know that you've done great. But what a job you've done, and I appreciate it. I really do. Your whole group has been incredible. That's a lot of stars you have, I'll tell you that. He's supposed to do a great job when you have 4 stars, right? But the military has been incredible, and I thank them for all of us. Conversely, if a state believes that it has surplus equipment or supplies, very important, because we actually have gotten so much to some of the states that they're able to now, they've done a fantastic job, and they've kept that line low. And we have some states that have surplus equipment and supplies, and they're working with us to rapidly redeploy those supplies to areas of greatest need. We thought that might happen. If it worked out well, that's what was going to happen, and it's happening. And I want to thank Governor Gavin Newsom, who's doing a tremendous job, who's announced California will send 500 ventilators to be distributed to other locations. I think some are going to Arizona, some are going to Washington, D.C. We think they're going to Delaware. We're working it out. But 500 excess ventilators from the state of California, and we're going to get them taken care of wherever they have to go. Those decisions are being made right now. The members of the White House Task Force and I are in close touch with mayors and governors and hospital administrators across our country, and we're told that at the present time, most of the critical needs are being more than met. States have to continue sharing detailed information in the amount and utilization rates of medical supplies so we know what to resupply them, or they can get it directly. That includes ventilators. They can get it directly. Ideally, if they can get it directly, but if they can't, if they're unable to do it, we have tremendous amounts of supplies, and we're building it up very fast, too. And this is before the big surge. This information is fundamental to our ability to deliver the material when and where it's most needed. Now, Mike, in his conversation today, I think got some information as to a couple of locations where we're going to be delivering large numbers of ventilators and large numbers of medical supplies, and we'll take care of that. But some of the states are very happy. Even Governor Pritzker from Illinois is happy. Of course, he may not be happy when he talks to the press, but he's happy. He's a very happy man. We're increasingly hopeful that the aggressive mitigation strategy we put into place will ultimately allow our hospital system to successfully manage the major influx of cases that we have right now. Again, I say that we're finding because of the incredible job done by the American people in conjunction with everybody, governors, the military, federal government, state government, local government. I've had a lot of conversations with New York City and Mayor de Blasio. I've gotten to know him. I didn't know him. Gotten to know him. A lot of people are working hard. Everybody's working hard. A lot of people are doing a great job. I'll tell you that. A lot of people are doing a great job. But the goal is that all Americans have been sacrificing to achieve these last few weeks, things that a lot of people thought were not possible to achieve. And I think we've more than achieved, but we have to go through. Again, we're going to have a rough week. We're going to have maybe a little more than a week. But there's tremendous light at the end of that tunnel. I said it last time, said it last night. There's tremendous light at the end of the tunnel. There's so many things happening with therapeutics, with vaccines, with things that we really want. Deborah, Tony, they're all working so hard on this, but those therapeutics, I mean, look, the vaccines are going to be always a little bit later because of that testing period, but the therapeutics, getting the kind of things that I heard about today, talking to these brilliant companies and brilliant people on the phone was fantastic. It was such an incredible conversation. And I also spoke just a few minutes ago with former Vice President Biden, who called, and we had a really wonderful, warm conversation. It was a very nice conversation. We talked about pretty much this. This is what we talked about. This is what everyone's talking about. This is what they want to talk about. And he gave me his point of view, and I fully understood that. And we just had a very friendly conversation. Lasted probably 15 minutes. And it was really good. It was really good. Really nice. I think it was very much so. I appreciate his calling. As we continue our efforts to develop treatments and cures this afternoon, I spoke with leaders of the American pharmaceutical companies, and just to give you their names, Amgen, Genentech, Gilead, Regeneron. These are four of the greatest in the world for doing exactly what they're doing. And currently 10 different therapeutic agents are in active trials, and some are looking incredibly successful, but we have to go through a process. And it's going to be a fairly quick process, I will tell you, based on what the FDA told me. And another 15 are in plans for clinical trials. So they're advancing rapidly. And today, a second company announced that the FDA has authorized its vaccine candidate to begin clinical trials. So you have Johnson & Johnson is already there. I believe they're the one that's first. And now we have a second company that just announced, and was just approved. So we have two companies at that level for the vaccine itself. We've now performed 100, well, if you think of this, 1.79 million tests. That's 1,790,000 tests nationwide. And I think we're going to put up a screen here someplace. Good. They're on cue. They're just on cue. And here it is. This is the process starting on 5 March and ending right there, right about now, right? That's about it. Yesterday. So, and it's going up at a rapid rate. Nobody has done more testing. And one of the reasons why they say, and I think I can say this, Deborah, very strongly, but one of the reasons that we have more cases is we've done more testing. If I went to some of these countries that have, in my opinion, far more people than we do that had the problem, and if we did the kind of testing proportionally that we're doing, they'd have many more cases than us. But we have more cases because we do much more testing. So when you do the testing, you have cases. Otherwise, you wouldn't know about the cases. People sit home, you don't know about it. But we have now done 1,790,000 tests nationwide. That's more than any other country in the world. Hence, we have more cases. And that number is growing by nearly 125,000 people per day. Think of that one. So it's growing by 125,000 people per day. I told you about South Korea. This is a, vastly faster. And we also have, they say, the most accurate of tests. CVS is launching, and they've been great. 2 new drive-through testing sites in Atlanta Georgia, and Providence, Rhode Island. And each location will be able to test up to 1,000 patients per day using the ultra-fast 5-minute test developed by Abbott Labs. Now they're down to 5 minutes. They call it the ultra-fast, and it's very accurate. Abbott Labs, I want to thank them. They've been fantastic. We're also speeding urgent economic relief to the American worker and families and the employers. As of today, tens of thousands of small businesses have applied for more than $40 billion in relief under the Paycheck Protection Program. You've all been reading about it, and it's really, I mean, it's only been going for a couple of days. It's really been performing well. A couple of little glitches, minor glitches that have already been taken care of, what they say. These funds will result in nearly 2 million jobs being preserved, so we're taking care of our workers, small businesses and our workers. Nearly 3,000 lenders have already made loans under the program, and we're signing up additional lenders very quickly, rapidly. Community banks have been very responsive, and larger banks are also stepping up. If we run out of funds, by the way, we're already preparing because it's going so fast for the small businesses and their employees. We'll ask Congress to refill it immediately. But the banks have been great. The big banks, the Bank of America was right up there at the beginning. J.P. Morgan Chase has been great. After the first day, they really came through, and a lot of the big banks, but the community banks have been fantastic. As we announced last week, we are providing $100 billion in direct support for our hospitals. And the first tranche, $30 billion, will be distributed this week. So I want to say one other thing. Our farmers, we love our farmers. And as you know, as of April 1st, the China trade deal, $250 billion. They purchased $250 billion from us, if not more. And of that, approximately $50 billion is expected to be with our farmers. So it kicked in as of April 1st, and we'll see how it goes. It seems like they're buying, so we'll let you know how that's going. But they're buying anywhere from $40 to $50 billion worth of our agricultural product. That should have a huge impact on our farmers, a tremendous impact on our farmers, but we're watching it very closely. To fight the medical war, we've mobilized the unbeatable, and it is unbeatable strength of American determination, ingenuity, and compassion. I got to see that when I spoke to the great science, because I call them science companies more than drug companies. They're scientists. We've seen businesses, charities, and private citizens making generous donations. So many people are making donations. We've seen states and cities supporting and helping each other and caring for our citizens. And we've seen Americans of all backgrounds and beliefs uniting together to answer the challenge and rise to the moment, and that's what they're doing. Above all, we've been awed and inspired by the exceptional courage of the doctors, nurses, EMTs, and healthcare workers who are the soldiers of this war. No words can ever express the complete measure of our gratitude for these intrepid heroes. One Cleveland patient credited his medical team for not only saving his life through their skill, but forever changing his life through their example of selfless devotion. Couldn't believe it, so generous he was with his statements. And he talked about their bravery in an area that was in such trouble, an area of that hospital where people were dying, and he talked about their bravery. Another survivor in Houston said simply, "I will consider them my angels forever. I will consider them," think of that, "my angels forever." As our nation endures the depths of loss and grief, we are also witness to the summit of American virtue, character, and courage. With the love and dedication of every American patriot, we will win this battle, we will defeat this enemy, and we will rise from this present crisis with new strength, unity, and resolve. And that's what's happening. Tremendous stories are coming out of this horrible moment, very dark moment for the world. 182. I was saying 151 for a while, and then it got up to 160, and it's 182, as I announced yesterday. 182 countries are being attacked by this virus. So I just want to thank everybody. I want to thank the American citizens for doing a great job. Stay inside and let's win this and let's get our country open as soon as we can. I think it's going to be sooner than people think. Things are going really well. Again, light at the end of the tunnel. And with that, I'll take a few questions, and then Mike is going to take over and talk with the Admiral and with the professionals, and we appreciate you being here. Yes, please.
Thank you, Mr. President. You mentioned that you were asking U.S. drug companies to provide treatment to the British Prime Minister. What sort of treatment is that? Is that something that is available?
Well, it's it's a very complex treatment of things that they've just recently developed, and that they have a lot of experience with having to do with something else, but recent for this. And they've already concurred. They've already had meetings with the doctors, and we'll see whether or not they want to go that route. But when you're in intensive care, it's a big deal. So they're there and they're ready. I think we have 3 of them. I spoke with 4. You know who the 4 would be, and you know the people within those. You'd know the companies. I told you the companies, but the people are the greatest in the world. So they're at the hospital, and we'll see. And they have everything with them should it be needed. Hopefully it won't have to be needed, but should it be needed. I found Boris to be a fantastic person, just like a fantastic, warm, strong, smart guy. He loves his country. You see that? I mean, he fought like hell for his country. And intensive care is big stuff. Really big stuff.
Yesterday you were asked about this as well, but now that he's been moved to intensive care, does that give you and the Vice President any pause or additional concerns, steps that you're taking to preserve the continuity of government here?
No, I don't think so. Mike had his test a couple of days ago. I had my test a couple of days ago. So, and we're here, and here you are. So, no, I don't think so. But I think we'll probably, just because of questions like that, I think we'll probably have maybe quite a few tests. It's not the worst idea. You know, the system of testing now is so quick and so easy. So I could see, and you were tested again today? You sure you're okay? I'm okay. Good, then I'm staying here.
Despite the nearly 1.8 million tests that you say the United States has done, the Inspector General for the Department of Health and Human Services released a report today, a survey of more than 300 hospitals across the country, and the #1 complaint from those hospitals were severe shortages of testing supplies and a really long wait time. I mean, a week or longer.
And did I hear the word Inspector General? Really? It's wrong. And they'll talk to you about it. It's wrong.
But this is your own government.
Well, where did he come from, the Inspector General? What's his name?
It came from the Inspector General
what's his
report.
Name?
I don't know his name
Well,
off the top
find me
of
his
my
name.
head.
Let me know, okay? If you find me his name, I'd appreciate it.
But, sir, these are hospitals.
All I can tell you is this: we put up on the board. You're going to ask the Admiral, but we are doing.
Who say that they're waiting a week or longer to get their test results. Why?
But we've done more testing and had more results than any country anywhere in the world. They're doing an incredible job. Now they're all calling us. They want our testing. What are we doing? How do you do the 5-minute test? How do you do the 15-minute test? So give me the name of the Inspector General. Could politics be entered into that? Go ahead, please.
This is our.
Go ahead.
Thank you, sir. Are you worried about retaliation to your decision to ban export of medical goods, like Indian Prime Minister Modi's decision to not export hydroxychloroquine to the United States and other countries?
I don't like that decision. I didn't hear that was his decision. I know that he stopped it for other countries. I spoke to him yesterday. We had a very good talk, and we'll see whether or not that's his. I would be surprised if he would, because India does very well with the United States. For many years, they've been taking advantage of the United States on trade. So I would be surprised if that were his decision. He'd have to tell me that. I spoke to him Sunday morning, called him, and I said, we'd appreciate your allowing our supply to come out. If he doesn't allow it to come out, that would be okay. But, of course, there may be retaliation. Why wouldn't there be? Yeah, please.
Thank you, Mr. President. The Paycheck Protection Program has gotten off to a confusing start for small businesses.
I don't think so. I think it's done very well.
Wells Fargo has stopped taking applications. Bank of America initially prioritized taking applications from clients that were already
Bank of America has been the leader, taking tremendous numbers of applications. And of course, there may have been, they wanted to have a slightly different application. They wanted to have a little different information. But Bank of America has been a leader. They're #1 in terms of applications. I wish you'd ask the question differently. Why don't you say it's gotten off to a tremendous start, but there are some little glitches, which, by the way, have been worked out. It would be so much nicer if you do that. But you're just incapable of asking a question in a positive way.
Is the federal government
It's
putting
already
in
done.
place
It's already
to
done.
ensure that there is
It's taken the
fairness?
measures. It's taken the measures. And we may even do a different system. Not with this. We're going to have to probably add more money to this to save and to keep our small businesses going and to keep the employees of those small businesses working. But it's such a positive event, and you ask it in such a negative way. It's just, I wish we had a fair media in this country, and we really don't. Speaking of unfair, go ahead.
Mr. President, the acting Secretary of the Navy told the crew of the USS Roosevelt that Captain Crozier was either, quote, too naive or too stupid to be in command. Is it appropriate for the Chief Officer of the Navy to be speaking this way about this captain? Is this
Well, I haven't heard it exactly. I haven't heard. I heard they had a statement that was made. If that were the statement, it's a strong statement. Look, the letters shouldn't have been sent, and certainly they shouldn't have been leaked. This is a military operation. I must tell you, I've heard very good things about the gentlemen, both gentlemen, by the way. I will say this about both gentlemen. And I may look into it only from the standpoint that something should be resolved, because I'm hearing good things about both people.
What might you look into, sir?
I may just get involved, if it's okay with you.
What do you mean?
Yeah, because you know what? You have two good people, and they're arguing. And I'm good, believe it or not, at settling arguments. I'm good at settling these arguments. So I may look into it in great detail, and I'll be able to figure it out very fast. But that was a statement. It's a rough statement. But look,
if you decide it was...
letters should not have been sent to many people, unclassified. That was a mistake. It's a mistake that shouldn't have been made, because it's unfair to the families of the people on the ship, because they get nervous, and it shows weakness. And there's nothing weak about us now. Not anymore. We have the strongest military we've ever had. And we're not going to be showing weakness to anybody, because we have, that ship is incredible, nuclear-powered aircraft carrier. And we don't want to be writing letters. We don't want to have letter-writing campaigns where the fake news finds a letter or gets a leak. We don't want that. So the letter, so the letter shouldn't have been sent. With all of that said, his career prior to that was very good. So I'm going to get involved and see exactly what's going on there, because I don't want to destroy somebody for having a bad day. Okay, does that make sense? Okay. Yeah.
Mr. President, Vice President Biden's spokesperson said that he made some suggestions to you about actions that you could be taken to deal with the pandemic.
He did. We had a very good talk. We agreed that we weren't going to talk about what we said, but we had a very, very good talk. It was a warm talk. I enjoyed it. I hope he enjoyed it too. And it was short. It was 15 minutes.
Did he have good suggestions? Anything that you're going to do?
Well, he had suggestions. It doesn't mean that I agree with those suggestions, but certainly he had suggestions. And I also told him some of the things we're doing. But the conversation was a friendly, very friendly conversation. Yeah, please.
Thanks a lot, Mr. President. You've mentioned, other members of your task force have mentioned, over the course of the next 2 weeks, it's going to be a very difficult time for our country in terms of fatalities. And
it will be a difficult week and a half.
Yeah. And there are a number of governors who are close allies of yours, Mr. President, who have refrained thus far to have these stay-at-home orders. And Dr. Fauci, who of course is on your task force, has said that the states that don't have stay-at-home orders are putting themselves at risk and the country at risk.
If Dr. Fauci said that, I would be inclined to call them up. You know, we do have a constitutional problem in doing that. You understand that? I mean, there's a double-edged sword. You understand? I can do it, but it is a constitutional. You can say federalist. You can say there's lots of different reasons where I would rather have the governors do it, make their own determination. They're smaller, and not in all cases, but sort of they're smaller cases. But I'm not sure 100% that Dr. Fauci said that, but you can ask him. Tony, you want to say something, please?
So I had good conversations with the governor of Nebraska and the governor of Iowa here, and it's interesting that functionally, even though they have not given a strict stay at home, what they are doing is really functionally equivalent to that. And we had a really good conversation with both of the governors. When I had mentioned that, I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation, and I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing.
If I could ask a question, Dr. Fauci, before you go ahead. About getting back to normal, you said you wanted to get back to normal as soon as possible. Will we truly get back to normal in this country before there's an actual vaccine that's available to everybody? How do you start lifting the restrictions safely?
Yeah, well, John, if back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. But when we say getting back to normal, we mean something very different from what we're going through right now. Because right now we are in a very intense mitigation. When we get back to normal, we will go back gradually to the point where we can function as a society. But you're absolutely right. I mean, if you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
I think that with the therapies, and I think that with the vaccines, which I have total confidence are coming, and I'm dealing with the companies. I'm talking to Johnson & Johnson. I'm talking to all of them. I think that when you add the tremendous stimulus that we're giving, like, for instance, deductibility for restaurant expenses for restaurants and entertainment, the money that we're talking about for small businesses and employees to keep everybody working, and other things that we're frankly working on right now, which are going to be great for our people. I think when you add that to it, I think we can get more than back to normal from an economic standpoint, actually be better, but more than back to normal. But I would agree that we'd love to see a vaccine, but immediately would love to see a therapeutic. And I think we're getting very close.
Do you think you'll be able to lift restrictions on April 30th right now?
I don't want to comment on that, but I can tell you that we certainly want to try. We certainly want to see what's going on. We're doing very well. Look, you look at those. You look at most places where that, you can call it the bump, you can call it the hill, you can call it the mountain, you can call it whatever you want to do it. It's very flat. You take a look, and that was done through mitigation. That was done through a lot of good work, and that far exceeded our expectations before. I mean, people can't even believe how low some of those bumps are, some of those hills are. They're very surprised. Now, you have a couple of tough ones. New Jersey's been very tough, and New York has been very tough. They're crowded in. It's tight. It's tougher. But far exceeding. California far exceeds. Washington State far exceeds. You look at so many of these states, how well they're doing. The 8 states, by the way, and I haven't spoken to the governors, but Tony's so right. They may not have it from the standpoint that they're saying it, but those people are practicing it, and they're doing a fantastic job. Take a look at where they are in terms of the levels, but take a look where they are. So, but if I thought it was something that, and I've looked at him, and I've looked at him very carefully. I looked at him today, looked at him yesterday. From a constitutional standpoint, I'd love not to get involved with that. And not from a legal standpoint, just from a moral, constitutional standpoint. Because legally, I can. But morally, I believe in our Constitution, much more so than most people. And I'd love to be able to let the governors do what they have to do. Those states are doing a fantastic job, all 8 of them. They're doing a fantastic job. So we'll see what happens. As for your question, you fully understand what I'm saying, so thank you. Yes, please.
Hi, 2 questions, if I may, one from somebody outside the room. But first, do you think Boris Johnson, when he talked about shaking hands with hospital patients, did he downplay the threat of this virus too much? And do you know exactly what his current...
Well, I think Boris was looking at it differently. He was looking at it earlier. He was looking at it like ride it out. There were many people thinking about riding it out, meaning, whatever it is, it is. But then you see what starts to happen, and the numbers become monumental, and they decide not to do that. We actually moved early. We moved early because of what we did with respect to the ban on China coming in, and then Europe coming in. That was an early ban, too. And then UK. No, he waited a little while, and he felt that, but he got, he made a decision very quickly thereafter to do what they did, and they've gone to a very strict lockdown. But they're suffering greatly as a nation right now. They're going through a lot. They're a nation that's having a difficult time. But I've gotten to know him. He's just such an incredible guy. It was just so shocking to see that, because you know what that means. Intensive care is a big deal with regard to what we're talking about. That's a very big deal, very scary deal. Yeah, please, Jeff.
Just somebody who can't be in the room due to social distancing has asked me to ask a question. It's Thomas Howell of the Washington Times. How many health workers in the US have become infected with COVID-19? And if the answer is not known, will the CDC be publishing that data?
Yeah, I could get you that information. I think they'd probably be willing to give that, right? Yeah, we could get you that information. Jeff, please.
Mr. President, OPEC is meeting on Thursday, and they have said that they are willing to make a cut in production if the U.S. chips in as well, which suggests that they want you to ask U.S. producers to do an
Well, you're the first one that's told me that. I don't know. We'll have to make that decision. And maybe we will, maybe we won't, but we'll have to make that decision. I think the cuts are automatic. If you're a believer in markets, I can guarantee you there's a cut from pre this condition. Look, this happened because of the virus. The virus knocked out 40%. It went down in 1 hour. I mean, literally, when places closed up, you're talking about a 40% cut. No, I think it's happening automatically, but nobody's asked me that question yet, so we'll see what happens. I'll let you know Thursday evening.
All right, that's the deal. But you would consider asking U.S. companies to
I think it's automatic, because they're already cutting. I mean, if you look, they're cutting back because it's market, it's demand, it's supply and demand. They're already cutting back, and they're cutting back very seriously.
But if OPEC is asking for a signal from
the nobody's asked me that, so if they ask me, I'll make a decision. Okay? But again, it's happening anyway. Yes, please.
In light of all the discussion about Prime Minister Johnson and his health, can you update us on the status of the second half of your physical that you were going to have this year?
Yeah, so I had a physical. The first half was very successful. I did it on a day when I was in the White House, and we were able to do that, as the doctor reported. And I have the second half of the physical different. Probably is done at Walter Reed, and I'll do that at the appropriate time, but I feel very good, and according to the doctor, very good shape.
Can I just ask you again on the idea of a national stay-at-home recommendation? What is giving you so much pause about making a recommendation?
I told you. He understood very well. I appreciate your understanding.
It's not an order,
it's called the Constitution of the United States, and I'd rather have, if possible, for the governors to make the decision. If a decision was very necessary, and they have done a good job, and Tony said it better than anybody, they are doing what we're asking them to do without having to put the seal on it. But I will say, if I thought it was necessary, I'll do it in a heartbeat.
Do you agree with the Georgia governor opening the beaches?
Opening what?
The beaches?
I haven't seen. I'm going to have to see to what extent. I'm going to have to see how many people you're talking about. Are they crowded? Are they packed? Are they not packed? We'll have to take a look at it. Right now, it's very early for beaches in Georgia. So right now, very early, so I'll take a look at it. He's done a very good job as the governor. He knows what he's doing, but we'll have to take a look. It really does depend on, how crowded it may be. But I will talk to him, and I will ask him that question. I would ask him. Yeah, please.
Mr. President, you said last week that you were considering travel restrictions around hotspots. Is that something that's still on the table, and at what point?
We're looking at it, and the airlines have been cutting their routes. You saw that yesterday. They announced big cuts in routes. We need some flights for emergency use for military people. We need some flights for medical people, and there are very few flights, as you know. And the flights that are going out are, I think they said they're 3 to 4% full. You have 3% of the plane is occupied, so it's they're very generally very empty planes. But it's good to have. It's a tiny amount of flights relative to the overall, and we need them also for medical workers. Otherwise, we're going to have to do a whole big thing with our own planes. So they're done for a reason. There's also testing done when people get onto those planes and also when people get off the planes.
If I can follow up on this question of the HHS Inspector General, and by the way, her name was Christy Grimm, and it wasn't so much her opinion, but they interviewed 323 different hospitals.
Well, it still could be her opinion. When was she appointed? When was she appointed?
I'm not sure when she was
Would
appointed.
you do me a favor? Let me know.
I'll check.
No, let me know now. I have to know now, John. Let me know now. Because we are doing an incredible job in testing. We are doing a better job than anybody in the world right now in testing. There's nobody close. And other nations admit this. Other nations have admitted it very strongly. Other nations are calling us, wanting to know about our testing. Let me know when she was appointed, would you?
Specifically,
Go ahead,
what she
please.
was saying was that there had been a delay in the
Okay, thank you very much. Go ahead, Chris.
Thank you, Mr. President. Only last week, there were multiple flights coming from China full of medical supplies.
Yes.
Companies like Huawei and Alibaba has been donating to the United States
People I know very well.
1.5 million N95 masks and also a lot of medical gloves and much more medical supplies.
Sounds like a statement more than a question.
And Chinese Ambassador Cui Tiankai last night wrote an op-ed on New York Times calling to cooperation with the United States. So are you personally working directly with China?
We just signed a trade deal.
Also fighting with the
It's the
virus?
biggest deal probably ever made, and I hope they're going to honor that trade deal. If they don't honor the trade deal, then I'll tell you a different answer, but I think they will. They're going to spend billions of dollars for agriculture. They're going to spend billions of dollars for many different things, whereas China never spent money in our country. We spent money. We had a deficit, a trade deficit with China for years of $500 billion, $400 billion. We had the biggest trade deficits in the history of the world with China. Now China's going to spend a lot, has agreed to spend $250 billion, many billions of dollars in our country, much of it going to farmers and manufacturers. So I'll let you know. I mean, I hope they're going to honor the deal. We'll find out.
With China, are you cooperating with
I don't
China?
know. Who are you working for, China? You work for China, or are you with a newspaper? Who are you with?
Hong Kong Phoenix TV.
Who owns that, China? Is it owned by
based in
China?
Hong Kong.
No, is it owned by the state?
No, it's not. It's a private-owned company.
Okay, good. Okay. Look, I'll let you know. I'll give you a good answer to that in a few months. I wanted to see what they do, because it's time for them to help us, okay? It's time right now for China to help us, and hopefully they do. And if they don't, that's okay, too. But we signed a deal. It was signed with great goodwill and spirit, and it's time that our farmers benefited, our manufacturers benefited, and we'll see whether or not that deal is honored. And I think it will be, because I know President Xi, who I like and respect, and I think he will honor the deal he made with us. It just went into effect 4 days ago. I will see whether or not. In fact, I called up just a little while ago. I said, how are the farmers doing with respect to China? Are they buying the product as anticipated? And the answer was, yeah, I think so. But it wasn't the most positive, but it was starting. The deal just started. So I'll let you know. But, you know, for many, many years, China ate our lunch because we had people in this position that I'm in right now that allowed China to get away with absolute murder. And it should have never happened. But we are now dealing with China. We'll see what happens. Yeah,
Mr. President, I'll tell you
how many do you want to ask?
So I was going to answer your question you asked me. She was appointed in January of this year to her current position as the Principal Deputy Inspector General.
We're going to take a look at it. Go ahead.
I know you don't want to talk about...
On the issue of small business loans, sir, you said that businesses have applied for $40 billion in loans, but can you tell us how much of that money has actually gone out to the small businesses?
I can't tell you, but I know it goes out very quickly once the loan application's approved, and the process is very fast. And you have to understand, these are banks, and that's what they do, but they were swamped. They were actually swamped. Okay, go ahead.
I know you don't want to talk about the Inspector General report, but testing is still a big issue in this country. When can hospitals expect?
Put the slide up again, please.
When can hospitals expect to receive a quick turnaround of these test results?
Are you ready? Hospitals can do their own testing also. States can do their own testing. States are supposed to be doing testing. Hospitals are supposed to be doing testing. Do you understand that? We're the federal government. Listen to me. We're the federal government. We're not supposed to stand on street corners doing testing. They go to doctors. They go to hospitals. They go to the state. The state is a more localized government. You have 50 of them, and they can go 50 within here. You also have territories, as you know, and they do the testing. And if you look at the chart, if you take a look, did they put it up? Yeah, just take a look. And these are testing, and the results are now coming in very quickly. Initially speaking, the tests were old, obsolete, and not really prepared. We have a brand new testing system that we developed very quickly, and that's your result. And you should say, congratulations, great job, instead of being so horrid in the way you ask a question. Please, go ahead.
Mr. President, today...
Yeah, I'd love to have the Admiral speak to that question. Yes, it's a great idea.
So I can talk a little bit more about testing later on, but as the President said, 1.79 million tests have been done, and this does not count the hundreds of thousands of tests that are done within hospitals that are now currently not reporting, so I'm sure we're well over 2 million. That Inspector General report was done here, 23rd, 24th, during our ramp-up period, quite a long time ago. There was clearly, and it's hard to interpret the report because it mixes up all kinds of things, but clearly there was complaints by some hospitals of a backlog, probably at send-out tests, and that is true. There were several days of backlog at some of the major labs that have been taken care of. We know now that the ACLA labs now have a 24 to 48-hour turnaround. They're doing well over 100,000 tests a day. We now have the Abbott machine that's point of care. That's 18,000 of those instruments throughout the country. The Cepheid machine is now all across the country with a 45-minute turnaround. So we have worked directly with many of the hospitals that have their own laboratory-derived tests. Some of those really, quite frankly, didn't understand the regulatory freedom they have to use other different kinds of instruments or different kinds of reagents. So like they do now, and I'm on the phone with them all the time to make sure that everything is clear. We have a 24-hour call number. But that's what it was there for. And I don't know the Inspector General. I don't know that person. I tell you one thing I have a problem with. If there was such a problem that she knew about or he knew about on March 23rd and 24th, why did I find out about the tests from them on the news media at 8 o'clock this morning? If there was a problem, I think you're ethically obliged to tell me where that is so we can interact with it like I do every single day. But that's a discussion for the future. I think testing is really in a good position right now, and I'd be happy to expand on some of the really good tests that are coming up.
How long has that person been in government? Could I ask you that?
Did serve in the previous administration.
Oh, you didn't tell me that. Oh, I see. You didn't tell me that, John. You didn't tell me that. Did serve in the previous administration. You mean the Obama administration. Thank you for telling me that. See, there's a typical fake news deal.
You asked me when she was appointed. I told you when she was appointed.
You're a third-rate reporter, and what you just said is a disgrace, okay? You asked me, you said, sir, just got appointed. Take a look at what you said now. I said, when did this person, how long in government? Well, it was appointed in the Obama administration. Thank you very much, John. Thank you very much. You will never make it. Go ahead, please.
On the ventilators,
Well, that's
maybe this is
terrible.
for Admiral Jawar, but can you tell us today how many ventilators are in the federal stockpile?
I'm not going to tell you how many are in the stockpile, but I can tell you that we look at ventilator use granularly every single day in every single state and down to the hospital level. So we have been able to meet and easily meet all the ventilator requirements that have been brought to us by the state. No one has not gotten a ventilator that needs a ventilator. And as far as we can project, looking at all models, every person who needs a ventilator will get a ventilator. I'm a ventilator doc, right? I'm an ICU physician for children. Spent every day of my life managing people on ventilators. This is my community. It's also the Surgeon General's community as an anesthesiologist. So what we have in the stockpile, I think, is not a number that we give out, but we have thousands remaining in the stockpile. And now you're seeing out of the appropriate American spirit that when a state like Washington or California doesn't need that ventilator, they're doing the right thing by moving them around the country.
It's about 9,000, just so you understand. That's right. It's about 9,000. And by the way, you didn't tell me also that this Inspector General came out of the Obama administration. You didn't tell me that either.
Sir, everybody up here.
Okay, please, go ahead.
Go ahead. I'm looking, sir, just quickly here, I'm looking at this Inspector General's bio. She appears to have served in government since 1999, but I was hoping to ask you about your call with former Vice President Joe Biden. Is there something that you learned on that phone call, and has that changed your opinion?
No, I understood his views before the call.
Has that changed your opinion about speaking to people?
I just think he's I think he's a nice man. I've always thought he was a nice man. I don't know him. I don't know if I ever spoke to him before, other than to say hello. But I think he's a nice man. We had a very nice call.
Do you want to seek now the counsel of some of your predecessors, George Bush,
No, but
Barack Obama?
no, not really. We're doing a great job. Hey, this administration, we inherited a broken system, both militarily, where we've rebuilt our military, where we now have so much ammunition, whereas you remember a very important general said, sir, we have no ammunition. They wanted to save money on ammunition. They didn't want to save money because they spent money like nobody ever spent money. But you know what? We now have a great military rebuilt, and we have so much ammunition, we don't know what to do with it, okay? And that's a nice feeling to have. But they also gave us empty cupboards. The cupboard was bare. You've heard the expression, the cupboard was bare. So we took over a stockpile where the cupboard was bare and where the testing system was broken and old. And we redid it. And frankly, it would be okay for a small event, but not for a big event. And they had a chance to do it. Somebody said that a certain person, I won't tell you, but a certain person said this will happen. And that's true. The problem is that person never did anything about it. Previous administrations, they never did anything about it. You know, we all know all about pandemics and all of the things that we're seeing now, but nobody thought it was going to happen. And if we did think it was going to happen, the problem is nobody did anything about it. We did. We have rebuilt the system, and now we're a fine-tuned machine. We built thousands of hotel beds for New York. We moved a ship in that now we're going to make for COVID-19. We are going to make it so that people having this horrible thing happen to them will be able to use the ship. The ship, as I said, is going to be shared with New York and New Jersey. We've done things that are incredible. When you build, 18 hospitals? We built 18 hospitals. We built medical centers all over the country. And when you have Gavin Newsom and other governors who really have been very nice and generous in their statements, because they make the statements to the press, not just to my face. Others tell us how great we're doing, like the call that Mike had today. I heard from other people that were on the call. He said it was incredible. It was 2 hours, and everything was positive. They were so happy with what we've done. And we're ready to do more if they need it, because we're ready to march. The Admiral can tell you, we are sitting there with 9,000 ventilators, and we're ready to march when we see that we can move very quickly. As soon as we see that need, we can move very quickly. We're ready to march. We built a great system. The problem is the Democrats, like a guy like Chuck Schumer, is a total lightweight, by the way. I've known him for a long time. He'll say, why don't you put a military man in charge? Military man? I have all military men. This man is doing an incredible job. We have 2 admirals, numerous generals. We have the Army Corps of Engineers. We have FEMA. We have this whole force that like nobody's ever seen before. We have a great military operation, and they've done an incredible job. And honestly, people should respect, because nobody's ever seen anything like what we've done. And what they end up with, forget about me, don't worry about me. I will only get bad. If I say, how many ventilators do you need, Governor? 1,000 would be great. I said, nope, I'm going to send you 10,000. And then you'll call up from the media. You'll say, how did Trump do? We're not happy he didn't send us enough ventilators. Because that's called politics. But if you look at what's happening, and I'm even surprised, the governors are saying all good things, but the Democrat governors, and a couple of rhinos, frankly, they're rhinos, that's all they are, one rhino in particular, but the governors are saying great things. He had a call that lasted 2 hours today. I heard about the call, not just from Mike. It was a perfect call. Now, I'm sure you were on the call, even though you're not supposed to be. I'm sure you were on the call, meaning some of the media was on the call, because they're constantly reporting the call. If they're honest, they will say it was a great call. Okay? Okay, next question, please.
Mr. President?
Here we go. This one.
So,
Here we
you
go.
didn't mention the hospitals that were built in New Orleans and Dallas today, but you've mentioned them a number of times previously. There seems to be some concern in Texas that they might lose the hospital in Dallas if it's not
We're
used.
never going to do anything that hurts
if
Texas.
it's not used yet.
We're only helping Texas.
Is there-
By the way, the governor's doing a great job over there with this situation. And Texas is so big, you have some parts of the state that are affected, other parts that aren't affected at all. You know, it's an incredible place.
But can they keep this hospital even if it's unused? Or is the federal government going to shift those resources elsewhere?
No, we're going to use whatever we need, and we're doing it totally in conjunction with the governor. Okay? We're doing it in conjunction with your Texas governor, who's done a fantastic job. Great.
Governor Abbott also has set up checkpoints at the border to check people coming in from Louisiana. We've seen checkpoints in Florida, other state borders. Americans are not
Very
really-
few people are coming through our border, and you'll be happy to know we're up to mile 161 of the wall.
Internal borders between states.
Oh, I see,
Americans
okay.
are not
But
used
on the
to
border
seeing-
between Mexico, we have 161 miles of wall.
About internal borders.
Okay.
Americans don't, they're not used to seeing border checkpoints between states. How much longer, and is that something that states have to deal with you?
First, you want us to call 8 governors and tell them to do something, and then you're complaining that another governor is so strict that he actually checks the borders. I understand why he's doing that, because he knows who he has, and he doesn't want people coming in if they should maybe, you know, not be to the liking of the doctors. No, I think it's, look, he's done a great job. He's done a great job with this case, as have many other governors, but he's done a great job. One of the things I thought you were going to say is we've been very tough on our southern border, as you know, very, very tough. And part of that's because of the fact that we have so much, you know, when you talk about 160 miles of new wall, nobody's coming through that, nobody, not even close. And we're building it rapidly. We will have, early next year, we'll have close to 500 miles of wall, which is what our goal was.
You mentioned Senator Schumer just a moment ago. He had a conference call today, and he said that he believes that a COVID-4 relief bill will be necessary. Do you share that belief, and what would be contained in such a bill?
I don't know necessarily, but I certainly want to listen. And what I want to do is 2 things. A real infrastructure, not a Green New Deal. You know, the carbon footprint. I'm not looking for the carbon footprint. We want to put people to work. But a real, and frankly, for so many years, we've let our infrastructure go to hell because we were wasting all our money in the Middle East and other places, okay? I want to rebuild our country. I don't want to rebuild. We're tired. We've rebuilt, if you call it that, or destroyed, frankly. What we've done is so crazy. What we have done, the direction that this country has taken is so sad. But we're in the Middle East for $8 trillion. And if you want to fix a pothole in a highway, you can't do it because they don't want to give you the funds. So we want to have an infrastructure bill, a real one, like in the vicinity of $2 trillion to completely rebuild our roads, our bridges, our highways, our tunnels, everything. And I'm totally open to listening to that. I'm also open to listening to and even putting forward, because we're going to be putting something forward, more money for our citizens, because they've gone through trauma. This has been trauma. This came out of nowhere. And I say it, and I'll say it again, we had the greatest economy in the history of the world. We had the most people working in the history of our country, almost 160 million people, far more than ever before. And then one day, our professionals correctly came to us, and they said, sorry, sir, we have to close down our country. And I said, say it again. Say it again. We have to close down our country. And the entire world closed down because of this hidden enemy. No, we're going to take good care of our people. It was not their fault.
Dr. Birx to clarify something that she said on Saturday, sir.
Go ahead. Yes, please.
May I ask Dr. Birx to clarify something that she said on Saturday? If I may, Dr. Birx, this is a question that comes from a radio colleague of mine, Tamara Keith. And on Saturday, it sounded like you said that for the next week, people in high-risk areas should not even go to the market or the drugstore. Is that what you meant to say, or is that accurate?
You know, out of respect for every single healthcare worker that's on the front line, whether they're a nurse, a doctor, a respiratory therapist, the phlebotomist, the persons who come in the rooms to clean. You know, out of respect for them, we as Americans should be doing everything possible. And what I meant was, if you can consolidate, if you can send one person, the entire family doesn't need to go out on these occasions. We really need, this is a highly transmittable virus. We've been saying that we want every American to know that what they're doing is making a difference, but we need to have solidarity of commitment from everyone to really, so, you know, maybe once every 2 weeks we can do a grocery store and pharmacy shop for the entire family. So it was really about, we have to do everything we can. I know I see on the TV stations the level of human suffering in the hospitals. Dr. Fauci and I and Admiral Giroir have spent our lives taking care of others. We need to take care of each other now as Americans and do everything that's in those guidelines. And I know they're tough. I know incredibly how tough they are. My grandchild of 10 months got a fever of 105 this weekend. I'm the doctor, and I couldn't get there. I mean, so I'm trying to explain to my daughter how to listen to her lungs, how to listen to her lungs,
So
and then the baby's lungs.
You did not get there?
I did not go there.
Good, I'm very happy with that.
Because of you two. I mean, when you can't take that kind of risk with the leaders of the country.
Your grandson's okay?
So, daughter, but she's
That's
coming
a lot
out
of
of it.
temperature, 105.
Yes. But, you know, we're all, and that's just an illustration that I know you all are making sacrifices, and I guess I want everyone to take this seriously. So that was really a call of seriousness of how important this is and how we're starting to see the impact, but you can see what can happen when you come at this a little bit too late. And that's why the message, before you see it, before you have to see your hospitals and your emergency rooms overwhelmed, it is on us as a member of this community, of this country, to do everything possible to save one another. And so that was really what I was saying, and I will continue to say that, because I do believe it's making a difference. You can start to see it making a difference, but we have to do even more right now, because that will predict where we are 2 or 3 weeks from now.
Thank you, Deborah. And it is making a big difference. I saw where Governor Cuomo was a little bit upset today over the weekend. A lot of people outside, and they were pretty big groups of people. I saw that. I noticed that, and he wasn't happy with that. And I could understand that. Look, we have a short period of time. Hopefully, it's a short period of time to go, and let's get it done. Let's get it done. Kristen, did you have a question?
Yes, I did. Thank you.
You're so quiet.
Follow to just got here. Apologies.
Because you have your own show.
No. Quick follow to the question about legislation. I know there's discussion about a phase 4, but are you also looking seriously at a second round of direct payments? And are you putting discussions on a potential phase 4 on hold for now while you pursue that?
Well, I was opposed to the way of distribution, money distribution through, as you know, unemployment and through the state offices, because they have very old, not all of them, but many of them have 40-year-old equipment, as I've said, and it makes it very difficult. But that's what they're looking, that's what they want to do. That's the way it's mandated to do. I thought it would be better if we did a direct payment system, but the Democrats really wanted it, and I think they had some help from a couple of people that I would have, had I spoken to them, I would have convinced them otherwise, I really believe. But it's getting out, and the federal government has done its job. All we can do is give this massive amount of money to the states. The states then are responsible to distribute it, a little bit like we're talking about here. But the money will be right on time from the federal government. Then the states have to do their job in getting it out.
There need to be a second round of those payments.
We could very well do a second round of direct. I would do it direct.
Is that under serious discussion right now?
It is absolutely under serious consideration.
And in terms of Chuck Schumer, he also said he spoke to your chief of staff about potentially appointing a czar to oversee the supply chain. Is that something that you would consider doing?
But we have people that are so talented. I know the people he suggested. They're wonderful people. They worked here. They're wonderful people. He's just doing that because it's politics. Because you know what?
Right now, Mr.
We have many, depending on what. In terms of testing, this gentleman right here. In term, you know who the point person is? This gentleman right here. He's the one in charge of the task force. But Mike, you may want to tell him about the, because this is really a military operation.
Mr. Vice President, in terms of the supply chain.
Let me answer your first question, if I may, because it's a very good question, and I spoke to Senator Schumer night before last about just that. When the president signed a declaration of national emergency, he stood up FEMA as the lead agency implementing his policy to marshal a whole of government response. And under FEMA, we provide federal support. The state manages the healthcare response, and healthcare providers and first responders implement that response on a local level. Our lead on this issue in implementing it is Administrator Pete Gaynor. But the man managing all of the supplies, and you heard a presentation this weekend about our air bridge, what we also call the control tower. We literally, with Admiral John Polovchik at the helm of our logistics effort, we have visibility now on all the supplies that are moving across this country and into this country from around the world. It really is extraordinary. I mean, when the president tapped FEMA to lead this effort, we essentially wanted to say, we want to organize this in a military fashion. And we tapped really someone who is widely regarded as the #1 supplies and logistics military officer to do just that. He really is an extraordinary individual. Admiral Juar has known him for a long time. And to be working with Admiral Polovchik, we speak every morning. Our team reviews the data. We go over that with Administrator Gaynor and Admiral Polovchik. We talk about an extensive team that's identifying supplies around the country and around the world. And then, as we were explaining to governors today, we work with the requests that are coming in from states with a priority on the areas that are dealing with widespread outbreak, like the greater New York City area, New Jersey, Louisiana, focus on Detroit, focus on Chicago and Illinois. And then what Pete Gaynor and Admiral Polovchik are doing is directing those commercial distributors to send the resources directly to the front lines of the battle against the coronavirus. It is an extraordinary system. And as I explained to the governors today, as I've explained to congressional leaders, who've made what I think is a good faith recommendation, that we organize this in a manner of military logistics. It's exactly what President Trump has done, and it's what we're doing every single day to make sure that healthcare workers, to make sure that the states that are dealing with a widespread outbreak of coronavirus can be confident that we're going to spare no expense, leave no stone unturned, and use this extraordinary apparatus centered in FEMA to get the people of our country what they need when they need it to battle the coronavirus.
And Kristen, when Schumer makes a statement like that, he's only doing it for politics. He knows. We have the best generals, the best admirals, we have the best people. These are incredible leaders. These are vibrant people. They've done such a good job. And again, you'll get a tape of the conversation, because I'm sure some of the governors probably had their favorite reporter listening to the conversation, even though they weren't supposed to, but that's happened before. Just so you understand, we had a call today that was a beautiful call, everybody friendly, everybody happy. They also know in some cases we'll get them a little bit more, and if they need it, we'll get them a lot more depending on where this monster is going. But when Schumer does that, take a look at the past. Well, you're going to have to tell me who. They certainly don't. Well, yeah, some Democrats, because they view this as a campaign issue. They want to make Trump look as bad as they can because they want to try and win an election that they shouldn't be allowed to win, based on the fact that we have done a great job. We built the greatest economy in the world. I'll do it a second time. We got artificially stopped by a virus that nobody ever thought possible. And we've handled it, and we've built a team, and we've built an apparatus that's been unbelievable. Take a look at the swine flu, right? That's H1N1. Take a look at that. And it's not the other way around, by the way. It's H1N1. You know what I mean by that. Take a look at the swine flu. It was a disaster. 17,000 people died. The other administration, they didn't even know. It was like they didn't even know it was here. And that was peanuts compared to what we have in terms of the power, the magnitude of what we're going through. This is attacking 182 countries simultaneously. So Schumer's just all about politics. I've known him almost all of my adult life. And he's a disgrace. In many ways, he's a disgrace. And he knows it's done. He just wants to do that. But he knows the job we're doing. Everybody's amazed at the job we're doing. And the public is starting to find out. One of the reasons I do these news conferences, because if I didn't, they would believe fake news. And we can't let them believe fake news. They see us up here. They see us with admirals. They see us with this talent. They see the job that Mike Pence has done, which has been an unbelievable job, an unbelievable job. I put him there. I thought he'd do well. He did great as the governor of Indiana, and I thought Mike would do well. He's done much better than well. And he gets along with people, I think, much better than I do. Because I like people being 100. Mike can put up with things that sometimes I say it's amazing that he can put up with it. But he's done an incredible job, and so has the entire team. This is a military operation. And again, we built 2,900 beds in Javits Center. We build medical centers in New York. In Chicago, we built 1,000 beds, much more now, in McCormick Place. That's their big convention hall, the equivalent of Javits Convention Hall. Big McCormick Place, fantastic place. By the way, the mayor of Chicago, at least on the phone, is extremely happy with what we're doing, thanking us, has a great relationship with Mike, thanking us. And I just wish the politicians would say to you what they say to us, really. And it's a good question. Do you have one? Yeah, please.
Yes, Mr. President.
We'll get
A national security question and then a question about Governor Cuomo. The national security front, to the extent that you can comment on this, your administration is making heavy preparations to move against the cartels in Latin America right now. And could you
said
expand,
Latin America?
Yes. Could you expand on the reasoning of why now? Are there supply and logistics especially weak? Is it political?
Yeah.
What's the reasoning?
Good question. We've moved a tremendous number of boats and ships to the area of, different areas of exactly where you're talking about, because we're tired of drugs pouring into our country from other places. And we're tired of seeing drugs pouring into different parts of Latin America, South America, and just coming into our country. Now we've got them stopped at the border, and they're trying to do it by sea. So we stop them at the border and frankly, with the help of Mexico. Mexico right now has 27,000 soldiers on our southern border. They never had any soldiers. They're doing that because I've asked them to do it. That's the only reason they're doing it. They have 27,000 soldiers. So now they're trying to bring it in by boat and by ship, the drug lords and the people doing drugs and trying to destroy our country from inside with drugs. And we're hitting them very, very hard. And that's why we're doing it.
Activities that U.S. assets are targeting, or
Say it?
Is it beyond narcotics? Are there other illicit activities that
Well,
U.S. assets are
there are the activities of human trafficking, and especially with respect to women. And as you know, proportionally, it's mostly women. And it's a horrible thing. It's a horrible thing. And there's never been a time like it. And it's because of the internet, and this is all over the world. But for the most part, they're coming through, in this country, they're coming through the southern border, but we're hitting them very hard. They have tremendous illegal trafficking in women and children also, but mostly in women. And it's illegal, and it's horrible, and it's disgraceful, and I've seen things that are an absolute disgrace, and we're trying to knock them out, and we're knocking them hard. And again, I want to thank the president of Mexico, because he has really stepped up to the plate. 27,000 soldiers. They've never had any soldiers on our border. And I did that because the Democrats will not approve anything to stop, because they want to have open borders. They want to have all these people flowing through our border. And in many cases, they're sick. They have problems that you don't want to know about. Or they're criminals in many cases. Not in all cases, but in many cases. And they don't want to have, they want to have open borders. They want to have sanctuary cities. So they protect criminals. And I don't want to have it. And Joe Biden does want to have that also, as you know, because he said that during numerous debates. I want to have strong borders, and I don't like protecting criminals with sanctuary cities. But we're doing it for drugs. We're doing it for human trafficking. We're doing it because you have to do it. We either have borders or we don't have a country.
All right, go ahead. Mr. President, on the question of antibody testing, which is FDA approved now but not widely available yet. I know the Admiral said by May you expect to have millions available. How are we going to prioritize who's going to get the antibody tests, and what is that going to show you? Do you think that's going to be immunity?
I mean, I have an answer, but I'd rather have the Admiral answer that.
So let me clarify, and I know you probably understand this, is the antibody test does not tell you if you have the active virus in your nose. If you're positive for the antibody, it strongly implies, it means that you have had the virus before. And to the degree that we know of medical knowledge, you will probably, highly probably, be protected against getting the virus again in the future. So I want to make something clear. There's no antibody test approved. Okay, approved is not a word we talk about. There is a test or two that has received emergency use authorization, and many, many, many others out there that have not gone that way yet. And I want to take this opportunity to caution. There is a very consolidated effort between the FDA, CDC, NIH to validate some of the tests that are on the market right now, because it is very important that they actually do what they say they do. And we have reason to believe that not all of them are going to perform well. I don't know the primary source, but the Financial Times just reported that the UK had 17.5 million antibody tests that they bought, and none of them work. So we're not going to get in that situation. We're going to be very careful to make sure that when we tell you you're likely immune from the disease, that test really said that. Now, I will also make a statement, and there's a lot of work on here, and I'm very excited about it. As opposed to the tests for a novel virus, the antibody type tests are very sophisticated technology, but they're old technology. This we expect to have many tens of millions of tests the first month that we are really sure that the test makes sense. So this allows for surveillance screening, and Dr. Birx is one of the world experts to understand, is 1%, 5%, 20% of Americans have been infected. But it also allows us to have very widespread tens and tens of millions of people screened with a finger prick on the spot.
By when? Just to be clear, by May you're saying this will happen? Or
science doesn't run on rails, right? So we need to make sure that the FDA, the NIH, which they're actively doing right now, assure that the tests that they're testing really do perform the way they should. And if things work out the way we believe they will, we will have millions on the market by May in a sophisticated way, in a prospective way, that we get the surveillance we need. We can test people to see if they've been exposed, immune, and go back to work. And a combination of that kind of test with the current kind of tests we have now is how America opens back up again.
And how do you prioritize who gets those tests? I mean, tens of million, we're a country of 300 million. How do you determine who you're going to have that test?
Well, we are having active discussions under the leadership of Dr. Birx and the task force, but you can imagine how that is, right? But with tens and tens and tens of millions of tests per month that are available, you could really do very widespread testing. But let me just give you an example.
Which nobody else can do, by the way. No other country can do.
I'll just give you one example. It would be very important to know if the virus is still circulating here, whether, for example, a healthcare worker or a long-term care nursing home worker is immune from the virus and can't carry it. Very, very important to protect our elderly in that situation, but also, if you haven't been exposed, to make sure that you really take precautions and maybe take care of the people who don't have the virus and you don't have the virus. So it's complex, but it's not complicated on how you go about looking this in different segments of society. And I don't want to take too much more time at the podium, but antibody tests are a different thing. They're coming. We're highly confident that this can be scaled very rapidly and provide us a bit of information we just don't have now.
Jeff, go ahead.
Mr. President, may I follow up on what you said?
A few more. We'll do a few more. And then Mike is taking over, and you're going to see some incredible work that's been done. Go ahead, please.
May I please follow up on what you said with regard to Captain Crozier before? You said you didn't want to punish him for having a bad day.
He had a bad day or bad week.
Does that
but
mean?
I don't. Yeah, I'm going to look into it, and I also think our Navy Secretary is a highly respected man. So sometimes that happens with people, and I'll take a look at it.
What do you mean by that? Would you consider reinstating him?
When he sends a letter out, and he sends copies all over the place, and it's not a classified letter, and it was very disconcerting to the families of the people on the ship. Very disconcerting. So number one, they get worried and scared. It was weak. We don't want weak. But I'm going to take a look because I think he, looks to me like he's an outstanding guy. I looked at his just a little while ago. I looked at his file. And people have bad days, and we'll take a look at it.
I guess my question is, what would you consider doing for him?
Well, we'll take a look. I want to speak also to the Secretary. I also want to speak to Secretary of Defense, Mark Esper is doing a fantastic job. And we'll, maybe I can help the situation out. I mean, you guys are saying, why is the president getting involved? And going, well, I like to solve problems. It's a problem, I don't want to see men hurt, women hurt. I don't want to see people hurt unnecessarily. Maybe we can solve it easily where, it's not life-changing. But he did a bad thing. Sending a letter out, and many, many copies, as you know. I don't know, I heard 28 copies. I heard a lot. That's a lot of copies. Plus, the letter was 5 pages long. I haven't read the letter, but I think it was 5 pages long, single-spaced. That's a lot of writing. He's the captain of a ship. He's a very important person of a very expensive ship, a nuclear-powered ship. He should be writing letters like that. But it happens. Sometimes I'll write a letter that I say, I wish I didn't send it. Not too often, but it happens.
Mr. President.
Go ahead. Yeah, go ahead.
Follow up on that, because the acting Navy Secretary, and I know you were asked about this, but I just want to try one more time. He did say in remarks to soldiers on the USS Roosevelt that Crozier was, quote, too naive or too stupid to be in command if he didn't think that writing
Well, I don't want to comment on what he said. I understand.
Use different language, Mr. President.
It's tough language, but I don't want to. Let's not get into that. It's tough language. Now, there are some people that think, oh, wow, he says it like it is. Look, he made a mistake. He should not have sent that letter. Or he should have gone through his chain of command, which is the typical way of doing it. He's in the military. He's a very important person in the military. He knows it better than anybody in this room what he should have done. And I'm sure he feels he made a mistake. But I'm going to look into it, and I'm going to see maybe we can do something, because I'm not looking to destroy a person's life who's had an otherwise stellar career, as I understand it. I looked at his file just now because I've been seeing what's going on. If we can save a person's career, I don't mind going after a person if they did something wrong. And, but this was a mistake. He made a mistake. I'm not justifying what he did. He made a mistake. Shouldn't be sending letters. He's the captain. He's a very important person in the military. You don't send letters, and then it leaks into a newspaper of all newspapers. That was a beauty, right? So you just don't do that. So it was a mistake. But I may get involved. I'll call Secretary of Defense and find out a little bit about it. And if I can help two good people, I'm going to help them.
Sir, on the tone seems to have changed a little bit since Saturday. Your tone seems to have changed a little bit on the captain since Saturday.
With the captain?
Yeah, is it the news coverage, or did somebody speak to you on his behalf?
I said when you asked me, and when the question was asked the last time, I said, shouldn't have sent the letter. I haven't changed. He should not have sent a letter. And it should have, if there's a letter, it should go classified, and it should go to his superior. And he shouldn't be jumping over his superior.
Sir,
it hasn't changed in that regard. The only thing that has played right up here with me is that I looked at his record, and he's been an outstanding person. If he wasn't, I wouldn't even be talking about this. He's been an outstanding person. He's had a very exemplary military career. I mean, he started off as a helicopter pilot. They called him Chopper. His name was Chopper. He was a great helicopter pilot. It's a tremendous skill. I know a lot about helicopters. And then he went to F-16s or F-18s, and he was a tremendous pilot. And then he's very smart. He studied nuclear energy, and he was fantastic. And very few people have the aptitude, they have the mentality to do that. Nuclear energy is very complex, it's very hard. Very few people can do it. And he did it well. And then he became the captain of a nuclear ship, right? He became replacement cost. If you look at replacement cost, $18 billion a replacement cost, right? So he's got, on a replacement cost basis, an $18 billion ship. You know, the President Gerald Ford, very expensive. That's, you know, the nearest thing I can think of, but they're spending money on that one like nobody's ever seen. So he made a mistake. He made a mistake. And maybe we're going to make that mistake, not destroy his life. Okay, a couple of more.
President, you mentioned medical professionals. You compared them to soldiers going onto the battlefield.
Yeah.
Many doctors and medical workers today, some have seen pay cuts. They're going into a certain environment where they're concerned about their own health, their families' livelihood, if something were to happen to them.
Very much in my mind.
As part of this phase 4, are you going to prioritize?
It doesn't have to be phase 4. I think it could be a separate phase when it's all over. Right now, I don't think they want to think about it. These people don't want to think about it. These people are incredible. They're not thinking about how much am I getting paid. These people are incredible. I've seen it. I see the spirit. I hear about it all the time. From Mike, from the Admiral, I hear about it all the time. These people are incredible. When it's all over, I do want to seriously think, maybe in the form of bonuses. These people are, what they've done is incredible. I just admire the attitude, and I've said it. They walk into those hospitals and they are seriously, you know, one of the things that came up with the Comfort, the ship, is that when we fulfilled the request of Governor Cuomo and Governor Murphy, and they're going to be splitting up, but, you know, a lot of things happen to ships when you do that. You know, it's a lot of, they didn't want to do this. In fact, they specifically didn't want to do this. Have patients that were affected with this horrible disease or whatever, the plague, because frankly it's a plague. That's exactly what it is. You'd read about it in the old days, the plague, and that's exactly what it is. But we're doing it. But when I see the bravery of these people walking through doors without their stuff, I mean, they're just getting, they're not standing outside, hey, let's get ready, they're running through doors, putting on the stuff that's not even on. I think it's incredible. I'm telling you, the nearest thing I can think of is soldiers in battle and soldiers going right into battle, because that's what they're doing. It's really, in many ways, it's the same thing. All right, how about one more?
One more question, Mr. President. You may have seen this, the Masters tournament has been rescheduled to November. 2 questions. A, is that an outgrowth of your conversation that you had with sports commissioners on Saturday?
I hope it's rescheduled. I hope football's able to start. I hope baseball can get to play a little bit. I hope basketball can maybe do their playoffs. I mean, hey, I have no interests or anything other than I want what's good for the country.
What about the U.S.
A lot of
Open,
people
which
are
you've attended
tired.
many times?
Yeah, a lot of people are tired of looking at games that are 5 years old. I looked the other day. I saw somebody. I said, "Wow, he looks great." I forgot. I said, "Oh, that was 9 years ago." I said, "He's really in great shape." Well, not in great shape now, but he was in great shape then. It was 9 years ago. You know, you get tired of looking at 9-year-old baseball games and playoff games that took place 12 years ago. I don't have much time to do that, frankly, but that's what people are doing. And they want to see sports. Sports are a great thing for this country. And I hope football can start. And I told them, I think you might be able to. They may very well be able to. I hope they can start, and I hope they can start with people in the stands. You know, we're not going to be separated. You have seats. Those seats are meant for people to sit next to each other. And when this virus is gone, people are going to be sitting next to each other. And just for the restaurant industry, so they understand, when the virus is gone, people are going to be sitting next to each other. One man said, I have a 200-seat restaurant. It's been great. But if I go by these rules, this 200 seats goes down to 60. I said, no. You have a 200-seat restaurant. That's what you have. But we have to wait till the virus goes away. It wouldn't even do well at 60. Frankly, there's a warmth to it also. There's a warmth, but not when we have the virus in the air. Well, ladies and gentlemen, thank you very much. So I'm going to let our Vice President take over. He's got some really interesting numbers, statistics, and I want to thank the Admiral. I want to thank Tony and Deborah and everybody else. I want to thank everybody that's working, and I really do. I see a lot of tremendous things happen. The therapeutics, the call I had today was one of the most exciting calls I've had in a long time. And again, I want to wish my best to the UK and the family of Boris Johnson. and we just hope he's going to be okay because he's a fine guy. Thank you very much, everybody. Thank you. Thank you.
Thank you, Mr. President. A few updates on the activity of the White House Coronavirus Task Force. Then I'm going to ask Dr. Birx to speak about what we're seeing in the numbers. We know we are at the beginning of what's going to be a very tough week in America. But as Dr. Birx will reflect, because the American people have been embracing social distancing, putting into practice the advice of state and local leaders and the President's coronavirus guidelines for our country. As Dr. Birx will describe, we are not only seeing remarkable progress in Washington State and in California, where the numbers remain low and steady. That's a great tribute to the people of both of those states and to all of their dedicated healthcare workers. But we're also beginning to see a leveling just at the very beginning. And she'll reflect on those in just a few moments. A couple of quick updates. At the present moment, the President has approved 50 major disaster declarations, and we'll likely be issuing a disaster declaration for the state of Minnesota before the end of the day. We've distributed more than $4.1 billion to states. And right after our incredible healthcare workers, we couldn't be more proud of more than 21,000 National Guard that have been activated and are working in states all across the country. During my conference call today, I learned that Governor Brian Kemp is actually using the Georgia National Guard to sanitize and clean up nursing homes. But National Guard are being deployed in a variety of ways all across the country, and to them and to the families of all these citizen soldiers, you have our admiration and our respect. As the President mentioned, our focus remains on the New York metro area, New Jersey, Louisiana, and then Michigan and Illinois. We're watching every area of the country, but those are the priorities today. And in that spirit, I spoke today, as the President did, with Governor Cuomo of New York. The President made the decision to open up the USNS Comfort to COVID patients. And he also informed the governor of New Jersey that we would be taking New Jersey COVID patients. So now there will be two facilities, one at the Javits Center that's all COVID, and the USNS Comfort that will be managing COVID patients. At the present moment, by this evening, there will be 2,179 medical, military personnel in New York City. And over the next 2 days, that number will rise to 3,000. Speaking with the governor, speaking with Mayor de Blasio, the President and I were informed that while we have surged ventilators, we have surged personal protective equipment, that sending in some relief for healthcare workers was vitally important. And so again, I want to emphasize that those are medical personnel, doctors and nurses and medical assistants who are on the scene now and will continue to arrive to a total number of 3,000. I spoke to Governor Phil Murphy of New Jersey. New Jersey is very much in the forefront of the coronavirus in America today. We want to commend the governor for his extraordinary leadership in the state. During our briefing today, we learned about the progress that they were making and also about the governor's decision to temporarily reactivate retired healthcare personnel in the state. And just as a reminder of all that we're dealing with, this weekend, Governor Murphy told me that New Jersey surpassed the number of lives that were lost on September 11th to the state of New Jersey. And it breaks our heart to think of that. And our hearts go out to all of the families of the more than 10,000 Americans who have succumbed to the coronavirus. We also, as the President said, we express our gratitude to governors in Oregon and Washington State yesterday for donating ventilators to help states at the epicenter of the coronavirus. Governor Gavin Newsom of California donated 500 ventilators. And I just learned that those will be going 200 to the state of Maryland, 50 to the District of Columbia, 100 to the state of Delaware, 100 to Nevada, and we'll also be deploying the remaining 50 to the Northern Marianas Islands and to Guam. And we want to thank Governor Gavin Newsom. The state of California has provided extraordinary and compassionate leadership for their citizens. They're making progress. As the governor said the other day, they're not out of the woods yet, but the numbers speak for themselves, and the generosity of the people of California and the governor is gratefully received. Beyond that, before I recognize Dr. Birx, let me just say that at the beginning of this challenging time, we want to challenge every American to continue to do what every American can do. And clearly, what we see in Washington and California, and what we are just beginning to see elsewhere, is put into practice the social distancing recommendations of the coronavirus guidelines for America. Listen to your state and local authorities. We really do believe that while this will be a week of heartache, it also is a week of hope. And as we see some of the cases beginning to level just for a day or two, it is our hope that what we have seen begin in the greater New York area and even in Louisiana and elsewhere will become a trend. But it only becomes a trend if every one of us continues to take ownership and continues to do our part for this 30 days to slow the spread. With that, I'll recognize Dr. Birx for the latest data, and then we'll take questions.
Thank you, Mr. Vice President. I think you heard very clearly our concern in the New York, New Jersey metro areas. This also includes Connecticut and Long Island. As we talked about, we did see a significant increase in Sussex County over the weekend. The weekend numbers are always difficult. I want to be clear on that because sometimes case reporting is not as accurate over the weekend. So we'll be watching very closely today's numbers and Tuesday's numbers. We're also very course focused on the New Orleans metro area, and that includes the 3 parishes of Jefferson, St. John's the Baptist, and New Orleans proper, and of course the Detroit area, which is Oakland and Wayne. As we mentioned before, we're continuing to track very closely out of concerns of it potentially reaching logarithmic phase in the Chicago metro area, the Boston metro area, the DC and Baltimore metro area, Indianapolis, the Denver area, and 2 regions of Pennsylvania, Philadelphia, and the Pittsburgh area, as well as Dallas and Houston in the Texas area. I had a very encouraging call because we also don't want to miss anything. Remember, I showed you a lot of states were very much under 25 and 50 cases per 100,000. There were a few standouts that we were concerned about, which was Vermont, New Hampshire, Idaho, and Montana. We had excellent calls today with their health commissioners, and they're they're on top of the situation. These were micro outbreaks that occurred due to ski events and weddings and nursing homes, and they were able to describe in critical detail the incidents and how they're tracking and tracing. So they are still doing full contact tracing through those areas, and I just want to applaud both a rural and metro problem, and I really want to applaud how many of the states that may have smaller populations are approaching this. That gives us encouragement of how we can talk about beginning surveillance activities at the same time we're following these very clear outbreaks and ensuring that there's full supplies based on the very granular data that we're utilizing. And I just want to thank the mayors and governors who get us that granular data and allows us to make these deep interpretations across all of the United States. We know each governor is concerned about their areas, but these metro areas cover different areas. So the Philadelphia area also includes southern New Jersey and Delaware, and so we have to really look at things very much as both the metro and the communities that surround those metros. And so all of those people, we ask you again throughout the United States to follow these very clear guidance. I want to just recognize both HHS, and you heard about the work that Admiral Giroir is doing, the work that Dr. Hahn and Administrator Seema Verma are doing, and also Administrator Engels in the work of HRSA to really ensure that our federally funded clinics are actively engaged in all of these aspects. But I also want to recognize the military, the medical corps, the nursing corps, and the medical subspecialty corps. These were my brothers and sisters for 29 years. It is highly unusual for the active force to be called into a domestic situation. I think that shows you how seriously we're taking this at the federal government level. In my 29 years in the military, I was never deployed domestically. So this is showing you how serious of an event we take this. If the military is deploying domestically, it is another reason for every American to be following these guidelines. Finally, CDC quietly launched a new website. It's you go to cdc.gov and you go to COVID-19, you can find their surveillance data. This surveillance data is bringing together our influenza-like illnesses with their syndromic management databases so that you can track the respiratory disease across the United States. The states are used to using this system. It's in emergency rooms, it's in hospitals, it's in doctors' offices, and it gives you insight, and you can see very clearly influenza A peak. You can see the influenza B peak, and now you can start to see the respiratory disease from this current outbreak. These are the systems that exist within the United States that will be strengthened in order for us to do comprehensive surveillance. So I just want to assure the American people, while we're working on these outbreaks, we're also working on bringing new systems together that have a comprehensive look across the country, building on the strong work of CDC as a public health institution, so that we can work county by county, community by community, state by state, to really understand where this virus is and where it will be, but also as an early alert for us in the future. So I just want to assure the American people that as we're working on the crisis of today, we're looking to the future to ensure we have the systems in place to bring those early alert systems together while we work on the antibody testing and while we work on continuing spreading and increasing the diagnostic capabilities that you see presented here. Thank you.
Thank you, Deb. And Admiral Giroir spoke several times when the president was with us, so he'll be here for questions, as Deborah Birx will. But Dr. Fauci, your thoughts, and then we'll take some questions.
No, actually. Okay, I just wanted to, okay, I will. It related to something I said yesterday about that somewhat paradox of everything going up at the same time that the feeding into this engine of this virus is starting to show some signs. So Governor Cuomo today reported an interesting data from New York, namely that the number of hospitalizations, the number of admissions to intensive care, and the number of requirements for intubations over the last 3 days have actually started to level off. So again, everybody who knows me knows I'm very conservative about making projections, but those are the kind of good signs that you look for. You never even begin to think about claiming victory prematurely, but that's the first thing you see when you start to see the turnaround. That doesn't mean we don't have a lot of work to do. That tells me, instead of saying, that's pretty good, it's we got there through mitigation. We cut off the stream of people who ultimately required hospitalization, required intubation, required all of the kinds of extreme methods. So we just got to realize that this is an indication, despite all the suffering and the death that has occurred, that what we have been doing has been working. So the call that I say every time I get to this podium is just keep it up, because this is going to get us out of it. This is our best and only great public health tool.
starting to see that across many states. We're seeing the level of hospitalizations and deaths is lower than what we anticipated.
Well, you're going to see it most dramatically, John, in a place like New York, where you see it goes up and peak, and then it will hopefully, and I think it will, come down. When you have places like Seattle, which and Washington State, who did a really good job from the beginning, it never really did that, so they were able to keep it down. And on the charts that Dr. Burke showed, when you saw California and Washington State, they were fortunate, they did a good job, that it never really got out of hand. So again, this is a big country, and you have a number of different metropolitan areas. I think if we do it right, you're going to see those who have not peaked will not peak, and those who have peaked, the New Orleans, the New York, New Jersey, Chicago, Detroit, and others, you're going to see the same thing if we keep our foot on the accelerator.
Further questions for the team?
Yes, sir. I'm just following up Dr. Fauci's comment earlier about what it's like going to be coming back to normal, and until there's a vaccine, that there'll be gradual steps towards restoring normalcy. Under that, short of a vaccine, does putting 80,000 people, fans, spectators in a sports stadium, or 25,000 politicos in an arena for a political convention this summer make a lot of sense, or does those sorts of things require a vaccine to fully protect the American populace?
No, I don't think that you're going to have to say that the country cannot get back to a real degree of normalcy until you absolutely have a safe and effective vaccine. It will be really evaluating the kinds of things, and that's the reason why it was discussed up here, why it's so important to have an antibody test so you know what the penetrance is in society. And then we have a situation where we don't ever want to get to have to mitigate. We want it to be able to contain. And by the time we have to face what's going to happen with this going back to normality, we will have in place the capability of identifying, isolating, contact tracing, so that it never gets out of hand. Ultimately, the showstopper will be obviously a vaccine where you can vaccinate people and you won't have it. There's going to be another issue that's going to be important, and it has to do with somewhat of a comparison, for example, with influenza. We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity, but I think it would have to be different than it is right now. So again, remember when you say normalcy, I mean, we could get back normally, economically and otherwise, without necessarily saying we're going to forget about the virus. We have to pay attention to this because we've had a very bad experience with this virus.
Dr. Fauci, can I follow up on that, please? Thank you, and this is for the Vice President, for Dr. Birx and Dr. Fauci, but can you give us a sense of, and I know you don't want to make any projections, but where we are with the numbers, because we saw that horrible number today, more than 10,000 deaths now in the U.S. Are we on track for those best case scenario numbers that you had laid out, the 100,000? Or are we potentially coming in lower than that at this point, given some of what you're seeing?
It just gives me an opportunity to thank and respect the modelers who have really worked on this, because there's a large number of them have worked very hard and done a lot of predictions. And what we did is we did predictions of predictions. We like to integrate data, and so that's where you come up with these numbers. I think Dr. Fauci and I both strongly believe that if we work as hard as we can over the next several weeks, that we will see potential to go under the numbers that were predicted by the models. And I think that is really two things. It is the extraordinary compliance of the American people and the diligence that they have mitigated with. Because remember, we are doing this strictly by behavior change. It's very hard to change trajectory of viruses on just behavior change. We have had difficulty in our past doing that. So that's what we're doing, and that's what the American people are doing. But the other side of that is the incredible insights that Washington State and others are providing on how to better care for the patients in the hospital. And so those two pieces are coming together that could have a dramatic impact on the predictions of the mortality from this disease.
So I'm glad you asked that question because I've said it a couple of times here. I want to say it again. Repetition is good. Is that models are good. They help us to make projections. But as you get data in, you modify your model. And I've always said, data always trumps models, always. So what I feel, and I believe that Dr. Birx also feels, that I don't think anyone has ever mitigated the way I'm seeing people mitigate right now. This has never happened in this country before. So I am optimistic, always cautiously optimistic, that if we do what I've been talking about over the past few minutes, we can make that number go down. I don't accept every day that we're going to have 100 to 200,000 deaths. I think we can really bring that down, no matter what a model says, because when the data comes in, they'll start to say, you know, maybe you are essentially overshooting the model. And I think that's where we can go. That's the reason why I like to always get up and tell the American people, it's the virus doing what the virus wants to do, and it's we as a society doing what we can do.
And let me just amplify that from a layperson's perspective. And the American people are doing it. I mean, the initial data, what we've seen in California and Washington, support the fact that the American people are doing these things, which is nothing short of loving your neighbor. I mean, the truth is, the threat of serious illness for most Americans is relatively low. But the threat of serious illness for seniors with underlying health conditions or anyone with an immunodeficiency is very high. And when we see Americans putting these principles into practice the way you all have been, it really means you're considering others more important than yourself. And I have to tell you, for the president, for me, for all of us, it's deeply inspiring. We just need to continue to do it for all of these 30 days, and we'll bring that number down. How about a couple more, please?
So, Mr. Vice President, when will you know, when do you think that you will know whether or not you will have to extend those 30-day guidelines, or if 30 days will be enough?
Well, the experts told us that somewhere around the middle of this month would be the peak. And as we begin to see a couple of days that might be the beginning of leveling, we're gonna watch that carefully, and we're gonna bring that information to the president. But for now, the decision is, and the request of every American, is to continue to put into practice all of the president's coronavirus guidelines, 30 days to slow the spread. And for all of you in areas that have been impacted broadly by the coronavirus, listen to what your state and local authorities are asking you to do. It will protect your health, your family's health, and it will save lives. Let's do a couple more, and for our panel, if you'd like. Jeff.
This is more of a personal question, but Dr. Birx, can you tell us if your granddaughter's okay? And
yeah, I'd like to know too.
Well, thank you. Due to the great care of my 91-year-old nurse mother and my daughter, she's down to like 100 to 99 now, but it was 3 days of 104 and 105, which is, you know, babies can do that, but it's very scary, especially when I couldn't assure myself that she was fine. So it was just some sleepless nights for me and them as they kept our fever down. So thank you for asking.
Do you have the virus?
Oh, no, I'm sure it's roseola or something. They have not been out of the house. They're not allowed out of the house. They've got 2 granddaughters, under 1, 2.5 almost, and 1 only 10 months, and my 91-year-old and 96-year-old. So no one is allowed in that house or out of that house because there's too much precious cargo inside the house.
How about one more question? We'll let
Thank
you
you,
all.
Mr. Vice President. For whoever wants to answer this, it's a technical question. So FEMA says that it is in the process of distributing 90% of each state's allocated supplies for the National Strategic Stockpile. And that allocation is determined based on population by the last census in each state. And the other 10%, it says, is going to frontline healthcare workers serving in the federal response efforts. So where are those healthcare workers in the federal response? And do you envision a scenario in which you could start giving states more supplies from the National Strategic Stockpile?
It's a really good question. And let me say the Strategic National Stockpile, and I'm going to have Admiral Giroir speak about his piece of that, has been largely deployed. We are continuing to replenish it in part with a small portion of what's coming in from around the world. You've heard about our air bridge, now more than 50 flights that have been scheduled that are bringing millions of supplies into the United States. What we're doing is taking less than 10% of that, put it into the Strategic National Stockpile, so we have that to basically provide for states on an as-needed basis. But the other 90%, that system that I just described earlier when the President was here, is working with the 6 major medical distributors in the country to deploy those resources to New York, New Jersey, Connecticut, Louisiana, Michigan, Illinois, the exact priority that you just heard Dr. Birx describe and that the data informs. And those decisions are being made every single day. And so while if a hurricane hits Florida or tornadoes or flooding tear through the state of Indiana, we're very accustomed to FEMA coming in, drawing from the national stockpile, providing specific resources. In this case, with a nationwide effort, what President Trump directed us to do was literally marshal the resources of the full economy to be able to make sure that we can meet the needs for personal protective equipment, ventilators, and all manner of supplies. And we're doing that in a small way through the Strategic National Stockpile, but in the largest way through that control tower system that Admiral John Polovchik is running for us, that is deploying those resources and making sure they're going straight to where they need to go. And as I said earlier, those decisions are being informed by the data, and they're literally being made by our team at FEMA on a daily and sometimes hourly basis. And we'll continue to keep you informed, as we did today, about where some of those are going. But let me let Admiral Giroir finish that answer.
I don't really have much more to add to that. The Vice President is certainly well informed about that. And I want to assure you that all the sourcing around the world, if it's there, we're putting it in our supply chains. We're buying more. Manufacturers are stepping up to the plate. And this is going not just by percent allocation, but it's going to the exact places that need it in the quantities that they need to take care of patients. And we want to make sure this is a two-way street. We get the data in from individual hospitals to know exactly what their burn rate is, exactly what they need. And we want to make sure that they feel comfortable that they're going to have supplies because they will. Because part of this is about potential shortages, some places. Most of it's about a fear of a shortage. If I'm a physician in an ICU and I'm not sure that it's going to be there, that's going to scare me. It's going to scare my nurses. So we want everyone to have that assurance that we will provide you what you need over weeks, periods of time, exactly to your need. And Admiral Polovchik and his team, and again, it's all military in there. I mean, he is the logistics guy for the Joint Chiefs of Staff, right? This is what he does. He is a wizard. There are more stars around me in the DoD part of the military than I've generally seen outside of the Pentagon. This is really being run as a military operation. I'm in the U.S. Public Health Service, so we're part of HHS. The Surgeon General and I have the honor of running that service. We are shoulder to shoulder in the field, in the military hospitals with everyone else. There are only 6,100 of us, 3,000 are doing direct patient care on a daily basis. We take care of the Indian Health Service, the Bureau of Prisons, those in detention at the border, et cetera. That's what we do. The other 3,000, over 2,000 of those are in the field already, taking care of patients directly, and we have more going out the door every day.
And if I could just follow up on that very quickly then, is it even worth then governors writing into FEMA if they've already received their 90% allocation and you're getting data directly from the hospitals to ask for more at this point?
This has been a very cooperative interaction. I bet I talk to 5 governors a day, and we talk out the issues and understand what they perceive in their state. They often help point us to particular areas that they feel need more attention or that needs more communication. So it's been very productive. I have to look up what governor goes to what state because that's not my world, but it's been a very productive interaction. So I think all of this is necessary. I'm on almost every governor's call with the vice president. They're very meaningful, they're impactful, they're informative, they're communicative. We talk to each other. But then we do get down to the individual hospital level because when the rubber meets the road, you got to know what the docs, nurses, respiratory therapists, the people who clean the rooms are an important part of the team. I want them to come to every work saying, it's not that I cleaned a room, I'm saving lives today. And they are saving lives by keeping the viruses off the surfaces and reducing transmission. So you've really got to get that granular, and we're to a point with Admiral P's. You have 2 admirals with the worst pronounced names in the world, so Admiral P, Admiral G, but Admiral P's team really has this covered down to the individual hospital level.
Thank you, sir.
Let me say, just by way of closing, because I thought that last question was helpful. We're interacting with governors every day, 7 days a week, and we welcome that. And while there are some resources in the Strategic National Reserve, we spoke about ventilators. We have some 9,000 ventilators on standby. We also have this vast array through the commercial system that when we hear from governors, we're identifying the needs. They're working every day to identify their hospital capacity. We went over governors today saying we need to know what your capacity is, what your normal capacity is, what your surge capacity is. We need to understand what your equipment complement is across the state. And governors have been doing this. They've been assembling that information. But I want to tell you, the governors across this country in both political parties have been doing a remarkable job. And the president's grateful, and I'm grateful. And I just want to know that those healthcare workers that they're serving and the families that those healthcare workers are serving can be confident that we are going to do whatever it takes to get them what they need when they need it. And every governor is working in that regard. Every hospital administrator is working in that regard. And the opportunity that we have, because the American people are stepping up so strongly and putting others ahead of themselves. In most cases, they're acting in a way that puts the health of others first. We're more confident today than ever before that we're going to be able to provide our healthcare providers and the states that are impacted with the coronavirus with the resources and the support they need to meet this moment. And we're just going to continue to work our hearts out and make that a reality. But I have to end with just a reference to the healthcare workers. You've heard these doctors talk about them. They're all healthcare people. You've heard the president talk about them. You all have seen them. And to think what these healthcare workers, doctors and nurses and medical assistants are doing every day, it inspires us to get up early, to stay up late, to keep working, to make sure they have what they need to be able to continue to do their job courageously. And I know I speak on behalf of every American when I say how grateful we are for each and every one of you. And in this very special Holy Week, I know millions of Americans are praying for our healthcare workers. I saw a picture that I sent out last night on Twitter. It was an article about a series of cities where doctors and nurses had paused to pray for the patients and the families that they were ministering to. And I just want to say to all those healthcare workers, I know there is a chorus of prayer going up every day for all of you. and with your continued courageous service, and with God's help, we'll get through this, and we'll get through it together. Thank you all.
And thank you to those of you who've been with us here on News Now. Just a reminder for you who are on our YouTube page with Fox 10 Phoenix, you can subscribe to our stream. That way you stay up to date each and every single day. And just a reminder also, we do have nonstop news that happens all across the country that we stream to each and every single day. Of course, the stream on coronavirusnow.com is a 24/7 stream. So each and every single day, all day long, we are bringing you the latest news stories about coronavirus across our country. Hey, let's take a look at the cases that we do have here in the United States. Since we just got an update from the coronavirus task force team, here's a live look at the numbers being reported from Johns Hopkins University site. More than 366,000 citizens here in the U.S., Americans, have been diagnosed with COVID-19. That number has continued to update here throughout that press briefing. And one of the things that even President Trump was talking about was the severity of COVID-19, who it's attacking. It's not only attacking our families right here, but families across the world. He did share his best wishes to Boris Johnson, who has been moved into intensive care as his symptoms have worsened with COVID-19. And Trump did mention that he does have U.S. doctors helping advise the team that's working on Boris Johnson. So our thoughts here from the News Now team also going out to him. Also, one of the things that has been happening here in the last little bit is Apple has said they are designing to produce millions of face shields for healthcare workers, all part of an effort to help workers battling coronavirus here in the United States. Their CEO, Tim Cook, explained in a video that he posted to Twitter, quote, "We've launched a company-wide effort bringing together product designers, engineer operations, and packing teams and our suppliers to design, produce, and ship face shields to healthcare workers." Now, the tech giant had previously announced that it has secured 10 million masks for medical workers. And Apple did debut a new COVID-19 website and app not long after that. So good to hear so many different, not only people, big companies have been stepping up. We've seen celebrities stepping up, and even locally, we've seen a lot of people stepping up. One of the stories our own Fox 10 team has posted about has said, if you're going to make your own face masks, the material actually does matter. Now, that's according to researchers. So thousands of individuals and organizations have answered that call to make those homemade masks, but they do say, just a warning, researchers have evaluated approximately 400 masks made by these community volunteers and found that some, if any, do work well. And so they said, we saw the possibility that we are facing a shortage of surgical masks in the hospital. We wanted to investigate the possibility of using cloth masks. Now, they go on to say, after careful analysis, researchers found the best homemade masks achieved about 79% filtration compared to the N95 masks, which achieved 97%. Some homemade masks, though, demonstrated as little as 1% filtration. So according to researchers, the best design was that of double-layer mask made of heavyweight quilter's cotton, and that's consisting of a thread count of 180 or more. So a double layer mask with a simple cotton outer layer and inner layer of flannel also had performed well. And the inferior masks consisted of single layer or double layer designs made of lightweight cotton. So just for those of you who may want to read on that, again, that's on our Fox10Phoenix.com page if you want to go read more about what to do if you have those homemade masks. that you want to make for people. But we're going to continue bringing you more news that's been happening here across our country. I know a lot of people have been thinking about what do we do financially. They may be a little bit in some financial constraints because of COVID-19. Maybe you're one of those people who got laid off. Maybe you only have one income at this time. So we did talk with a financial advisor giving some advice to people during this time. Our Fox sister station KTVU has that for us right here on News Now.
All right, joining me right now is Winnie's son, managing director and co-founder of Sun Group Wealth Partners. Here we are, Winnie, a new week, and the markets have started off on the right note. What are you seeing out there right now?
Well, some good news, right? The Dow is over 1,200 points and Nasdaq's up over 400 points. I think the main thing is we heard some good news this weekend. We saw that the Dow futures were already up even yesterday. So this is not completely out of the ordinary, but we're looking at investors being more confident because they're hearing that the coronavirus new cases developing are now a little bit lower than before. So they're hoping for light at the end of the tunnel sooner rather than later.
But you think overall, I mean, here we have a big jump right now, 4 or 5%. I mean, we dropped so dramatically over the last 3 weeks. We're not going to get that all back over the next 3 weeks if this trend continues. You figure there's going to be a slow growth if we continue to grow at all?
I think so. I think, we're certainly in bear market territory. There's no way around it. Today is obviously a good day. Hopefully we end the market on a plus day as well. However, there's so many more things that need to unwind still, right? We still have a tremendous amount of cases all over the country where people right now can't get back to work. They don't have paychecks. We see there's so many other issues, underlying issues that need to be sort of flushed out before we can get to a point where we see the market completely come back. So we want days like this. Days like this is totally normal. We'll probably see more days like this, but we should certainly expect that there's still going to be days where there's going to be tremendous volatility, and that will also mean days of correction, which means the market will be down as well. So don't expect this every day.
I'm thinking about those paychecks you talk about. A lot of people obviously not getting paid right now. For those individuals who aren't getting paid, or maybe they are getting paid, but they're let's say they're in their 30s or their 40s, and they have a 401k, there's always that debate. Do I open it up? Do I take money out at this time right now? What do you say to their clients who are maybe, they're not toward retirement age, but they are in their 30s or 40s, and they're having that internal debate?
Yeah, absolutely. We're seeing that all the time. We're getting calls constantly. Like, what do we do about our 401k? But if you're in your 30s and your 40s, you got to ask yourself, what is this money for? If the money is truly for retirement, then you've got plenty of years ahead of you. If you're probably got at least 20 years ahead of you. So you have to make a decision. Do you want to take a look at it? Do you want to try to rebalance what you currently have? Or you truly not want to deal with this right now? And actually, usually I would say it's great to have awareness of where you stand financially, but right now, it's okay to put it aside and not want to look at it. I think right now we got to figure out that this is sort of a long haul journey, and that includes your retirement assets as well. So if it means that you're ready to take action and you want to start adding more in because you still have a paycheck, great. If you're in a situation where you just can't deal with it because you're totally overwhelmed, then that's okay too.
A lot of those stimulus checks are going to be, hitting people's accounts fairly soon. What can you tell us, Winnie, in regards to when these individuals are going to actually get this money, and to emphasize again, this is a one-time payment, correct?
It's a one-time payment. Hopefully it's one of several payments. We don't know, but as it stands right now with the $2 trillion stimulus package, it's a one-time payment. You'll probably be receiving that payment, for those of you who will be receiving a payment, sometime next week, I expect. And then it'll probably go right into your checking account if the IRS has your checking information. Now, that being said, those of you who are not sure and you're like, well, I don't even know if the IRS has my information, then this is a great time. This week, you should actually jump on the IRS website, go in there. If you don't think they have your information, input that information. So ideally that your payment comes directly to your bank and not via check, because the checks aren't going to mail it out till like May 10th, I believe.
Got it. It's interesting because my mom is on Social Security, and so she's been getting checks. She was wondering, actually, and I didn't have an answer for her, so I'm going to ask you. But for those who are receiving Social Security, maybe even disability benefits every month, will they be getting this stimulus check?
Yeah, great question. My mom actually gave me a call as soon as she heard about this too. And she's like, I'm on Social Security. Am I going to get a check? Is dad going to get a check? And the good news is, yes, absolutely. If you're on Social Security, you're on disability, the IRS definitely has your banking information in most cases. So yes, you will be receiving that check. As long as you meet those criteria, you probably will be getting funds next week. So that'll be great news.
What about taxes? Are they pulling money? So if it's a $1,200 check, is it going to be a $1,200 check?
No, that's the good news. No taxes due on this. Is considered a tax credit. So that money is yours.
All right. For those who can save right now, and they want to put money away, and they have the ability to do that, retirement fund, emergency fund, where would you recommend? What are you telling your clients right now, Winnie, to where they should put that money?
Absolutely. I guess it depends on the person. If you're fortunate enough to have still a paycheck or income and you think, well, there's great opportunities here, you might be thinking like, how can I invest? So obviously, if you're younger, like we were talking about earlier, the 30-some individual, and you're looking at it, you're thinking retirement fund or emergency fund. Actually, I think you can almost accomplish the best of both worlds if you're in a situation where you can afford to do this, because there's some great accounts, like for example, the Roth IRA is one of my favorite accounts. It allows you to put aside money, after tax money, just like you would in your checking account or your savings account, but you can put in a contribution into your Roth and it'll grow 100% tax-free if used for retirement. Now, if you don't use it for retirement, let's just say even emergency come into, like, let's say the roof falls down or you need to buy, a house or something happens and you really need to take out your money, the contributions that you put into the Roth IRA, that portion you can take out at any time, no taxes, no penalties. But ideally, you probably won't have to take that money and they'll grow 100% tax-free for retirement. So it's kind of like a win-win in like the ideal situation.
Yeah. Looking at my phone right now, I don't really play the stocks here, but I do follow a number of them. I'm just saying who's having good days and who's having bad days. I know there are people out there who like to buy the dip, who like to, use this opportunity to make more money. And I mean, Tesla is just a company that comes out. It looks like they're having a positive day. Are there any other companies out there, or even if Tesla is one, that may be of interest to people who are looking to invest?
Yeah, certainly. I think if you're looking to invest, one thing I would say is stick with a diversified portfolio. Take a look at it. If you're still getting a paycheck, like Mike, let's say you're working, you still have that paycheck coming in, think about possibly doubling up on your 401k contributions right now to a nicely diversified portfolio. Of course, we love right now, we're loving U.S. growth, we're loving U.S. value, but long-term wise, you want to stick with a diversified portfolio. Now more than ever, you can always decrease that contribution into your 401k as you get closer to like the end of the year, the market improves. But right now, if you're looking for opportunity, that's the way I would do it. Double up, triple up on that 401k contribution.
But it's so hard to do that. Even if you're saying I'm giving 6% right now, at a time that we're living in, I guess it's just more of a mental challenge. Just say, hey, add another percent, 2%, 3%, or double up, as you say, and then just don't look.
Just don't look. But you got to be really honest. If you know for sure you're going to be fine, you're going to be employed for the next 3+ months, then this is something you can consider. But if you even have a chance, or you even feel like, I don't know, Winnie, I'm just like not sure, then I would say right now, keeping money in cash is a really smart way to do. And I think most people that get this stimulus check, I would recommend you do that. Keep it in cash, medication, groceries. That's where that financial lifeline is designed for.
All right, we talked a lot about individuals in this conversation. What about businesses, small businesses, big businesses? What do they need to know about the Paycheck Protection Program here?
Well, businesses are talking about this all over online right now. It's like the trending topic, the PPP, right? The Payroll Protection Program started on Friday. So if you are a small business owner, you have less than 500 employees, you're still keeping your payroll going, you want to make sure you get everybody taken care of, then you want to look at the PPP. It's something that most of the large banks are offering because most of them are SBA approved lenders. So you want to go there first, figure out where your business banking is, go to that website, website. I know B of A is already open, Wells Fargo open and closed, Citibank we're waiting on, and a lot of other smaller banks too. You can actually look for that, but I would start with your own bank first, because a lot of the lenders aren't allowing you to apply for the PPP on their website unless you have a previous banking relationship with them. So there's that sort of caveat. So, but this is a great thing. This is, in many ways, this is our forgivable loan. So if you're still paying your employees, this might be a great thing to have as a business owner as we go forward.
You know, one thing I'm not taking advantage of right now is because I'm in shelter, you know, I'm working from home or in the shelter in place, is at the gas pump. I mean, gas prices are so cheap right now, but you know, for many Americans, they're not driving anymore. But I wonder if they're going to go even lower.
You know, well, we'll see, because today the news just came out that the Saudis and Russians are going to come up with an oil sort of deal soon. So I think oil prices will probably stay at current levels. I don't know if they'll go even lower, possibly, but right now there's not that much demand. So there's just an excess amount of supply. So of course it could go down, but nobody's really taking advantage of it. Hopefully nobody's really taking advantage of it. But you know, what I would do on that note, Mike, is call your car insurance company and tell them you're driving less and get your premiums to go down.
Ah, nice tip. I didn't even think about that. I'll get on the phone right now. Winnie Sun, Managing Director and Co-Founder of Sun Group Wealth Partners. I appreciate your time as always. Have a great rest of the week.
Thank you, Mike. Take care.
You too.
All right, guys, going to continue on with more stories happening here across our U.S. And Claudine Wong, now she's with KTVU Fox 2 in the San Francisco Bay Area. She talked with a winemaker who's producing 8 million ounces of hand sanitizer and is hiring out-of-work bartenders to lend a hand.
I'm Claudine Wong, joining you from the San Francisco Bay Area, and joined now by Dave Finney of Savage and Cook Distillery with a absolutely gorgeous background there. Good morning to you, Dave.
Good morning. Thanks for having me.
So let's talk about where you are and what you're doing these days, because you know, as we all are, I imagine you are sheltering in place. You just have a beautiful place to do that.
Yeah, no, I snuck out outside of town where I live. Just because it's quiet out here and we have really good Wi-Fi. The Wi-Fi at my house is actually pretty horrible. So yeah, we're up in St. Helena and Napa Valley, and yeah, as you said, sheltering in place and getting to know my wife and kids really good.
Yes, I imagine that you are one of those guys who is working all the time, and so this is new territory for you to get to be at home as often as you are now.
Yeah, no, it's been great. It's I was telling somebody, you know, to get to play basketball with my son just about every day, you know, taking walks with my wife, helping my daughter cheat on her video schooling or whatever it is.
That online distance learning, yes, we are all learning to homeschool our children with a lot of help from the schools. Let's talk about your business, because so you've been in the wine industry for a long time, but Savage and Cook Distillery is your newest venture over on Mare Island in Vallejo. Really cool place, a really cool idea. You guys were up and going and had big plans, right, for your hundreds and hundreds of acres that you had on Mare Island to kind of develop that into a city of its own.
Yes, that's correct. So Savage and Cook, which is on Mare Island, was sort of what led me, you know, down to the island, which then led to the greater Nimitz group, the partnership that between myself and Galen Lawrence and Sebastian Lane, and together we formed the Nimitz group, which has purchased the remainder of the South Island, and as well as we're in negotiations with the city of Vallejo for the North Island. But my core business down there is Savage and Cook, which is a distillery where we distill mainly whiskeys, so bourbon, rye, and American whiskey. And when the COVID virus, you know, when everything started, we almost half jokingly made a small batch of hand sanitizer for friends and family. And then it was only a couple days later, we got a call from one of the major municipalities in the North Bay, and they needed something like 8 million ounces is what they were looking for. And, you know, that's when the sort of light bulb went off that, wow, this is really serious. And also I immediately got in touch with our, not only our local congressman, Mike Thompson, but Bill Dodd, our state senator, Autumn Burke, who's a assemblywoman down in Southern California, just tried to figure out what was really going on. And oops.
We lost you a little bit there. There you are again.
Yeah, I had my low battery went off. And once we realized sort of that it was a real concern and a major concern, we moved very quickly. I give my staff all the credit to find denatured alcohol, which was, no pun intended, evaporated, and we were able to get one of the last 30,000 gallons worth of that, as well as 1 gallon containers. They have to be specialized because of the high alcohol, and we just went to work. And currently we're doing about 12 to 15,000 gallons a week, and we're providing first and foremost first responders, hospitals, and then it just sort of trickles out from there.
So Dave, let me ask you, because, I've seen a lot of different companies across the country, wineries especially, or people who already had some of the products, or the know-how or the equipment to kind of be able to convert. At the time that you guys said, okay, here's the need, were you guys still also trying to run the business that you were trying to run, or had you already kind of shut down or scaled back?
It happened at the same time. Once we decided we're going to do this, it was very much, in fact, we were skirting the public relations aspect of it originally, because until we knew we could produce at scale, we weren't going to talk about it. So, we took the approach that if we're going to do it, we need to treat it like a real business and make a difference. So once we knew we could scale it, we immediately stopped distilling, converted all the tanks and pumps and everything, and our quasi bottling line, and switched over completely to hand sanitizer.
Yeah. So when you're making this, I think that what makes you unique in this is the amount, right, that you're able to do, in terms of how you compare that with full production of what you were doing at your other business versus full production of this, and has that kept people in business? How have you changed your business model, and how are you funding all of this?
So we're self-funding, and what we did is probably the thing I'm maybe most proud of is we were able to actually hire people, and we went out into the restaurant community, which we're very almost partners with in many instances, and we're able to hire out-of-work bartenders, waiters, waitresses, because it's very hand-intensive work. It's not mechanized. We don't bottle gallon jugs of whiskey, so we had to pivot there. So it's a lot of handwork. So we're just kind of going after it. And there's sort of 3 buckets the way we look at it. There's sort of the charitable bucket, the stuff that we give away. There's the other bucket that is where we have hospitals, first responders, and police departments, post office, where we give basically the hand sanitizer at our cost, which is, I think, 8 cents an ounce. And then there's the price that we sell it to, call it Frito-Lay or Tesla or major companies that are still in business. We have a third price, which is probably about 30% less than what hand sanitizer was selling for before this crisis. So
right. It's so hard to get it. It's kind of crazy. I imagine you have a lot of people knocking on your door.
Yeah, and what we didn't want to do is sort of profiteer from it, and that's why we wanted to have it below market rate. And just it's mainly to keep my people working and to have other people working. So, and also, sorry, go ahead.
Yeah, no. So how many employees did you have before this, and how many people were you able to hire?
It's hard because there's a lot of cross cultivation between our businesses, but we've hired on any given day, call it half a dozen to a dozen people, depending on what we're doing. And that'll increase if we're already talking about running 2 shifts. So we would be doubling that if needed. So
do you have enough? Do you have is the 60,000 gallons, is that about how much you're doing?
No, we'll continue now. We have a steady stream of alcohol coming to us.
Okay.
Because ours still is a craft still. So it's meant to run actually very slow to get a higher quality spirit, whereas there's, you know, much more industrial style stills out there. And so we have a constant, we have basically ships in, we put it together and bottle it. Another truck comes, ship in. So we'll just continue on until it's no longer needed. And it's kind of an ironic thing in that I've never been in a business where I hope it fails, because, you know, I can't wait for that day.
Yeah. I mean, do you have a projection? If you run it like a business, you predict out how long at least you'll be needing to do this, and how long have you kind of prepared for? I mean, it's good that you have the supplies coming in, because I think that that's been a huge issue of, is there enough? I mean, when people wanted to make their own at home, they couldn't, because they couldn't find all the stuff they needed.
Yeah, you know, I just decided, again, from talking to my staff and from the electeds, that, you know, I'm gonna make a bet, so to speak. And, you know, if this is available now, let's just buy it. And God forbid, again, it'd be a great problem if I'm stuck with a bunch of hand sanitizer, because that means that we're out of this. But you know, we're preparing to do this as long as it's needed. So, you know, weeks, months, I have no idea, but we'll just continue going and continue betting. I mean, we're still having to buy containers, and, you know, that otherwise are kind of useless to us.
And because this need is so, it's across the nation, but it is locally, and we are a hot spot in the Bay Area of trying to flatten that curve. Where do you prioritize? I mean, you talked about the three different kind of price points and where you get it out to people, and how you distribute it, but where do you decide to go first? I mean, do you start in Vallejo, which is the city that is home to Savage and Cook? Do you start in the Bay Area? Do you go to where there's the most cases? I mean, that's a very difficult thing when you have a lot of people asking.
Yeah, you nailed it. We started, you know, in our backyard. Mayor Bob Sampayan of Mayor of Vallejo is a good friend of mine, and so he was one of the first people that I called. And then it's been St. Helena Hospital, where I live, the Oakland Post Office, the San Francisco Post Office, the San Francisco Police Department. You know, it's the obvious. You know, you take care of the people taking care of people. Hospitals, of course, all first responders, and try to meter it out accordingly. We haven't, well, I guess we did kind of run out, but now we've got a system where I don't think it's going to be an issue, the supply. And luckily, people don't need like 5,000, although one person did need 5,000 gallons, but most people need like 100, and then, hey, we need another 100 next week. And it's that kind of a thing. So it's not, no one's hoarding it, I guess you could say.
That's good. That's good news,
Yeah.
because certainly we have seen that. Do you, you know, and I saw we in the pictures we were looking at before. Let me see if I can pull them up again. But when you're bottling this, how are you shipping it? Because you talk about the gallon containers and the different ways you're doing it. Are you, and then the bartenders and the people who are out of work, making it into smaller bottles? I mean, how are you giving it out?
So it's all in 1 gallon increments. And so we have Tuesdays and Thursdays, you can come pick up your order from the distillery, and then we're shipping as well as delivering. So we have, you know, a couple different flatbed trucks, and a great group of employees that have jumped in. One of them's holding the phone for me right now. But everybody's kind of stepped up and have switched from whatever job they were doing for the various companies, and are now concentrating on this. It's been an amazing effort.
Does it, you know, I think every business, when I talk to a lot of business owners and entrepreneurs, you have to have a kind of a model as to why you start the business, what you want from the business, what's going to guide you, your thesis statement, right? Or your, you know, whatever is the light that sends you one direction versus the other. You know, when you started Savage and Cook, you started it on, for people who aren't familiar with Mare Island, on a place that has a boundless, I think, potential, and a deep history, you know, as a naval base in that area, but also one that has seen some tough times. I mean, I think when you went there, it was for the long haul, right? And does that guide you in kind of how you've decided to move your business, and where you've decided to go, and the ventures that you start, on why you would go in this direction now?
Yeah, I mean, you hear the term impact investing. It's become very chic now. And I think that we don't consider what we're doing impact investing. It just philosophically felt good to know that our tax dollars would be going to a place like Vallejo that is an amazing, working class. I've been told it's the most diverse city in America, and to know that the money's going to go to, a place that needs it feels really good, and to be able to help out and be a part of the community. I mean, Vallejo, it grows on you pretty quick, and we've met some amazing people and continue to. So to be able to have a business, I mean, I live in a beautiful place, but to be able to have a business and know that our business is going to help contribute jobs as well as tax revenue for a city like Vallejo is awesome.
Within the industry, is there also some camaraderie on how to do this? I mean, and whether they're small wineries or small distilleries or competitors or people that you worked with. I mean, is there, because you guys have this ability, and I don't know how hard that transition was. It doesn't sound like it was. It sounded like you had to give it some thought, but not. It wasn't obviously impossible to do because you're doing it. Some joint effort within the wine and alcohol and whiskey community to together?
Definitely. The alcohol we're purchasing is from a company called Ultra Pure that we've worked with, for about 10 years now. And they were amazing and how quickly they reacted. And then I wish I could talk about some of the bigger distilleries that are friends of mine, and what they're doing is amazing. But they're very quiet and they don't really like to talk about it. But yes, there's been an amazing amount of camaraderie and support. And, we have the luxury of being able to do it because we already have a lot of whiskey laid down in barrels. But essentially, our transition equates to about $750,000 per month of lost, material. So that, my wife would say you're just dumb enough to do that. But I think that, that's, again, to be able to keep everybody working, to be able to provide a service, especially on Mare Island, which traditionally in time of crisis, that's what men and women did there. They produced, stuff to help the American people. So, I look at it as just, it's our turn now, and we're just doing what's, been done on the island for centuries.
Economically, how long can you continue to do it though before it's not just your wife, but it's the future where you have to say, we want to do, but shutting down, obviously you're not making money. I think the question is, how much money can you continue to spend when you're not making any?
It depends, and I have faith in the government and the stimulus package, and I think that this is one where you sort of don't ask permission, ask forgiveness. So I like to have faith in the fact that if we're doing the right thing, somehow it'll come back to us. And if it's through grants or loans or but it's actually not really what we're concentrating on now. We're just trying to get as much of this stuff produced and out to the public as possible.
And how long, just so I know, does it take you to make one bottle, or 1 gallon?
Oh, geez.
It's
yeah, it's about 2,500 gallons a day. So
2,500 gallons a day.
I guess I'm not good at math, but some number of minutes. Yeah.
Well, that's amazing. I think it's a commitment to both the area of, Vallejo and Mare Island that you are a part of. I know a lot of people in that area are very excited about seeing Mare Island develop and grow into something new. And certainly this is a time when, you're right, that naval base kept people together, and now thank you for being a part of keeping everyone safe today.
Oh yeah, no, it's just what you do.
It's just what we do. So, all right, Dave Finney from Savage and Cook Distillery, thank you so much, and thanks so much for all you are doing to keep our hands clean and keep that coronavirus from spreading. You stay healthy.
You too. Thank you.
And something we tried to bring you earlier, but then of course the press briefing had started. I want to go back to, I know a lot of people miss sports, so our team at Fox 4 Dallas Fort Worth did do an update, a week in sports, well, sorta.
The COVID-19 pandemic is affecting different people in different ways. They include some sports figures you might know. Some are struggling with the changes in their lives, and many others are just finding ways to help other people. More tonight from the Fox 4 Free-for-All team.
All right, we continue our work from home here tonight. Mike Ducey with Sam Gannon, Jeff Kolb with us, the entire Free-for-All Fox 4 Sports team here. You guys doing okay?
Doing all right. I don't know what day of the week it is, but you know.
Yeah, right.
Hey, hanging in there. I was growing quite the beard, but I've shaved, so it's over now.
Boy, Jeff overdressed for the home studio.
Very dapper, yes.
Today,
No,
yeah.
I'm not trying to show you up.
No, some sense of, I never worry about that. Some sense of normalcy anyway. We're going to talk a little bit about the effect of this shutdown on basketball teams in our area, the Mavs and the Wings. And let me start with Dwight Powell. I talked to him the other day. And Powell, well, you may have seen this recently on social media.
Out came a whistle. Yeah! Willie stopped and looked around to see who it was. It's me, Peter shouted, and stood up, and Willie raced straight to him. Yeah, I know.
Gabe, our buddy with the Mavs, one of the best MFFLs we have. All of us have a little relationship with him. We see him at games all the time. And when I heard he was doing his homeschooling reading time, kind of around the time when I was, obviously at home, his dad asked if I could do it. I said, of course, which was awesome. It was fun. And hopefully we get to do it again soon again. But and then today I got a chance to talk with some kids at the hospital and check in on them and see how they're doing in this kind of strange time. And it was great. They lifted my spirits. Hopefully I lifted theirs a little bit as well.
Powell, along with Luca and Mark Cuban, donated $500,000 to first responders in the COVID-19 battle. Of course, Cuban has been an impressive leader in this fight, not just in Texas, but nationally. And Powell has been impressed.
Extremely proud. I think that's one of the greatest parts about being a Maverick is the way that we've been taught from day one and shown through example of how to act in this community. And we have a lot of great fans that look up to us, and we're members of this community. So it's always been important for all of us to find ways to give back and find ways to be leaders. And Mark has done an amazing job for his entire time winning the Mavs and doing that. And I think that's passed down through the leadership of the team. I know Coach Carlisle does an amazing job of reiterating that message to us and setting an example. And then Dirk did a phenomenal job as a player. So my tenure here already, I've been able to pick up a lot on what it means and how to execute being a leader in the community. And it's no surprise to me that Mark stepped up in this situation, and he's tirelessly trying to find ways to help and unique and find the niches that need the most attention. And it's no surprise at all, and I'm truly proud and honored to be a Mav.
So, guys, Dwight Powell is recovering from the Achilles injury. He says this whole shutdown hasn't really affected him that much because he's early in that process, but he's anxious for basketball to get back, as is Mavs CEO Cynthia Marshall. And Sam, I know you talked with her today.
All right, guys, just going to switch gears. We'll go back to that story here in just a few minutes, but I do want to jump out to LA, where we do have the mayor. He's going to be stepping up to the podium. We're getting an update on coronavirus out in California.
Socializing could kill someone. And don't think that you can just leave whenever you want. We have strict recommendations, and our order only allows critical business workers and those critical trips. You can exercise in the neighborhood, but otherwise, please stay home. And if you think that your household is immune to this, we also saw in that poll that now 50% of households either have somebody with a serious medical condition and or compromised immune system and or somebody over 65. In other words, the most vulnerable people are in 50% of the households. And so you going out and coming home and thinking everything's okay may kill one of those loved ones that lives in your house. And I think a lot of people think this is still an elderly person's disease. But if you look at the county numbers, we have 34% of the cases are people 18 to 40, and 43% of them are 41 to 65. So together, you look at that, and that is 77% of cases are folks that are under 65. Second, please work with the city to ensure you're in compliance with all the safer at home orders. And I want to thank some people that have done that in this past week. Our farmers markets, when we suspended them, stepped up and stepped up big time. And I want to thank Streets LA, one of our departments here, the Bureau of Street Services, that worked closely, and 31 farmers markets are now approved. 16 of them were open yesterday, and I'm grateful to vendors and market operators for taking swift action to ensure good food is available to people, but also ensure that we're doing that safely. And if your local farmers market isn't approved yet, go to them and tell them to submit their plans at streetsla.lacity.org/COVID. We've also had more than 1,000 visits from our business ambassadors. These are our city employees and some volunteers from our crisis response team proactively going out in the city and looking at people who are not abiding by the orders. As of Friday night, LAPD visited 722 businesses that were not compliant with the Safer at Home order and has issued 37 applications for compliance. Let's be clear. The vast majority of that minority of businesses that we get a complaint about, 92% of them have been compliant, and less than 1% have been issued complaint applications. Third, let me make clear, there's no actual monetary reward for being responsible in this crisis. When I said, please give us that information, the reward is saving lives of somebody you love and maybe even yourself. And fourth, to help with the current blood shortage, I wanted to tell people, please, if you can, and we are authorizing this as under the order, something that you can leave the house to do, please, if you're healthy and able, please consider being a volunteer blood donor. This will save lives. And you can find out at redcrossblood.org where that is going on. There's proper personal protective equipment, and we'll make sure that you get in and out of there safely, but you can help save a life, and we're going to need that blood in the days ahead. With that, let me turn it over to Chief Moore to say a few things. He's actually going to just speak from where he is so we don't share microphones, to say a few words about enforcement, reductions in crime, and additional updates from our police department. Thank you, Chief Moore, for everything you've been doing.
Mayor, thank you. And on behalf of the men and women of LAPD, we want to say first thanks to the vast majority of Angelenos who are safer at home, who are honoring the mayor's directive, they're mindful of acting responsibly. It is through their work in staying safe at home that's going to allow us to get through this pandemic as quickly as possible. One of the attributes I've been asked about frequently in the last 4 weeks is how has the impact of the pandemic been on our rate of crime, on the instances of violence and other crime here in Los Angeles. And it is the one area of benefit, if you will, from this terrible virus, this terrible infliction of injury and pain in our society, is a 23% reduction in crime here in Los Angeles over this past month. We've seen reductions in crime in nearly every category, with the exception of auto thefts, which is kind of an odd area, but violent crime, property crime, people staying at home in their neighborhoods, watching out for each other, and exercising social distancing is allowing us to have a safer city. Additionally, on our traffic crime, while we have seen some increases in vehicle traffic speeds on some of our roadways, which we've directed our officers to begin having greater enforcement efforts on, we have seen a reduction in overall traffic collisions, hit and runs, DUI-related collisions, pedestrian collisions. So Angelenos, safer at home is a safer city. Now, as to one area that I saw in a newspaper account today, and one that we're particularly sensitive to, is because people are staying home and they're spending more time together, what does family violence look like? What is the instances of just the ability for people to get along in their household? And we recognize that in times of stress, in times of turmoil, that family violence can increase. I'm happy to say that to date, this past month, we haven't seen that increase actually manifest itself in reported crime. Family violence crime is actually down 11% from the same period last year. However, in an effort to ensure that people understand that while there's been a compromise to our ability to have front desk operations and for officers to be readily available to an individual in a face-to-face meeting, we want to hear from victims of violent crime. And family violence, there is no excuse with a pandemic or any other emergency to have to sustain that or endure it. This week, we'll be calling together a number of victims advocates from the domestic violence advocate community to sit down and ensure through a virtual town hall what are the hotlines looking like? What are they hearing from people reaching out and asking for help and support? And we want to remind every victim, every survivor of family violence, that we have a place for you, that we have a place for you, that you do not have to be home. You do not have to be secluded or isolated with someone who is committing violence upon you. With that, Mayor, I'd be happy to, one last thing you asked me to speak about was the enforcement of people from non-essential and essential duties. And again, the vast majority of Los Angeles are showing their better angels, but to the 37 individual cases which we have filed a criminal complaint with the city attorney, we expect to see fines and criminal prosecutions for that. This is not just irresponsible, it's endangering not just themselves, their employees, but everyone else in that community. And I'm proud of City Attorney Fuhrer and his work and his prosecution of those individuals to holding them and bringing them to justice. And with that, I'll give it back to you.
Thank you. Thank you very much, Chief, and thank you to the men and women who are serving us during this. Thank you to our City Attorney, Mike Fuhrer, for the prosecution that he has brought to let people know that we are serious, and we hope to hear from him in a future briefing as well. And if you didn't hear that from the Chief, secure your car. They don't know why, but make sure. And to anybody who'd be stealing cars, a lot of people are home, so watch out. There's a lot of eyes on you. Please report that if you see it. And for anybody who is stuck in a situation of domestic violence, as I said a few days ago, and may fear picking up a phone where you are, you can use your phone now to text 911. We're one of the first jurisdictions in the country to have that, and you can text the help that you need, and we will make sure that you get what you need. And we have expanded our domestic violence services and beds in this period to be ready for anybody who needs a safe place to be. With that, let me turn over to Chief Ralph Terrazas, who leads our fire department, does an extraordinary job. And I'll get the numbers from the chief, too, in terms of the number of LAPD folks who have come up as positive for COVID-19. But even in the face of that, for the first responders, who are the ones who often are the ones who are transporting, have really done a marvelous job keeping themselves healthy, making sure that we have the medical services that we need, and innovating. It's this fire department that's helped lead on everything from the testing that we've talked about doing to monitoring what's happening in our hospitals, and we're very grateful that you are here tonight. Chief Terrazas.
Thank you, Mayor. Thank you for the opportunity to share with you what the men and women of Los Angeles City Fire Department are doing to contribute to this battle against the coronavirus pandemic. First of all, we've been tracking the number of coronavirus cases since January, and we've seen a steady increase in the trend of the percentage of 911 calls that we're transporting to the hospital. Last week, our percentage was a little bit over 35%. So that's in alignment with all the studies and research going on. In terms of the state of the department, our staffing level is excellent. It's better than it's ever been. We have canceled all leaves. I'm sure that contributed, but our people always want to step up when the people of this city are threatened. So in addition to that, to bolster our staffing, we've accelerated the graduation of our current Jewel Tower class of firefighters. Approximately 50 firefighters are going to finish their training ahead of time so we can put them back in the field this Sunday, April 12th. Now, in terms of our daily call load, we're seeing a trend of about 10% below our daily average. Our daily average is about 1,368 911 calls every day. So we're 10% below the average. In terms of patient transports to the hospital, we're seeing a decline in the range of 35 to 40%. And our theory is that people are reluctant to go to the hospital for obvious reasons. They're fearful of contracting the virus. So right now, that is actually helping us. We do anticipate that that trend will change in the coming days and weeks. The next area that we're involved with, let me talk about the testing. We have had 13 members of our department test positive, 12 sworn and 1 civilian. We've been very aggressively messaging our firefighters to learn to know that when you approach a patient, you have to assume everybody has a coronavirus ailment. So we have to wear the proper personal protective equipment. We've also done videos on frequent washing of the fire stations and cleaning twice a day. Twice a day we take temperature checks of all our firefighters. If their temperature is above 100.4 degrees, we send them home sick. We can't afford to have anybody spread the virus. In addition to that, in the testing area, we have been staffing the testing site since day one. very proud of our people. It's something that we've never done before, but we realized we had to do this in order to protect lives and property. And our people have been amazing. But like the mayor said, we are anticipating we're going to need them in the future to staff ambulances and fire trucks. So I'm glad that we're transitioning out of that mission. Related to that, we have something today that is brand new. We've been working on it for a year and a half, and it was funded through Mayor Garcetti's Innovation Fund. That's our telemedicine program. And what that allows us to do is have doctors on our dispatch floor, so when a 911 call comes in, we can transfer that call to a doctor who can do a patient assessment. And they'll use FaceTime to look at the patient so they can do a visual assessment as well as ask questions. And today we've had, like I said, we launched for the first time. This morning I watched it in operation, and we had somebody call in who was worried about the symptoms of the coronavirus. They had all the obvious symptoms. So we communicated to that person to go to a testing site tomorrow. We did not have a dispatch. We did not have the threat of contaminating firefighters, contaminating hospital staff. We assisted in reducing capacity at emergency rooms. That will become more and more important as the days continue throughout this pandemic. So we've been doing a lot, and we're very proud of our people. We ask that you do what the mayor asked, to stay at home, use all safety precautions so that you don't have to dial 911.
Thank you very much, Chief. I think you can all see why we're so proud of this fire department, how innovative it is and its leader. I want to thank Dr. Eckstein, too, who has helped us with that telemedicine and our testing, as well as his counterpart, Dr. Kazan at the county, who together have really worked to expand our testing capacity. I promised you the numbers, and the Chief whispered them to me, Chief Moore, about LAPD. Today there's 47 LAPD personnel of almost 13,000 that have tested positive, and 250 people are quarantined. That may be somebody who has somebody in the household, or they had been exposed to somebody who's been exposed but are not tested as positive. And thank you, too, to Chief Terrazas for really highlighting how we can help preserve medical resources by having good interventions at the beginning. And thank you to our police officers who are helping in a friendly way enforce, but are ready to be tough if necessary, any businesses that are not abiding by our safer at home order. A couple last things, and then we'll open to questions, and both the chiefs are available for questions, as well as Mr. Sahakian. But as we brace for what I know I started with good news in terms of the number, and that's really credit to all of you, of coming down to a single-digit increase, but it's just one day. This will still be a difficult week, and even as we see that number come down, I want to be clear, the numbers still go up. In the last 2 or 3 days, we've had more cases than in the first 23 days. So there are more people that are getting sick, and that is something to keep in mind to motivate you to continue staying at home. But I'm also heartened by the bravery of all sorts of organizations and individuals, and I'd like to highlight a few of them as well. One is the International Medical Corps, which is based here in Los Angeles and works around the world, helping on everything from Ebola to medical emergencies we see continents and oceans away. And they are helping us surge our hospital capacity here in Los Angeles. Thank you. By deploying field medical units outside of County USC Hospital, Martin Luther King Community Hospital in Willowbrook, all of UCLA Medical Center in Sylmar, and with support from Providence St. Joe's Health, AbbVie, the Medtronic Foundation, and Martha and Bruce Karsh, they have come together to really use their expertise in the place that they are based out and usually leave from. This time the crisis is right here in our backyard. We're very grateful. And I want to thank my colleague, Catherine Barger, and all the Board of Supervisors, Hilda Solis, who's been helping so much with making sure we have new hospitals open. But I want to thank Chairwoman Barger for her key role in securing these field units for the International Medical Corps. As chair of the Board of Supervisors, she has been an unwavering ally and a great leader in this as well. And last week, the superstar Pink raised awareness about the seriousness of COVID-19 because she has survived it. Her positive test results came through. She got through this. But that's not all she did. She didn't just share that very bravely. She also stepped up to support Los Angeles' frontline work to the crisis with a generous donation of $500,000 to the Mayor's Fund without anyone asking. So thank you, Pink. You're a true angel in this city of angels, and thank you for helping those who are the least among us get food, get groceries, our healthcare workers to have childcare, have our seniors get meals. It's really extraordinary. And another extraordinary pillar of our community is the Weingart Foundation, who also stepped up with a $500,000 donation of their own. They've been with us for so many things, from the fight to end homelessness to help expand our Summer Nightlights program. But I'm very grateful that Weingart, under the leadership of my dear friend and their CEO, Fred Ali, once again answered the call when we needed help. And by supporting the Angelino campaign and the Mayor's Fund, led by Matt Johnson, Rick Jacobs, my wife, Amy Lane Wakeland, who I want to thank for all the calls she is making too. This is helping our neighbors who are experiencing extreme financial hardship. This has been so tough, and many people are not included in the federal help. So continue to give, and give generously by going to mayorsfundla.org. We know that physical distancing saves lives, but we know that we need more than just the help of slowing down coronavirus. We have to make sure we don't just save lives, but we try to preserve livelihoods as well. And I've also been overwhelmed by the response from private companies who have been just tremendous during this. Companies like Facebook, which are offering $1.5 million in cash assistance and ads to small businesses to keep them going, and for people to be able to shop online in local businesses that are here, and especially with minority and women-owned businesses. You see, we are defining what it means to be an Angelino. It doesn't just mean the most incredible sunshine and those beaches and those mountain trails that we will get back to together. We're also defined by our hearts. I've often said that Los Angeles isn't just a place that embraces diversity or inclusion. This is a city where everybody belongs. And it's time for us to continue proving that we all believe we belong here, and that we all believe that the lives that are here are worth saving and preserving and promoting. And that's what you've been doing. And I'm so grateful as the mayor of the city of Los Angeles to be a part of doing that side by side with you. So proud of how you have stepped up, so proud of how you have stayed home, so proud of the ways that you have helped one another in the midst of this crisis. And I know that we're going to look back in this as one of the darkest times in our history, but one of the brightest moments when it comes to our spirit and what you have been able to do. So, as I always say, stay safe, stay healthy, and stay home. Strength and love, Los Angeles. And with that, happy to answer questions, any of us. First question, please.
We have our first question from the line of Alex Michelson. Please go ahead.
Hey, Alex.
Hi, Mayor. We keep hearing around the country that the next 2 weeks are going to be, in terms of the worst weeks. Is that what you're seeing for the modeling for Los Angeles specifically? And on the issue of testing, it's great that we're going to be getting more tests, but what about the test results? How quickly are they coming back? Any update on that?
Great question. So the centers that the tests that we're doing through the testing centers that the city and now the county are running directly, we're getting them back pretty quickly, 24, 48 hours. Once in a while on the weekends, it might take 3 days. That's in big contrast to what we had experienced in a lot of the private labs who were trying their best, but were so overwhelmed that they were taking 5, 6, 7 days, sometimes even longer. Somebody called me and they were still waiting 2 weeks later for their test results. And that doesn't help us from a public health perspective. It doesn't help individuals be able to do the right thing. So the ones that we are running are getting a really good and quick turnaround time. We've worked with and set up with local labs, and we're trying to not do new partnerships where we can't get those results quickly. So far, so good on that front. In terms of the projections, the University of Washington study that I mentioned had California projected, it was just 4 days ago, they were projecting the peak would be late April, early May. Now they're saying mid-April. But I would say for Los Angeles and Southern California, I would caution, because we're having disproportionate number of cases here. As you remember, Northern California spiked earlier. So it's my expectation that maybe that's an average that they're projecting for the state, but for us it's probably a week or two later, so that we're still looking at that same time towards the end of this month, beginning of May, if we keep with physical distancing. If we don't keep with physical distancing, everybody's bets are off. And I was reading recently about San Francisco in 1918 during the influenza outbreak, how they declared victory because they had a very effective few weeks of physical distancing, keeping people at home, wearing masks, all of that. And they went back to work too early and had a very deadly second spike that happened almost immediately. So we're going to be working really closely with doctors, public health officials, that even as we're doing well, it doesn't mean let up. It may be see that through, but we're expecting that peak, the projections we have in LA, maybe a week or two later. Next question, please.
Your next question will come from the line of Mary Beth McDade from KTLA Channel 5 News. Please go ahead.
Hey, Mary Beth.
Yes, hi, hi, Mayor. So I'm a little bit confused on that. If we're now hearing from county health officials and from yourself that okay, so we're going to have this spike, this very dangerous 2 weeks ahead of us. So are we having what, 2 surges now, or are we fearing there's going to be a surge this week and next week, and then again at the end of April and beginning of May? That's sure. One thing. Number 2, do we think if we keep following the protocols that are out there as far as social distancing and staying home, can we avoid a surge? And then, number 3, we keep every day hearing about an increase in the number of cases, but we're not hearing about, out of those confirmed cases, how many have now recovered?
Right. I'll try to get you those numbers on the recovery. Those have been tough, and I've asked for the same things. And it's a combination of different, we have private hospitals, we have public hospitals, we have nonprofit hospitals, we've got research hospitals and university hospitals. And I know that the county public health is trying to track that as close as they can, but I can't report that tonight in terms of the recoveries, and that's often too because we're getting obviously all the positives but not always the negatives, and whether people are at home with other symptoms, that's also tough to track. But I'll see if I can get that for you. In terms of the 2 things, there aren't 2 things, and I'll try to explain again. I said last week there's 2 things for us all to track. Is the rate of increase increasing? How quickly is this doubling and doubling and doubling? While the doubling rate may slow down, that doesn't mean that we're still not piling on more cases, because remember, 7% today on a much bigger base means many more new cases than we had just a couple weeks ago, when the percentage increase, the rate of increase was maybe 20, 30%. We're still adding fewer cases. So a peak refers to the peak number of cases or the peak number of deaths. And we can expect that that is coming in future weeks, even as the doubling rate slows down because of what we're doing. And to your second question, could we have another spike, and can what we're doing save us from that? Absolutely. If we all went out right now, we would guarantee see a spike. If half of us went out, we would have a spike. If 25% of us did that, we would have a spike. So these numbers matter. Even one person can spread. If they go to a grocery store, if they're a place where right now people are having to do critical work or critical locations where they have to go. So we do expect a peak of absolute number of cases still in future weeks, even as we hope we have come to the fastest doubling point. And that's really in our hands. Hopefully that is behind us now, but it only will be behind us if we continue to stay at home. Hope that clarifies. Next question, please.
Thank you.
You bet.
Our next question will come from the line of Steve Gregory with KFI News. Please go ahead.
Hey, Eve.
Thank you. Good evening, Mayor. Couple of things. Chief Terrazas, could you clarify something you said in your opening remarks? You said that if a firefighter has a temperature of 104 degrees or above, you send them home? Can you clarify that? And why is it so high if that's the case? Because that's not what medical professionals are telling us. And also, Mayor, can you tell us, with regard to the snitches thing, and I know you said it with tongue-in-cheek and whatnot, but can you tell us how many snitches have come forward? How many people have actually filed complaints or called with concerns about non-essential businesses? And also, what are the top complaints that the mayor's office is getting from residents right now? What are the top 3 concerns you're getting from residents? Thank you.
I'll start with them.
Steve, the answer to your first question, it's a 100.4. Not 104.
100.4, okay, because in the playback it sounded like 104 degrees. Okay, thank you for that.
You're welcome. You're welcome.
Yeah, for sure. We sent him home much earlier than that, but thank you. Yeah, it was tongue-in-cheek. I shouldn't have used the word rewards. It was snitches get our thanks, because we're not trying to get people to rat on each other and throw people in jail, and that's certainly not the approach that we're taking. We want to know where people aren't abiding by things, and we want to send ambassadors to say, appeal to people's better angels. If the better angels don't work, maybe a visit from a police officer will in a friendly way. If that doesn't work, then we are prepared to take charges and to bring them. There isn't one single thing that we're getting on the mayor's helpline, but there's a lot of inquiries about rent, both from landlords and tenants. There's a lot of inquiries where folks want to know where they can go get testing, and asking sometimes about test results, sometimes from outside of Los Angeles City too, so we try to help out. We're getting also questions about the Small Business Association loans that are coming from the federal CARES package. And we'll talk about it later in the week, but we're working together with the county to help as many small businesses as possible, because it is a race to that money. And many smaller businesses that don't bank with the big boys and girls that are the ones giving these loans out really do need help, because they might not be previous customers of one of the large banks, but they deserve to have that money and deserve to keep their employees employed as well. So we get a wide variety, and maybe tomorrow what I'll do is I'll run you down the top 4 or 5 that we got from that day and give you them statistically as well. Okay? Next question, please.
Our next question will be from Claudia Pechuta with KNX News Radio. Please go ahead.
Hi, Claudia.
Hi, I have one quick question for Chief Terrazas and then a couple of questions for the mayor. So if you could talk about, Chief, LA County has told paramedics to delay transporting cardiac patients, according to the LA Times. I wonder if the city has done anything like that, and then I'll come back with the questions for the mayor.
Yes, Claudia, the protocol that Department of Health Services puts out requires that all the healthcare providers in the county comply with that directive. So the directive that the LA County Fire Department is following is the same one that we're following. And it's basically a more further clarification about when somebody's in full cardiac arrest. We are directed now to continue performing CPR, and then when we stop and the person has a recovery, we call it ROSC, return of spontaneous cardiac circulation. Return of spontaneous circulation. We're to wait 5 minutes to see if it continues. If it doesn't continue, we can go ahead and pronounce. So we are following the same protocol.
Okay. Sorry, it's really hard to hear you guys on the teleconference instead of the live stream when we're asking questions. So I think you finished answering. So a couple of questions for the mayor.
Sure.
You had talked last week about considering putting out an order requiring people to wear face coverings when they go out. I'm wondering what the status is on that. And also, if you could elaborate on your comments about considering restrictions to keep people within their neighborhoods.
Sure. Let me start with the face coverings, and I've been consulting very closely with Barbara Ferrer, who is my guide on this. And let me say one thing about face coverings at the outset that worries her and that I want to amplify. When you have a face covering, you need to wash that at night when you come home. It's not something that you take on and off all the time and put down, because it can actually spread germs. If you put it on a counter, put it someplace safe on your clothing. Don't just, put it on all the time. If you're jogging by yourself or biking by yourself, as she said, you don't need to have that. It should not be a medical mask. And be very careful about making sure that you keep it clean, whether that means buying a couple and switching them every day so you can wash one and dry it on the off day. It's very important to make sure that we use it properly. And it's properly used when you're going to be interacting with strangers to prevent your droplets from going towards them and reducing that incidence. So it's when you go to the grocery store, it's when you're going to be interacting with folks at the pharmacy, it's when you're going to find yourselves, if you're critical workers, in those situations where you may be able to spread this if you are a person that is asymptomatic but potentially a carrier of this. In terms of an order on mandating that, we're still consulting with the county. I don't think we'll have an order for everybody. You've seen some places, Riverside and San Diego, look at that, but there's as many concerns, I think, that Dr. Ferrer has as positive benefits that could come, but we are looking at that in certain environments, and I think we'll have more on that in the coming day or two, potentially in those retail environments and other places where people still are. And then you had one other question. I think that was maybe the two, both on the face coverings. We'll text you, and my team will tell me if I missed one. Next question, please.
And our next question will come from the line of Leslie Marin with CBS KCAL. Please go ahead.
Hi, Mayor. You mentioned about opening up testing for everyone, and then I noticed there was a tweet that came out that said testing would be open for everyone that obviously is showing symptoms. Can you go ahead and clarify that?
Sure. Yeah, I'm glad you asked that. This is not everybody gets a test. We're opening up the aperture, saying you're no longer restricted to only those who are 65 and older and or those folks who have pre-existing medical conditions or compromised immune systems. So now it is for folks with symptoms, and folks who will go through that will still be asked those questions. If you say, I don't have any symptoms, you're not getting a test right now. I'll be very clear about that. And we're hoping that there'll be blood tests and other tests that will help us in the future be able to see whether people have been carriers, et cetera. But right now, this is just for letting people know you don't have to live in the city. It can be anywhere in the county first. And secondarily, if you have some of those symptoms, you can then go through this and get a test, even if you don't fit into those categories. Okay? Thank you. We'll go to the next question.
Next question will come from the line of Conan Nolan with KNBC TV.
Hey,
Please
Conan.
go ahead.
How you doing?
Hello, Mayor. Nice to see you. So one of the things you said earlier dealt with the number of people that had stopped staying at home but were actually traveling, and that the city had gone from an A to a C and now back up to a B minus. Two things. I'm wondering if your office does any kind of analysis, or if there's any availability, any way to try to figure out why that is. And the White House Coronavirus Task Force and Dr. Deborah Birx had said that this is such a critical period this week and next week that she actually advised not to go to the grocery store. And I noticed that you said that was one of the reasons perhaps why you would leave your home. Could you just expand on that? And does that lend itself to this week not being as critical here as it may be nationally?
No, I think it still is a critical week. Wherever you can, please don't go out. If you can order groceries in, if you can do things. We are advising whenever possible. It's not a necessary trip out should only be if it's a necessary trip out. If there's any other way to stay at home, please stay at home. Claudia, I remember your other question. I'll link it into this, which is whether or not we'd ask people just to stay in their own neighborhood. We can't yet do that, nor do we have an enforcement mechanism, nor are we a country where, thankfully, we monitor people's cell phones and where they're at all the time, and I don't think we're going to do that anytime soon. But it's through public education and our public health directives that are encouraging people, don't drive across town to go exercise. Please stay where you are, walk around the block, even if it means walking many times, because we want to try to contain that motion. Where we went from an A to a C to now a B minus, it wasn't because so many people have started to slip, but other places are doing it even better. We need to make sure that, as we saw in the LMU poll, that the 5% that think they can go out to socialize, you cannot. You are not permitted just to go out and socialize. The 10% who say, I go out whenever I want, use some discretion. Maybe not doing that in a bad way, but you kind of think, well, as long as I'm not working, I'll go out whenever I can. Limit those trips, because any outside exposure can have the possibility of spreading this. So we're really emphasizing that this coming week. We're not telling people don't get food or don't go to the grocery store. That is not our advice here. And that's based on what we get from our Los Angeles County Department of Public Health. But in this, the more times we are able to exercise that discretion, the better chance we have of this being shorter. And as I've said, the deeper we do this and the shorter it is, then the sooner we can go back to life as we knew it. The more slippage we have and the longer it takes means that this will last even longer. Thank you. Next question.
Thank you.
We do have a follow-up from the line of Claudia. Please go ahead.
I think I remembered it. So is that good, Claudia?
I just wanted to ask if there will be any immunity testing happening in Los Angeles, as far as you know.
Any what kind of testing? Say that again.
Any immunity testing, like some of the stuff that's happening up north, Stanford?
Sure. The testing at Stanford, we have some universities doing that here. Folks are waiting to get blood tests that are reliable. It is absolutely something that we are looking at. It's not ready for prime time. I think sometimes we hear the reports and people say, well, why can't we start that tomorrow? We have to make sure the tests are right, that there's not false positives, which a lot of the early ones had, and that they are scaled up. The first 50,000 blood tests that some were talking about, antibodies, were already, and reasonably so, going to the East Coast. So it will still be some weeks of time before that would even be ready to be available. But I do hope that we will have the medical, not only technology, but the ability to go out and to see who has had COVID-19 who didn't get tested. Because there is the suspicion a lot of people may have carried this, may have the antibodies, and may be better prepared to go back to work earlier. One second point, though, is there's also research that is not definitive of whether or not you can get it a second time, or whether you could spread it even if you've had it. So of course we would want to make sure that we get a little bit more direction on that so that people couldn't, even if they weren't going to contract it again, weren't spreading it, or putting people in danger to get it a second time. So we're still a ways off. That testing that's going on is really academic testing and medical testing to see how we can accelerate this, but it's going to be a little bit. Thanks, Claudia. Next question. Do we have another question?
All right, our next question will come from the line of Elizabeth Chu with LA Daily News. Please go ahead.
Hi, Liz.
Hi, Mayor. So I have 3 questions. Sorry. So I first wanted to ask you about the supplemental paid sick leave ordinance, and since the deadline is tomorrow for you to sign it, I wanted to see whether you're planning to sign it and why you have held off on signing it so far. My second question is about the fact that this month is usually when you release the proposed city budget, and I was wondering how that process is going and how you are grappling with the changing economic conditions when you're trying to make the financial projections that the budget is based on. And also my third question is about getting a update on testing among the homeless population, and also what criteria you are using to, who gets to take a test.
Sure.
If you're homeless.
I don't have numbers, though I did ask for the numbers and hope to get them in the next day on the number of folks who have been tested who are people experiencing homelessness. That said, we're not coming up with those criteria. We're giving it to those clinics that serve folks and to those organizations that serve folks who are experiencing homelessness with healthcare. So those doctors, those relationships that people have, especially among vulnerable people who might have pre-existing conditions and other things that make them especially vulnerable, they will be the ones who will be administering those tests. So it's not through the testing centers. It's done directly by those who know best, the folks that are living on streets or in cars or in shelters. So, but I'll try to get you a number of that. Second, in terms of the budget, it's extremely dynamic right now. We will deliver it on time, but our projections, just even early projections, for instance, of our hotel tax, are down 37%, and that's assuming people come back to hotels later this year. It may be even deeper. We've said hiring freeze already. We've told all departments anything new you are going to do are not happening, so sharing that with my chiefs here, they know that. We are really down to the bone, and we will have to look at this coming year in an extremely sober way. I mean, if you're looking at unemployment potentially of 20%, second only to the Great Depression when it was 25%, we can assume that sales tax will be down maybe by as much as 10%. These things might sound like small numbers. They are hugely critical. What that means to the number of officers who can have overtime to be able to cover when we have surges in crime or emergencies like this, what it means for our fire department, what it means for our basic city services will certainly have ramifications, and we'll try to continue to do everything we can to keep those city services going. And I've guaranteed you from the beginning, this city will not shut down, but it will be a radically different budget. And then in terms of paid sick leave, 100% supportive. It was something that the government, the federal government, did not add for people who are employees of companies of 500 people or above. I spoke today to the council president. I think there's some technical changes because it was done with hurriedly because it needed to be done quickly, and I thank the council, especially Council President Martinez, for her work in leading on this, but making sure, for instance, that companies that offer the same amount don't get penalized, and if you're a great employer that already gives 30 days that people can take of paid leave, that you don't have this tacked on top of that. So a couple of things that we'll have to do. We're trying to figure out whether that gets done by council tomorrow or whether that gets done just by a clarification order, but we will have that tomorrow. Next question, please.
And our last question from the night comes from Esmeralda Cineros. Please go ahead.
Thank you, Mayor, for answering our questions.
Of course.
Our first question is, what consequences can business landlords face if they're trying to evict their tenant for not being able to pay rent? And what rights do tenants of these businesses have if they can't complete the rent during this health crisis?
Thank you. And I'll answer in English, and then I'll answer in Spanish and go into my Spanish remarks. And I'll let the chiefs get back to the other work that they were doing as well. So during this emergency, we established, it was one of the most far-reaching orders in the country, that the landlords can't evict commercial tenants as well, and they'll have 3 months to be able to pay that rent. So that is outlawed. If there's somebody who has a landlord threatening to evict them, please contact the city through 311, and we will make sure, document it, but we'll make sure that they are contacted too and informed about what the law is. I would also encourage landlords and commercial tenants, just as we have with residential ones, to talk to each other. We know that can be tough sometimes, so that's why it's important to document this. And I know that for a lot of mom and pop landlords, they have to make their mortgage, or else this is kind of dominoes that collapse. For those of us who want to make sure that restaurants and stores stay open, that renters stay in their housing, if that person isn't able to meet their mortgage, then that housing isn't there, and it's probably going to be snapped up by Wall Street, making it even less locally owned, less community wealth here. So I've said from the beginning, I certainly hope and absolutely 100% support federal assistance, and in the next round of federal legislation, I hope we can see this, that assistance to the banks, our taxpayer money given to the banks, should then go towards potentially allowing folks to have that not only rent deferred, but potentially taken care of. That, to me, would be a proper use of our federal dollars. So banks would allow mortgage holders, whether it's an apartment owner, whether it's a homeowner, or whether it is a commercial landlord, to be able to skip ahead some months. And then that would be something that we would mandate they have to pass on to their tenants as well. A lot of people have asked us in the city, can you just mandate that nobody has to pay their rent? We cannot. We do not have that power, and that whole domino series would collapse. But I do support that if we are doing federal assistance to the big banks, for instance, that should come with those conditions. But in the meantime, document that. I'll say that briefly also in Spanish. Durante esta crisis de emergencia, y gracias a los jefes, thank you to the chiefs for being here as well. Durante esta crisis de emergencia, los propietarios no tienen el derecho de desalojar a cualquier inquilino residencial.
While we were listening in to our Los Angeles mayor, we did also have a message from the Colorado governor. Now we're going to jump over to that right here on News Now.
This economic paralysis lasts, the fewer jobs there will be to return to, and the more difficult the recovery will be. Thankfully, a silver lining is just beginning to emerge in Colorado. The data is telling us that thanks to the actions we've taken and you've taken, we're starting to make progress. At the beginning of this crisis, the number of positive cases in Colorado was doubling every 1.5 days. Today, the number of positive cases is about doubling every 6 to 7 days. That means the spread of the virus is beginning to slow. This is a remarkable achievement by you, the people of this state, and I want to thank each and every one of you who's been taking this seriously and staying home. You're truly helping to turn the tide against this deadly virus. This is not the time to abandon what's been working. Quite the opposite. We need to keep up the good work for a while longer so we can eventually return to a level of normalcy in our economy and our society. That means washing your hands frequently with soap and water, wiping down surfaces, avoiding touching your face. Most importantly, we need to stay at home and not go out unless it's absolutely necessary. And when we do go out, you need to stay at least 6, 8, 10 feet away from others and wear a cloth facial covering or a mask when you absolutely need to leave your home. And you don't need to buy a mask or even buy craft materials for one. You can simply make one from an old t-shirt or just use a scarf. Really, any facial mask that covers your mouth and your nose works as long as it doesn't interfere with your own breathing. By following these steps, you're saving lives. Could be the life of your grandparent, your parent, your aunt, your uncle, your cousin, your child, your friend. It could even be your own life. The better job we do of staying in, the sooner we'll be able to go back out. I know this isn't easy, but if we all do our part, we can beat this virus and get back to living our lives. Earlier today, I spoke with a family where both parents, Andrew and Christine, both children and both maternal grandparents were all sickened with coronavirus. 5 out of 6 are fully recovered, and we hope that grandma is well on the way to feeling better. They told me that the virus impacted each member of the family differently, and the outcome could have been different if they didn't have access to medical attention. Now look, 80 to 90% of those who get this virus won't need medical assistance, but between 10 and 20% will need hospitalized care. Right now, by using this valuable time to prepare for this coming surge in patients, we can make sure that everyone who has a chance to make it gets that fighting chance. We're moving heaven and earth to ensure that our healthcare workers have the gowns, the masks, the gloves, the face shields to keep them safe. Because they are our heroes. They're the ones who will take care of us when we're sick, and we owe it to them to keep them healthy. We're building more hospital beds and working to acquire more ventilators to make sure we have the capacity to handle the projected increase of severely sick patients. And I want to thank Colorado Hospitals and the Army Corps of Engineers for constructing hospital space to meet the needs. Finally, we're using our creativity, our innovative, scrappy, and independent spirit to obtain more tests so that we can have widespread testing and containment like South Korea and Taiwan, who've been able to successfully return to a level of normalcy by testing, quarantining and isolating individuals instead of quarantining an entire society. Recovery from both the virus and the economic devastation is possible, and we will get there. But all of these efforts will be in vain, and many lives will be lost if we fail to do our crucial patriotic duty and stay home. By staying home and wearing a mask when you have to go out and practicing distancing and good hygiene, you're literally saving lives. The need to limit interactions is so great that the federal government is literally paying us to stay home. If you make up to $75,000 as an individual or $150,000 as a couple, you'll get $1,200 per person. And no matter what your income level is, you'll get $500 per child age 16 and under. This is not free money. The federal government, President Trump, Nancy Pelosi, Mitch McConnell, almost the entire United States Congress agreed that paying Americans to stay inside is needed to prevent a full-scale disaster. You need to earn this money by staying home, except when absolutely necessary to go out. The federal package also includes an incentive for companies to keep you on payroll, even if you're not able to go to work, to prevent even worse layoffs. On the state level, my administration is suspending regulations, deferring tax payments, eliminating red tape and in-person requirements for many license renewals, and working tirelessly to ensure that we're supporting our businesses and our workers as we all weather the storm to ensure a speedy economic recovery when this is past us. What matters now is not what you believe politically or your occupation or what your faith is or your age or your race. None of that matters here because none of that matters to the virus. What matters is that the more we stay home, no matter who you are, the better chance we have of beating this virus so that we can all go back to the things that make life worth living. Look, I know this isn't easy. I know Coloradans are hurting, and this is no ordinary emergency. We faced crises before, floods, fires, recessions, but this one is uniquely painful because we can't be with one another. This April will always be known as the lost month. We all have the blessing of being on this planet for 900 or 1,000 months in our lives. And we won't get this one back, but if we act together and take action, we will have many more to live in prosperity and health. In times of tragedy and difficulty, humanity comes together in fellowship. We mourn and we celebrate together. We laugh together and we cry together. We find comfort in the company and the love of one another. Now, we can't do that right now physically, but that doesn't mean that we can't be with and don't need to be with one another emotionally. Use this time to reconnect with friends and family and loved ones. Thankfully, there's been amazing progress in how we can stay together even as we stay apart. Email, phone, Skype, Zoom, FaceTime. We can see and hear our loved ones almost as if they were there. We had a group Zoom with our grandparents and kids this weekend, and I know that many families are doing the same. Let's stay positive because none of this is permanent. With time, we'll have more hospital beds and a mass testing and containment program in place, and the spread of the virus will be limited enough that we can get back to a fairly normal economy and society. There will be a day in the not too distant future that we can physically be together once again, when we can go to bars and restaurants, attend schools and universities, churches, temples, and houses of worship, when grandparents can hug their grandchildren without the fear of getting sick, when we can once again feel the wind against our face as we ski down our favorite ski runs and hike our favorite trails. But that day is not today, nor is it tomorrow. Right now, we need to dig deep into our souls to muster the resolve, the courage, the fortitude to carry on and do our patriotic duty as generations have done before. Thousands of our forefathers sacrificed on battlefields defending our freedom, our homeland, our way of life. Thousands of our foremothers sacrificed pots and pans and farm equipment to be melted down for the war effort during World War II. People had ration cards to save food for the troops. We banned men's suits from including cuffs and restricted the length of shirts to save fabric. Everyday citizens became heroes. Ordinary men and women became G.I. Joes and Rosie the Riveters, everyone working together and doing their part. We scraped and toiled and persevered, and we won. That is the spirit that we all need right now. This generation has been called upon to make our own sacrifice, to temporarily sacrifice our way of life so that we can save human life and return to normal. And I know that we can rise to the challenge once again. A number of communities across the world, including some right here in Colorado, have taken up a new tradition of going outside for a moment at 8 p.m. to applaud and cheer our brave healthcare workers who are putting their own health and safety on the line to keep us safe, and everyone else who's helping us through this crisis and putting themselves at risk. Our first responders, our farmers and ranchers, our journalists, our custodial workers, our grocery store workers, delivery people, truckers, so many more. I want to encourage Coloradans to participate in this new tradition this evening and every evening this crisis is with us. Our appreciation for those putting themselves at risk unites us across the world. And the only way we're going to get through this is by working together as a state, as a nation, and as a world. Both China and Taiwan are donating masks and protective equipment to Colorado. Israel even delivered masks to Palestinians. And let's also cheer our very own scientists at Colorado State University who are racing around the clock for a vaccine or cure. And when we achieve that cure or vaccine, And I say when, not if. Whether it comes out of Germany, South Korea, Japan, or Fort Collins, it will be shared around the world to end this crisis and save lives. I might not agree with Henry Kissinger on much, but I found his recent words in the Wall Street Journal very profound. He said, quote, "The pandemic has prompted an anachronism, revival of the walled city in an age when prosperity depends on global trade and movement of people," end quote. Colorado and America is not a walled city. We will survive this and return to health and prosperity by embracing the world rather than shrinking from it. And through this crisis, we'll reaffirm our identity as innovative, resilient, good-hearted people who care for one another. St. Francis of Assisi once said, quote, "All the darkness in the world cannot extinguish the light of a single candle," end quote. In these dark times, we all have a light to shine, and that light is the goodness within all of us. We see that light in the young man who picks up groceries and medicine for an elderly neighbor so they don't have to go to the store and risk getting the virus. We see that light in the small business owner keeping her employees on payroll because it's the fair and decent and right thing to do. We see that light in the parents who do their best to explain these difficult times to their children and making sure they know the truth of that wisdom, that a single candle is enough to light the dark. We see that light in the teams of doctors and researchers and scientists spending week after week in labs all over the globe, burning the midnight oil, showing that light, searching for the cure to save the world. We need everyone to do their part. We need everyone to show that light. And when we do, as I know we will, we'll find our way out of this darkness and into the light of a brilliant new day. Thank you. God bless the great state of Colorado, and God bless the United States of America.
All right, going to turn things back to sports with our Fox 4 team down in Dallas.
Yeah, Mike, she is one special lady. You know, we've heard so much about Mark Cuban, and we've seen so much of Mark Cuban basically on every platform, whether it's Twitter or in the national news. But she is really right beside him throughout this whole thing. She's embedded in the community with him. They talk a lot on the daily about what they can do to help the community. Here's part of our conversation from earlier today. You have all your wonderful players who, of course, are known for what they do on the court, but they've all been part of that Feeding the Fight initiative. I mean, what can you say about the players and the way that they've participated?
You know, we always say it's bigger than basketball and that our guys are champions on and off the court. And so now what people really get to see up close and personal is they really are champions off the court. They are helping to fund meals that we're providing for the healthcare workers who are on site. They are out there reading to kids. They are spending their own money, donating to food banks and to other initiatives. Everywhere you turn, either they are coming up with ideas or responding to the ideas that we're giving them. There's such a good spirit with the players and with the coaches, and frankly, throughout the entire organization, just saying, how can we give back? We're blessed that nobody's sick. And so, yes, we have to stay home, but we can give from home. And so I love our guys. I mean, I already love them, but I really love them now. I mean, just to see that, I mean, they have such big hearts. One of the things that was really important to my boss that we talked about even before the suspension was announced, that if anything happened, he wanted to make sure, and of course I wanted to make sure as well, but he wanted to make sure that the folks got paid. Everybody who normally works our game, that they would get paid, because the last thing we wanted is for people to have to worry about an economic crisis in their own house. And I love my boss. He has such a big heart. We're a good match.
You guys are.
He has a big heart for the community. I have a big heart for the community. The whole organization. I mean, Rick Carlisle, Donnie Nelson. Sometimes, you know, we want to be anonymous, but every now and then we have to step up, because when people see our name, sometimes it makes other people do great things. So we prefer to stay anonymous, but sometimes we can't get away with it.
So yeah, you can see, Mike, how much this Mavs organization is involved in really trying to help get everyone through this. Of course, the Mavs employees, that's the #1 priority. But then they're really trying to come up with innovative ideas on a daily basis on just how to, further help ease people's minds and get them through this time of crisis, because it's so uncertain for so many people right now.
Well, Jeff, let's bring you in here. I know you talked to a WNBA player who's really been impacted by the changes brought on by the COVID-19 pandemic.
Yeah, that's right. Dallas Wings center Isabel Harrison has really felt the effects of this pandemic in several ways. Now, one thing you might not know, many players who don't make top dollar in the WNBA, they end up going to play pro ball overseas during the off season. In fact, many of them actually make more money that way. Harrison was playing for a team in Bologna, Italy, at a time when the pandemic really started to increase in its severity, and was just able to escape to get back home here to the U.S. right ahead of President Trump's U.S. travel ban. When you hear that the president makes that decision and you think about the possibility of you could be trapped overseas, what emotions run through you?
Anxiety. Even nights before that, I wasn't sleeping for a good 4 or 5 nights, just trying to stay on top of all the updates they were giving, not only Italy, but the U.S. And of course, a lot of people were contacting me, just expressing their concern. And I'm like, I don't even know what to do next, and I'm nervous. So a lot of anxiety and a lot of uncertainty. So when I actually landed back in the U.S., I can't express to you the amount of relief that I felt.
When she got home, Harrison quarantined here in Dallas, but then found a new issue on her hands. Harrison deals with an autoimmune disease. She takes a drug called hydroxychloroquine to help. The actual brand name of the drug Isabel is prescribed is called Plaquenil. Well, on March 19th, President Trump announced that hydroxychloroquine was showing very encouraging results as a possible cure for COVID-19. Ever since then, Harrison and other people with autoimmune diseases who are more vulnerable, of course, to COVID-19 have faced real struggles trying to get the drugs they rely on.
When Trump made an announcement on television that it's going to help cure COVID-19, of course, everybody's like, oh, now let me go get some Plaquenil. And that's just not the case. A lot of studies were being done, but nothing came back conclusive. That's what my doctor told me. So, of course, instead of presenting the numbers and information, people are just going out and finding itself. And I just want people to know that's putting people who actually need the medication at risk.
As far as basketball goes, the Wings are scheduled to open their season in Seattle on May 15th. And so far, the WNBA has not officially announced any delay to its season. Izzy tells me, of course, all the players want to play. But guys, as each day goes by, of course, the inevitability of a delay becomes more and more realistic.
Yeah, definitely trending. Well, the Rangers season should have gotten underway this past week. The home opener should have been Tuesday, as we've been discussing. Instead, baseball is on hold, and Rangers general manager John Daniels joins us right now from his home. JD, like everybody, I know you've been thinking a lot about what should be happening right now, but I'm kind of curious as to what your emotions were on Tuesday about the time that first pitch would have been thrown for the first time in the brand new ballpark.
You know, I got to be honest, Mike, this is, it's kind of like Groundhog Day right now, where you don't wake up and every day you got to remind yourself what day of the week it is and all that. So,
John, we've been talking about the new ballpark for about a year, just the anticipation of it. What are your overall impressions of that finished ballpark?
Yeah, so it's, listen, a ton of planning went into it. So many people put a lot of thought into it. And if it can be better than advertised, it is. Now, I haven't been back there since right around March 1st. I came home for a few days in what was the middle of spring training at that point. And I went over and kind of went down the field, went through the clubhouse. I was in our offices for a little while. I have not been back there since we broke camp, given everything that's going on. But the park itself is spectacular. I think we've put out some photos and some video and drone footage and whatnot that kind of you get a little bit of a picture. I haven't actually not been there with the roof open yet. And from the pictures we've put out here recently, and then talking to some of our folks that have been there, they said it's even better I mean, there's literally every spot you could sit in as a fan with the roof open or closed, but the grandeur of it open is just spectacular. The views, the sight lines. I'm really excited. And I know our players are going to be really excited about what we've been able to do in the clubhouse. I think, not just creature comforts from an amenity standpoint, but real benefits from a lifestyle standpoint, things for their families and their kids. So we really want to be the destination, and we want to be the spot that players and staff want to come work and live and be part of. And then also from like a sports science and a rest and recovery and rehab standpoint, we put a lot of thought into how we can best keep our players on the field, how we can best train them behind the scenes and give them every advantage. So, once we're able to get in there and take advantage of all that, that's going to be very exciting.
Speaking of families and kids, has the one positive of this whole situation for you been the fact that for a change you've been able to spend a lot of time with your family, including your 3 kids here right now? Yeah, Mike. I mean, listen, I have quite literally never been home as much as I have been here the last couple of weeks. And with the exception of the occasional, my wife kind of give me a look, which tells me to give her some space and head back to my my guest room, home office here. But I mean, I've literally have had more meals with Robin and the kids here the last few weeks than I have in the previous probably 6 months. So obviously, like a lot going on, huge seriousness to the situation. I'm concerned with a lot of different things, but from a silver lining standpoint, having this time with the family is a big one.
John, so many athletes have stepped up during this time because there are so many people that are going through hardships. I know one of your own today, we saw the reports, Shin-Soo Choo donating $1,000 to each of the 190 players within your minor league system in your organization. I'm sure you're not surprised at all by this act. I know he has the reputation of just being one of those great guys around the clubhouse. So Chu himself, first of all, came up with the idea, but then it was on him. He followed up with us a number of different times. And so he's donated $200,000 to South Korean efforts, their relief and recovery efforts there. And then separately, he's donating $200,000 to pay or to increase the stipend that we're paying our minor league players. And I think, as he put it, he got a decent signing bonus as an amateur, but he gave it all to his parents. And so he and his wife, Mia, coming up, foreign country, new language. He went through the minor league system. He wasn't one of these guys that came over and went right to the big leagues and had those advantages. He really worked his way up. The minor league salaries are very low. And so he wanted to give back to that group. And when he told me that, I want to give $200,000 now, that really blew me away. I also don't think he wanted this publicity. He was happy to do it privately. It kind of got out a little bit here. I think it's a good thing. I think he should be celebrated for it because it's some kind of selfless act. John, what role can Major League Baseball and the rest of the sports world, play in getting this country back on track once we're finally all able, to resume a sense of normalcy again and all be able to be with one another?
Yes, I think even before that, I think our role is to try to remind people how serious this situation is, and that we all need to do our part, as we all are here sitting in our home offices or our living rooms, and try to contribute from that standpoint. Once we're back, and whenever that is, and we can do it safely and get back together again, I think people are going to be looking for positive stories. They're going to be looking for outlets. They're going to be looking for ways to connect with each other again. And I think that, all sports, but especially baseball, given, where the season that we're in and heading into the summer, and baseball kind of traditionally being the only game in town, so to speak, during the summer, I think has a real chance to be part of the kind of national recovery and give us some real positive things.
All right, Sam, here we are for a little Monday lunch.
Hi, Mike.
An acceptable distance apart, social distancing. And you put out a call on Twitter for just names of restaurants in the area that are still doing business, still have takeout. And we're here at Smoky John's on Mockingbird, great barbecue place in Dallas. And there's a little bit of a sports tie in here too, right?
Yeah, Mavs player Justin Jackson actually bought 100 meals from them to donate, which is really great to see because there's so many restaurants around the DFW that are struggling and that need help and support. And that's a big reason why you and I wanted to come out here to show our support, and that it doesn't matter who you are, how important you are, everyone can contribute and make a little bit of a difference.
Yeah, and all the local teams have done a great job here during this crisis. Two brothers run this family business. Let's hear more from them now.
That's the extra sides and the dessert.
So our dad started in 1976. He was on the corner of Lemon and Mockingbird. He actually started as Big John's Barbecue. And one day he had some issues with his smoker, and the smoke was going everywhere, and a guy walked in and goes, "Man, you should call this place Smoky John's." And like a week or so later, Dad changed the name, and it became Smoky John's. Early 80s, late 70s, we had a very strong sports connection because Drew Pearson, Harvey, all the Cowboys would come around our restaurant when we were growing up. We got the call from another caterer, and she said, "Hey, would you guys be interested in if the Mavericks they're trying to feed people, would y'all be interested in serving them?" We're like, "Of course." So we got a phone call a few days later from Lindsay over at the Mavericks, and she said, "Hey, we're going to be feeding the guys at Parkland." And then when they got the order put in, they said, "Okay, well, Justin Jackson is actually paying for it." We're like, we're big Mavericks fans. We have season tickets, so we were like really excited that we could be a part of, people doing good, and so we packaged every meal individually. It was great. We were able to be a part of it, and knowing that the Mavericks, they've been so much in the forefront from day one about taking care of their people in the arena, as well as helping the health caregivers with the child care, and then now helping provide lunches, and then knowing that the players themselves, it's not just Mark Cuban, it's the actual players they're making themselves available to help out where they can.
Community is everything. Our restaurant thrives off of community. Absolutely. I mean, we're a family business. Absolutely. So one of the things we do is we try to reach out to other families, and even the to-go packs that we're putting together, people are able to take those home, eat together, hopefully have leftovers. And I think this whole thing is really bringing people together. Whereas we normally probably would have spent a lot of time away, now people are having to be together and sit down and actually talk to each other.
Mike, it was awesome to hear from Brent and Juan. They could do our jobs maybe even better than we could.
Don't say that too loud.
I just think hearing about the history of their restaurant, especially with their dad starting it back in 1976, how there was a fire in 2017, how they had to rebuild that, and now going through this whole thing with the coronavirus, what was really inspiring to me is how embedded they are in the community. They're all about helping others, helping anyone in any way they can. And those are the types of gentlemen that we need and that we need to see more of and showcase so that people can see how many people really are contributing.
I know you're talking now, but I'm smelling barbecue, so I need to eat. All right, should we go get something?
Yeah, let's go.
All right, here we go. I'm not trying to eat healthy, by the way. Should we talk just a tiny bit of sports?
Let's talk
Since we
sports while
sort
we
of
eat.
do a sports show.
Yeah.
Just looking at the national shows, just looking at what ESPN's trying to do to fill time with their talk shows, they're still talking about the Dak deal. And we talked about it last night and all the Dak comparisons and stuff. I guess they continue to talk. I think what they need to do, Dak's agent and Stephen Jones need to come to this place. They need to come to Smoky John's.
Sit down.
They can't sit here like we are, of course,
No.
in the restaurant. This is a special dispensation.
Right.
Get some takeout, sit in the back of the hatchback of the Escalade, and just hammer this thing out.
Get
What do
the
you think?
deal done.
Okay.
I think it's a good way to go.
All right.
And we appreciate Brent and Juan taking the time to let us come in here.
This mac and cheese, I'm telling you.
Way to rub it in. Way to rub it in. But
Bon
this,
appetit.
this
Enjoy.
Yeah, Mike, she is one special lady. You know, we've heard so much about Mark Cuban, and we've seen so much of Mark Cuban basically on every platform, whether it's Twitter or in the national.
1,800 cases of COVID-19 have been
reported in our area. What does that mean for us? What are coming in the days ahead? That's why we are checking in right now with Dr. Umair Shah. What an honor to have him with us. We're talking about the Executive Director of Harris County Public Health. Dr. Shah, you're a household name by now. We see you on the news conferences every day, so thanks for your time this morning. Bring us up to date with how you feel Harris County is doing right now. How are we doing staying home and doing what we're asked to do?
Yeah, thanks, Melissa, for having me. And obviously, I would rather not be out there because usually when I'm out there, it usually means that something is going on. And unfortunately, right now we're dealing with COVID-19. Thanks for having me on. And I think the first and foremost thing to say is that we are doing everything we can from our policymaking under Judge Hidalgo. Obviously, everything we can with emergency management, our county partners, working with our city partners. I'm connected with Dr. David Pearce, the health authority of the city of Houston, on a multiple time a day basis. And what we're doing is really to encourage and really do everything we can to get people to be socially distanced. I think that's the key message, is we've got to stay away from each other. We have to be emotionally connected, but physically apart. We have started to see an increase in cases. We've also, our department just confirmed 2 deaths just yesterday. So we know this is a serious virus. We are doing everything we can to flatten the curve, but unfortunately right now we do not know where we are on that curve. And that's why it's important for all of us to work together.
Oh, it is so very important. And I think that one of our biggest goals is just to not end up being like a city like we're seeing in New York City or states like New Jersey. So how do you feel Houston is doing to make sure that that doesn't happen? Are our hospitals getting extra beds ready? Are we ready just in case we become those areas?
Yeah, I have to give a lot of credit to our healthcare institutions. We have some of the finest in the country and actually in the world. Our Texas Medical Center partners, even hospitals within TMC, but also outside of TMC, have just done a really amazing job of. And I always say, and I'm one of them. Healthcare providers are really the front line. Our first responders are the front line. They are really heroes. At the same time, we recognize that what's happened in New York City or what happened in Northern Italy can very quickly overwhelm a system. And so we're working with our hospitals, and they're doing a great job of really planning for potential surge of folks presenting. But we're also looking at other options so that we can supplement what they're doing as well. Right now, we've seen an increase in cases, both in terms, as you mentioned, in our region that we're confirming, but we're also seeing an increase in presentations to hospitals and healthcare facilities where people are now presenting with what looks like it could be COVID-19. And that's obviously of concern.
Mm-hmm. And you mentioned our first responders. They are so very important for our entire community for so many reasons. Are you all thinking about some way to help protect them? Maybe something even more extreme than what we're doing, because we are starting to see them be infected with this virus. It's a huge concern.
It's a big concern. We've said all along, if our healthcare workers and our first responders, if they go down, we're in trouble. I mean, they are the ones that protect us. They're the ones who take care of others. This is something that really is of concern to all of us in our response community. So I do think that both everything we can to see how we can get, and it's hard because supply chains are so constrained, but personal protective equipment with those N95 masks and all those other ways to protect our workers and our first responders is absolutely critical. But we know that there is a limit around the country of even those supplies. So then we're asking, folks to really do everything they can to protect themselves, to do all the universal precautions, making sure they have good strategies on social distancing and not getting in. Obviously when you're taking care of a patient, it's very difficult, but not getting into a situation where you might unduly expose yourself, and certainly watching for symptoms. Those are the messages to our first responders and obviously our healthcare workers. But Melissa, and this, I'm a champion of public health. And I will say the other heroes in this are our public health teams across the country. And I call them the invisible workforce, the offensive line of the football team. Everybody knows Deshaun Watson, but nobody knows the offensive line, and that's public health and our epidemiologists and our disease clinicians and all the folks that are just working 24 hours a day to really figure out where disease is happening with COVID-19 in our communities and really contain it as best we can. They are also heroes, and I want to make sure we recognize their work as well.
Oh, I'm so glad you brought that up. It is incredibly true. Dr. Shaw, I always find you to be a calming voice for our county, really for the entire area. And I know that you are working just about 24/7, like all of those heroes that you were talking about, so you're one of them. But tell us a little bit about your day. What type of experts are you working with? Who are you working with on a day-to-day basis? Because I know it's just a huge group of people, quite a powerful network, making sure that you stay up to date and keep us up to date with what's happening right here.
Well, I already mentioned Judge Hidalgo. We're connected multiple times a day, and her team has been just amazing. Our county leadership across the board, county partners. But across outside of that, and I mentioned the city, I've also mentioned, or haven't mentioned, but I should, are our regional partners, right? This is not just one community or one city or one county. This is about all of our regional partners from Fort Bend, Montgomery County, Galveston County, et cetera, and making sure that our health authorities, our public health departments are connected. That's absolutely critical. Our state partners and certainly our federal partners, and we've even reached in at times to our global partners. And really, I think the key message is that we have an incredible group of people there, but we also recognize that we've got healthcare institutions, Baylor College of Medicine, University of Texas, and all host of academic institutions. You know the public health experts, but you also know the research science experts like Dr. Peter Hotez and others who we reach out to. And then our dean at the University of Texas School of Public Health, Dr. Burwinkle, who has done some mathematical modeling of what's happening with COVID-19. And then, fortunately, we've worked so well across the country. There are so many experts, but so many folks who are going through this in Los Angeles and San Francisco and Seattle, and obviously in other parts of the country that we're really working with and getting information and staying connected, trying to do everything we can to be one step ahead of this virus. And Melissa, you know this, you cannot stop a virus. You can slow it down. A virus like this, you can slow it down. This is right now the most studied virus in the world. We're doing everything we can to learn it, understand it, and strategize ahead of it. And you're seeing that guidance is also changing. Like, for example, you've seen over the last couple of days, there's been news about the CDC saying, hey, we were previously saying don't wear masks. Now we're re-looking at that guidance. So there's a lot of information that's changing. And we want your viewers to know that we're staying ahead of that. In fact, we're a part of it. People are reaching out to us as well from across the country. They want to know what Harris County is doing. And we really want to make sure everything we do is not just connected, but it's about protecting and serving our community. That's why our teams are working so absolutely hard day and night.
And, you know, I think it's so important right now for people to have the reassurance and to hear that. We just need something to put us at peace. And something that you and I know, we've worked together closely through the Texas Medical Center, is we have some of the best doctors in the world right here in our own backyard. Don't you think that the fact that we already have so much equipment, that we have this expertise, that it does hopefully give people peace of mind that if you had to be somewhere, this sure is a good place to be to deal with an outbreak like this?
Oh, absolutely. You know, we are so fortunate, not just in our community, our region, to have so many incredible experts that are here. You know, we whenever you have an issue or a problem or a challenge, you can pick up the phone very quickly. Unfortunately, you can't meet as much, right, together because of social distancing, but we can do everything we can, pick up the phone and stay connected. And I think that's been absolutely critical. But I do want to transition for just a moment about, as you hear experts and you hear government and you hear policymakers, I think we have to remember the other partners in all this is our community. Ultimately, we can have all the science in the world, we can enact all the policies in the world, but if we cannot have our community work with us and help us, empowering each other to really fight this virus, then we're not going to be successful. that means we have to do everything we can with, we've talked about personal protection from hand hygiene and wash your hands and cover your cough. And if you're sick, don't expose someone else. And we're also saying now, obviously, that, there is that other message that, if you are someone in the community, please stay away from each other, stay at home, stay home, work safe, stay home, live safe, stay home, play safe, stay home, and you can go down the list. We want to do everything we can to keep people off the streets and really at home where they are not around others except for their immediate family. And then finally, what we really want people to know is that whatever we can do, if you have symptoms, we have an online tool on our readyharris.org website. You can go to our Harris County Public Health website for other information. We want everybody to go to readyharris.org, and you can have a self-assessment. So if you do need to be evaluated or tested, people know what to do. But do everything you can to distance yourselves from other people. We know right now, Melissa, and you and I have talked about how difficult this is for our community. You and I are part of that community. This is not like we're making decisions and it's in a vacuum. We too go to restaurants. We too go out. We too go do things. And unfortunately, it has disrupted life for all of us. But it's a necessary disruption right now because we're trying to do everything we can so we can stay ahead of and stay away from any of those situations that are occurring in other communities. And unfortunately, it's too early to tell.
Well, I'm glad you brought that
really
up because I want people to remember that you are part of that. You are all making decisions for the best of everybody. Dr. Umair Shah, an honor to have so much time with you. Thanks for sharing your valuable time, and thanks for all you're doing for Harris County Public Health and everyone in our community. Take care of you, and you stay safe and healthy throughout this as well.
Thanks for everything you do as well, Melissa. I appreciate it.
The news sounds very promising that the death rate for COVID-19 may not be quite as severe as we feared in the beginning.
Right. There's been some new studies coming out. This is a number that we are constantly looking at because both the numerator, the number of people who die, and the denominator, the number of people we know have the disease, kind of keep changing and are a moving target. But there's been a good study that came out recently that showed that the death rate may be as low as 0.66%, which means basically 66 out of 1,000 people may die from this illness here in the United States. And so I think it's important to know that death rate, it's kind of simple to calculate. It's the number of people who die over the number of cases, but it is a moving target. The number of people who die depends on how good the health care is, and the number of cases depends on how many people are getting tested.
All right, and then people may say, then why are we stuck at home? They need to know this is a more contagious disease than the flu, and it seems to take a lot more hospitalizations than the typical flu. Is that correct?
Absolutely. So it's very much more dangerous and infectious than the flu, and a much higher death rate. By comparison, the death rate from flu is like 2 or 3 out of 1,000 people, not 66 out of 1,000 people dying. And what's important to remember is what we're doing is we're reducing the number of people who are getting infected at one time so that our hospital systems don't get overwhelmed. So if we just all go back to work and go back to life as normal, what will happen is our death rate will skyrocket because the hospitals will be overwhelmed, as they are in places like New York City and Louisiana, where there are a lot of cases. And so, if the hospitals can't take good care of you, you're much more likely to die.
All right. So as a physician, does this just make you feel a little bit better that what we're doing by staying home, that we are really, I would say, controlling it as best we can?
Yeah, it does make me feel better. In the long run, basically half of the population or more is going to catch this virus. And what really matters is what period of time does that occur over, and do we have enough time to develop a vaccine so that, instead of half the people catching it, we are able to vaccinate a lot of people and prevent infection.
So how do we personally take these numbers where we really get what you're talking about?
So I think statistics are really hard for people to grasp. Think about a large group that you're a member of, maybe your high school graduating class or the religious community you worship with. Maybe that's about 1,000 people. And if 66 out of 1,000 people die of this illness, then, you know, that's a pretty sizable proportion of your high school class. So it's really important to also think about what's the risk that you care about, you know, what's your individual risk. So if you're having really few symptoms and you test positive, your risk is still approaching zero that you're going to die from this illness because you're not having any symptoms. But you could pass that infection on to your grandmother, who would be at much higher risk, particularly if she's like in her 80s. Her risk may be as many as 1 in 10 people could die from this if they have a positive test. So it's really, really important to think about how these statistics translate into actions that you can take as an individual.
Good evening, and thanks again for being here with us on News Now. So you can see 367,000 cases of COVID-19 have been reported here in the U.S. Just to give you a live look, here is a look at New York. We've talked about how they have been doing their social distancing, stay-at-home orders, and now you can see that has definitely impacted how Times Square looks. Hey, it is that time of the evening when we go to Fox 11 Los Angeles for their special coronavirus crisis report.
Garcetti of Los Angeles calling it a make or break week for LA. Welcome to this Fox 11 News special report, the coronavirus crisis. I'm Alex Michaels.
And I'm Dr. Drew Pinsky.
And also joining us once again tonight is Reverend Andy Bales from Skid Row. He's the CEO of the Union Rescue Mission. We're going to talk to him about the homeless and the coronavirus in just a little bit. Thank you for being with us, Reverend. But we begin with a look at our top stories. The latest numbers across Southern California. LA County now topping 6,000 cases for the first time. 147 of them have died so far. Riverside County reporting 6 more deaths today. That's a 30% jump from yesterday. Big international story. British Prime Minister Boris Johnson, the top guy in their whole government, has been moved to intensive care of the London hospital where he is being treated for COVID-19. Johnson's office says his symptoms have worsened, but he's conscious and he does not require a ventilator, at least not right now. And the Surgeon General of the United States warning that the country should prepare for what could be the saddest and hardest week of most Americans' lives. Jerome Adams comparing this to Pearl Harbor or our 9/11 moment. More than 10,000 Americans have died from the coronavirus. Models show coronavirus is peaking nationwide over the next 2 weeks. So I asked LA Mayor Eric Garcetti just a short time ago about those projections and how they apply to Los Angeles specifically. Here's what he had to say.
In terms of the projections, the University of Washington study that I mentioned had California projected, it was just 4 days ago, they were projecting the peak would be late April, early May. Now they're saying mid-April. But I would say for Los Angeles and Southern California, I would caution because we're having disproportionate number of cases here. As you remember, Northern California spiked earlier. So it's my expectation that maybe that's an average that they're projecting for the state, but for us it's probably a week or 2 later. So that we're still looking at that same time towards the end of this month, beginning of May.
Do you agree with that? That makes sense?
Yeah, it made sense, and I'm glad he's taking caution because that is his job to plan for the worst case. But the reality is we have done a marvelous job in California, and what he's talking about, those curves have adjusted downward markedly, and they might continue to adjust down. So, yes, he's right. We should really keep our pedal to the metal, but I'm optimistic. Those numbers, I was studying them over the weekend. I couldn't understand why they hadn't adjusted the curves, and I woke up this morning to find new curves that look a lot better.
Well, let's talk about curves. Usually, sometimes you talk about a different kind of curve. This is the kind of curve we're talking about now here in California. The peak now expected 11 days from now on April 17th.
That's
the
deaths
peak
per day.
now expected 70 deaths per day. Let's compare that with the model from just 5 days ago.
See, that's a completely different story.
Yeah, then it predicted California would peak on April 30th with 122 deaths per day.
Yeah.
So that means the work we're doing is working.
Exactly.
Let's look at the national numbers. The outbreak peaking on April 16th with more than 3,100 deaths per day.
But keep in mind that that pink is a confidence interval, and they keep adjusting this thing down towards that lower limit of the confidence interval.
That's good news. Now let's go to New York, which is the hardest hit state. That's expected to peak in 3 days with more than 870 deaths per day. Think about that.
So that's the part that the Surgeon General is talking about. When you really think about the number of lives and the people that are being lost, it's breathtaking. Even though here in California we're doing very well, Team Newsom has done a great job, and thank God he did it early. But nationwide, there's still a lot of people going to die of this thing, and that's sad.
You know, Governor Cuomo is getting so much love around the country, but really, if you think about it, the job that Governor Newsom's doing statistically is a lot better. Announcing today the state of California is going to lend 500 ventilators to the Strategic National Stockpile to help other states fighting the coronavirus outbreak. Take a listen.
We're Americans, first and foremost. We happen to have 40 million Americans that live in the great state of California. And as a nation state, we can do certain things where we can punch above our weight, and we carry a big weight. But to the extent that other Americans need our support, our largesse, and to the extent we have the resources, we're going to be there for as many people as we possibly can. But know this, we're also taking care of our 40 million Californians as well.
So it's a good sign that we have enough of these that we can now lend some of them.
It's a great sign. It's a great sign. And with the preparation that this state has made, we are going to meet our resource needs. I'm confident about that.
Now, in terms of the national picture, the White House Task Force on Coronavirus now warning against even going to the grocery store or trips to the pharmacies. We saw something similar being talked about in LA County today as the pandemic expected to hit that apex within the next 14 days. Dr. Deborah Birx says Americans need to be careful over the next 2 weeks. What makes this time so much different than other times?
This is when we find out if we really suppress. The mitigation efforts can be brought all the way home in the next 2 weeks. This is when we act. All these weeks have talked about the flattening of the curve. This is when we get on that flattened curve, and we want to stay there. And the fact is, as the virus starts to peak, this is also the greatest time for infectivity. So we want to keep that to a minimum. I've been very concerned about grocery stores and pharmacies for a while. I'm seeing how people behave there. I've seen cases contracted in that environment, so I'm glad to see them try to get people to stay home, particularly this next week, at least locally here in California.
Well, now to this. Over the last several months, a lot of people's views have changed over the severity of the coronavirus, how bad it's going to be. I know, Dr. Drew, you've been in the news a bit yourself over the last weekend, and on that front, I know you wanted to address our viewers.
Yes, I did, and I want to issue an apology. I got this wrong at the beginning. I was looking at the numbers of H1N1 and influenza, and really just comparing numbers and not looking at the ferocity of this virus. This is a ferocious virus, a highly contagious virus, and looking at the end of one epidemic and the beginning of another, those numbers do not measure much of anything. I missed that. I got it wrong. I wish I'd gotten it right, and for that, I am sorry. But I think I appreciate your confidence as we go forward. It's time for us to come together. It's time for us to get together. As you know, I've been saying that Dr. Fauci is my North Star, and that's where you should always look. I still say that. I've thankfully said that from the very beginning, and I still say so. Let us get together. This is a time for unity as we go and beat this virus. We're doing so well right now. We need to get this all the way home and hang together. Let's do it.
What do you think you've learned from this whole experience?
Well, I certainly learned about comparing numbers in situations like this. I've certainly learned to always be cautious, and that's what I was doing when I was referring to Dr. Fauci, because I knew he would get it right. I was alongside of him during the HIV epidemic, and I knew whatever he did, here's what I really knew. I knew we wouldn't see those giant numbers that were being predicted, and I felt he would get them down one way or another, and we needed to calm down about that. I've also learned you know, that the important thing in times like this is other people, and that we just think in terms of service of others as we go forward.
And speaking of that, you have offered to serve the California and New York Health Corps, trying to potentially risk your own life to try to help people with this.
Which is what I had done. You know, as you know, I sat here and filled out some of that paperwork right here. I think it's time to step up for all of us, and that's what I'm hoping to do.
Yeah. All right. Well, thank you for addressing that, and we be transparent as we move forward. Up next, this is an interesting story. A tiger tests positive for coronavirus. Are other animals, including your pets, potentially at risk on this one? And reports the NBA could return, but with a very different look. We'll have details of that. And our guest, Reverend Andy Bales from the Union Rescue Mission, Skid Row, is invited to talk more about the homeless, what's being done to protect them during this pandemic. We encourage you to join in our digital town hall happening on the Fox 11 Los Angeles Facebook page right now. With Major League Sports on hold, ESPN trying to come up with some sort of creative ways to fill all that programming. The network reportedly in talks with the NBA right now. According to ESPN.com, they're working on a televised game of horse. That's H-O-R-S-E. You know how that works? Competition would involve a bunch of big-name stars shooting from their own gyms in isolation. Would you watch this? So basically what horse is you shot this, then somebody else has to imitate that same shot, and then you try to knock each other out.
I don't get it. Would you watch that?
I would 100%
really?
watch that.
Okay,
yes,
right.
I would. And I think there's a lot of sports fans
we're that hungry for sports.
That would love it, because it'd be fun to watch those guys and see how great they really are. Speaking of a great guy, let's go to the Union Rescue Mission in downtown LA. It's really on the front lines of fighting the coronavirus, helping the homeless with food, shelter, medical supplies while facing the virus head on. We are joined now by Reverend Andy Bales. He joins us from the studios of KKLA Radio in Glendale. He's actually working with them on a big fundraiser. We're going to talk more about that in a moment. But Reverend, thank you for being back with us. We understand that one of your colleagues who drives a van for you at the Union Rescue Mission is a potential COVID-19 patient. How's he doing?
So 9 days ago, he fell ill and said he was tired and just a bit off. He went to urgent care and was turned away. Then on the next day, Saturday, he checked into the ER at USC County and was put into ICU right away, where he has been this entire time. And he's battling for his life at this moment, and we're praying for an Easter miracle.
Reverend, I wonder what your thoughts are on Governor Newsom's plan to help house homeless. It seems like he's taken some. We were talking to LA County Board of Supervisor Chairperson Barger last week, and she was saying some of this is action that we've been hoping for a long time. Do you see things changing downtown?
Absolutely. You can see the numbers dwindling on the streets, and part of that is the gangs seem to have become fearful and no longer carrying on their drug trade in the scary environment. But also some of the most at-risk people. I believe the city and the county has been picking them up. I know they came to our third floor, which after our teammate went into the hospital, we put in isolation, kind of take good care of our third floor, and we actually were able to, with the county's help, move 27 of our older men, more vulnerable men who were over 60, into their private motel rooms.
This is big news.
And also out to Dockweiler Beach, and where they're having more nursing care. And I ask also, we'll maybe learn tomorrow if the Department of Health is going to move our 60 most frail and elderly women on our first and second floor, as well as our 60 most frail and elderly men on our first and second floor. And that way there's more space in the mission, and we get the people most in need to get out of harm's way.
And what we were just looking at was some video from a few weeks ago when my colleague Bob DeCastro talked to you, and you toured the gymnasium at the mission, which has been converted as a place to deal with this issue. So, you know, we've all been afraid of this sort of widespread coronavirus outbreak on Skid Row. We're not seeing that, at least not so far, right?
Right. Our teammate was the first confirmed case of COVID-19, and I have yet to hear, there may be one, but I haven't heard of another on Skid Row, and I think it's partially that they're not folks who travel outside of the country and haven't gone to impacted places. Volunteers have been told if you have traveled to impacted countries, don't come volunteer, don't bring the virus to the folks on the streets. But I think it's also just a good job so far by the Department of Public Health and the individual missions. I know we stepped up early and gathered the resources we needed, masks and personal protective equipment and sanitizers and hand washing stations.
Reverend,
and I know
I wonder if do you think this is going to be part of an ongoing movement of taking care of people on the streets, that we are finally starting that process, breaking that logjam, and we'll continue to move in this direction even after the crisis?
Absolutely. I think that's the shining part of it, is that once we get everybody off the streets, how in the world could we return everybody on the streets? How in the world could we return people to die on the streets 3 and 4 per day, every day? I don't think there's any way possible. I think we've awakened to the fact that human beings weren't meant to live on the streets. And now that we know you can find a way in a hurry to get people into private rooms and elsewhere, I think it's going to stick.
Wouldn't that be a great silver lining from all this? Meanwhile, you are a reverend yourself. This is one of the holiest weeks of the year for multiple religions. What's Holy Week going to look like for you, and how can people participate in that?
So already we've gone to virtual chapels. Tomorrow morning I'll be speaking from 1 Peter chapter 4 and 5 in a virtual chapel. And then Good Friday, I'll be doing a Good Friday service that I was supposed to do at the YMCA, the entire YMCA of LA County. I was going to get to speak, and I'll do that Good Friday message, Good Friday morning virtually. And then Sunday morning, we're going to have an Easter sunrise, but it may just be me, perhaps our praise team as well, but I know it'll be me up on our rooftop at 6 a.m. Giving the resurrection story on our rooftop, even if I'm alone. It's a new way of doing things, but this is an unprecedented time. Never in church history have we failed to gather during Easter, no matter what is going on.
And meanwhile, also KKLA 99.5 hosting a radiothon fundraiser for the Union Rescue Mission, happening all day on Wednesday, April 8th. You can also check out urm.org for more on all those services and for a place where you can donate to the important, life-saving work that Reverend Andy Bales does every day. We thank you. You are one of the most important heroes in our community, and we are so appreciative of what you do. And a happy Easter to you.
Thank you, Alex. Happy Easter to you and Dr. Drew as well. Thank you for putting the word out and doing so much. Thank you.
Thank you. God bless you. Coming up, our segment, Ask Dr. Blue. Dr. Drew, he'll answer your questions when we come back. We might talk to Dr. Blue, too. He's a great guy. A reminder to join in our digital town hall happening right now on our Facebook page. Simply search for Fox 11 Los Angeles. We'll be right back. A tiger at the Bronx Zoo has become the first known animal in the U.S. to test positive for the coronavirus. Nadia, a 4-year-old Malayan tiger. She, along with 5 other tigers and lions, developed a dry cough. The zoo says the animals were affected by a person caring for them who was either asymptomatic or had yet to show symptoms of COVID-19. All the animals expected recovered. The Bronx Zoo has been closed to the public since March 16th. I got to admit, Dr. Drew, when I saw this headline, I thought it was Tiger Woods. You know, I saw a tiger test positive. I'm like, what?
You and your sports. Everything's in that sports.
Sports, politics, entertainment.
Yeah.
What, I mean, does this make sense? I guess this is a new way for us to think about this.
Well, it makes sense. It's actually a story we need much more information about. It's actually rather concerning to me because now we're talking about jumping into other species, and we've already obviously gotten into the human population, but if it gets into other animals as well, are they contagious? Is it dangerous for them? Can they pass it to humans? This is something that some virologist is going to have to very quickly answer.
Yeah, hopefully we can get some more information. Love to have a guest on that topic this week as well. But we want to get to our segment, Ask Dr. Drew, where you get to call in and ask Dr. Drew a question. Mara on the phone with us, calling in from Utah tonight.
Hi, Mara.
Mara, what's your question for Dr. Drew?
Yes, hi. I just want to say I'm a big fan also. I have been taking the hydroxychloroquine for a few years, and
what were you taking it for, Mara?
Well, I'm taking it for an autoimmune disorder called Sjogren's syndrome.
Okay, so Sjogren's is, Plaquenil is a medicine we've used for a long time for various autoimmune disorders. Sjogren's is dry eye, dry mouth, this kind of thing. It can sometimes be associated with lupus, even with rheumatoid arthritis, and it can be a syndrome in and of itself. People, as they age, frequently get sort of Sjogren-type syndrome, and sometimes it really responds to this medication. And I bet you want to know, are you protected against the coronavirus?
Yes, I want to know if I have an edge.
Well, you have an edge, but don't count on it, okay? So you still need to wear masks. You still need to practice social distancing. You still need to wash your hands just as wildly as all of us do. But I will tell you, although there's no formal publication on this, there have been a number of observational studies that show that lupus patients on Plaquenil have not seemed to get this virus. So you may have an edge. Certainly don't stop it. It's good for Sjogren's, and let's hope you have that edge, but don't count on that edge, okay?
Right. No, I'm doing everything, all the social distancing and the masks and all that kind of stuff, washing my hands, and I'm still doing all that.
Well, thank you, Mara, for calling in, and thank you for your loyalty to us. We appreciate it. Stay safe. If you have a question for Dr. Drew, you can email it to askdrdrew@foxtv.com. Make sure to include your phone number so you can call in. Up next, a look at a good exercise to be doing these days when we're all stuck at home. Stay with us. We're right back.
up, guys? Jameson here from the Rome community in LA with a quick quarantine-style workout that you can do from anywhere. Put your feet shoulder width apart, and you're going to hinge from the hips and do an inchworm. Down, walk it out. Nice little strength, core stability. Walk it back in. Reach for the stars. If you want to spice it up a notch, you're going to do the same thing. Come down, go out, add a push-up. Boom. Bring it back in. Come up. Now, challenge for you. Do that
thanks to my friend Jameson Bolt from Rome. We're going to try and feature a different trainer with a different workout every day this week as we're stuck at home without the gym. We all got to get creative, right?
There's a lot you can do, though. You'd be surprised. So pay attention. We'll try to give you something every day.
All right. Now we want to answer your questions. These are coming from our digital town hall on our Fox 11 Los Angeles Facebook page. Robin with this question about the pneumonia vaccination. If somebody got vaccinated or booster shots, would they be a little more protected from this virus?
No. I've been asked this question many, many times. It takes a second to develop this idea. The pneumonia vaccine is strictly for pneumococcal pneumonia. It's a particular class of bacteria, the pneumonia, that is representative of about 30% of community-acquired pneumonias in people over the age of 65. So in terms of being over 65, you want to eradicate this classic pneumonia if you can, which is why we give you two vaccines. One is the Pneumovax, the other is the Prevnar vaccine. But realize there are hundreds, maybe thousands of different causes of pneumonia. Pneumonia just means inflammation and infection of the lungs. There's different lung tissues that get involved in pneumonias. It's typically viral or bacterial, but it can be inflammatory as well. The pneumococcal vaccine is for that bacterial pneumonia. The virus we are fighting here, the coronavirus, causes a viral pneumonia.
All right, we're going to get more about all of that, more of your questions on our Fox 11 Los Angeles Facebook page right now, our digital town hall. Extra with Billy Bush on TV starts right now.
And we just want to say thank you to everyone who is here with us on News Now. If you're with us on the YouTube side with Fox 10 Phoenix, we are going to be shutting things down here for the evening. But don't worry, if you want more coronavirus news stories from across our country, it's going to continue on coronavirusnow.com. So thank you again for being here with us. We'll be back streaming up tomorrow morning at 7 a.m. Arizona time. That's Pacific time. That's 11 a.m. Eastern time. But again, you can go to coronavirusnow.com if you want more coronavirus stories from across our country. Thanks, guys, and have a great rest of your night.